9 Gaskell, on the structure and function of the nerves which innervate the vascular system, Journ. Of Physiol. January, 1886. If the various spinal nerves be cut singly from above downward, and the effects noted, and if the peripheral ends be irritated and the effects noted, and if with proper care the results be analyzed and compared, it will be found that the anatomical connections of the segments of the spinal cord with the sympathetic ganglia, which are so evident at each level, are not the ones by which physiological impulses pass out at that level. The vasoconstrictors of the head, which can be traced to the superior cervical ganglion, do not come from the upper cervical region of the cord, as might be supposed from the connections of that ganglion, but from the first three dorsal nerves. They reach the ganglion through the sympathetic cord in the neck, having traversed the inferior cervical ganglion on the way. There are vasoconstrictors in the cranial cavity which accompany the third, fifth, seventh, and 12th nerves to the eye, face, and mouth. It is still undecided whether they originate in the cord and medulla, issue in the spinal accessory nerve, and with it enter the cranium, Gaskell, or reach those nerves by way of the carotid and vertebral plexus from the inferior cervical ganglion, D'Ostrey and Murat. The vasoconstrictors of the arm, which can be traced to the inferior cervical and upper thoracic ganglia and to the thoracic sympathetic cord, are derived from the 7 upper dorsal nerves. It is true that division of the roots of the brachial plexus causes a slight dilatation of the vessels of the arm. But this is so much increased when the dorsal nerve roots are divided that it is evident that it is through them that the constrictor fibers chiefly pass. The vasoconstrictors of the leg, which can be traced into the second and third lumbar ganglia and lumbar sympathetic cord, are derived from the 5 lower dorsal and first lumbar nerves, and only join the crural and sciatic nerves after passing through the abdominal sympathetic. The thoracic viscera are probably supplied partly through the branches of the inferior cervical and thoracic ganglia, and partly through the pneumogastric, the latter statement being disputed by Gaskell. The abdominal viscera are supplied partly through the splanchnic nerves, which are made up of fibers issuing from the cord in the 5th to the 12th dorsal nerves inclusive, and partly through the pneumogastric. Thus the dorsal region of the cord is the origin of the majority of vasoconstrictor fibers in the body. The origin of the vasodilators is also to be traced to the dorsal cord. The vasodilators of the buccofacial region come from the 2nd to the 5th dorsal nerves, whence they pass to the first thoracic ganglion, and thence by the annulus of Vuissens into the cervical sympathetic cord. Those of the eye, head, and ear come from the same ganglion, but have their spinal origin in the 8th cervical and 1st dorsal nerves. Those of the arm are traced into the upper thoracic sympathetic cord, which they reach from the 5 upper dorsal and last cervical nerves. Those of the leg are traced to the 1st and 2nd lumbar ganglia and the lumbar sympathetic cord, which they reach from all the dorsal nerves from the 6th downward. Gaskell holds, however, that the vasodilators of the extremities pass out of the cord in the cervical and lumbar plexuses and accompany the cerebrospinal nerves. The vasodilators of the thorax and abdomen are supposed to pass in the pulmonary plexus and splanchnic nerves, but this is not yet fully determined. Gaskell 10 believes that vasomotor nerves can be distinguished from motor and sensory nerves in the spinal nerve roots by the smallness of their caliber. He finds such fine fibers only in the spinal nerve roots between the 2nd dorsal and 2nd lumbar segments of the cord, in the dog, and in the 3 upper roots of the spinal accessory nerve. According to his account, the vasoconstrictors issue from the spinal cord in both anterior and posterior nerve roots as metallated fibers, and pass to the sympathetic ganglia lying on the vertebrae, proximal or lateral ganglia. There they lose their metallary sheath, and either end in cells whence new fibers issue, or more probably pass directly onward as non-metallated fibers, having a connection with the unipolar cells of the ganglia only for purposes of nutrition. The number of fibers issuing from any one ganglion is much greater than the number entering it from the cord, hence it is supposed that each metallated fiber splits up into a group of non-metallated fibers. Which is possible, as the researches of Ranvier have shown that each axis cylinder is made up of numerous fibrils. Leaving these ganglia, the nerves pass either to the 2nd series of ganglia, distal or collateral ganglia, whence they issue in plexuses to enter the vessels, or to the vessels directly, where they divide in plexuses. It is in the meshes of the plexus that the local ganglia of the vessel walls are found. The vasodilators are thought to differ from the vasoconstrictors in passing directly to the distal ganglia as metallated fibers, not being connected in any way with the proximal ganglia. Gaskell makes no statement regarding their limits of origin from the cord, except to state that the nervi erigentes issue with the sacral nerves. He agrees with the view that the vasodilators act as inhibitory nerves upon the local ganglia. 10 Journal of Physiology, January, 1886. Vasomotor reflexes. Thus far, reference has been made only to fibers whose direction of transmission is centrifugal, and whose exit from the spinal cord is by the anterior nerve roots. There are other fibers, however, through which centripetal impulses pass, and these enter the spinal cord with the posterior nerve roots. The function of these fibers is to transmit sensory impulses inward to reflex centers, and thus set in action motor mechanisms of a vasoconstrictor or dilator kind whose effects are produced at the periphery. There are, therefore, vasomotor reflexes, as well as skin and tendon reflexes, whose centers are in the spinal cord. These reflex acts may be excited by impulses reaching the center not only through the vasomotor centripetal nerves, but also through the sensory nerves of the cerebrospinal system. The effect of changes of temperature on the circulation in the skin: if the right hand be plunged in cold water there is a fall of temperature in the left hand, the effect of pain upon the color of the face and the size of the pupil. The red cheek on the affected side in pneumonia, the occurrence of glycosuria during sciatica, are all instances of such reflex acts. Many vasomotor affections are produced by irritation causing reflex effects at a distance from the seat of irritation, a fact always to be kept in mind. The utility of counterirritation to the surface in diseases of the internal organs is explained by supposing that vascular changes are produced in those organs through reflex mechanisms set in action by the local irritation. While some of these reflexes may have their central mechanism in the local ganglia, it is probable that the majority are to be traced to the spinal cord. It is believed that the sympathetic ganglia are not the seat of reflex centers. Figure 57. Diagram to represent the mode of action of counterirritants applied to the chest, Lauder-Brunton. The irritation of the afferent nerves by the blister on the chest wall gives rise to a vasoconstrictor reflex in the vessels of the lung. Since the vasomotor nerves are connected almost exclusively with the dorsal portion of the spinal cord, it is very natural to conclude that the vasomotor reflex centers are situated in this region. And the hypothesis has been advanced by Jakubowicz, and strongly urged by Gaskell 11 that the cells of the vesicular columns of Clark, which are peculiar to this region, are the seat of these reflex mechanisms. This hypothesis gains some support from the pathology of syringomyelia. In this disease the gray matter surrounding the central canal and the vesicular columns are destroyed. The characteristic symptoms are vasomotor and trophic disturbances, consisting of changes in the vascular tone, changes of local temperature, and various eruptions, in some cases going on to ulceration in the skin and mucous membranes. It is, however, undecided whether the vasomotor centers of the cord are limited to the columns of Clark, or are situated in the gray matter surrounding the central canal, since both these parts are destroyed in this disease. 12. That they are not located in the anterior or posterior gray cornua is determined by the fact that diseases limited exclusively to these areas do not cause vasomotor disturbances. The situation of the various reflex centers for the various parts of the body is at different levels of the cord, as has been determined by the experiments already cited to establish the level of origin of the vasomotor nerves. The exact location of the vasoconstrictor and vasodilator reflex centers for definite parts is yet to be ascertained. 11 Locke, CIT. 12 C. Firstner, Arch für Psych, 14. 422. Vasomotor tracts. These reflex centers are connected with the medulla by tracts which lie in the lateral columns of the spinal cord, 13, although it is not determined in which part of these columns. It is not possible as yet to separate the constrictors from the dilators in this tract, nor to determine whether it transmits impulses in both directions or only from above downward. Nor is the course of associating fibers between reflex centers at different levels known. In cases of transverse myelitis, the control of the medulla is removed from the vascular centers below the lesion, and the lack of vascular tone seen in the paralyzed limbs, together with the susceptibility to local irritation, is the result of this division of the vasomotor tracts. 13. Ausjanico and Skiriju, Bull. De L. Academic. De St. Petersburg, 18. Medullary centers. It has been stated already that a general vasomotor center with both constrictor and dilator powers is situated in the medulla. This lies in two divisions on each side of the middle line, in or just beneath the floor of the fourth ventricle, from the calamus scriptorius up to the level of the sixth nerve nucleus. Each division governs the vascular tone of its own side of the body. 14 And lesions in its region in man produce unilateral vasomotor symptoms. 15 This center can be excited to reflex action by strong irritation locally or through the blood, in which case a general constriction or dilatation of the vessels of the entire body will ensue. It seems probable, however, that the general center in the medulla is made up of a number of special centers, each of which governs a definite set of organs. The vascular tone of the thoracic and abdominal viscera is certainly regulated by a series of such centers. Brown Sequard and Schiff have produced hemorrhages in the lungs, pleura, stomach, intestines, and kidneys at different times by destructive lesions of the medulla, and the well-known experiments of Bernard, in which by puncture of the medulla local hyperemia of the liver or kidneys was caused, producing glycosuria or polyuria, confirm this view. Lesions of these parts in man produce similar effects. Charcot has shown that in cerebral hemorrhage ecchymoses may be found in the stomach, pleura, and endocardium, and that pneumonia is especially frequent upon the paralyzed side. De Jonge 16 has been able to collect 13 cases of diabetes mellitus in which a lesion of the medulla, hemorrhage or tumor, was found after death, and Flatten 17 has proven the existence of similar lesions in diabetes insipidus. The connection of these centers with the liver and kidneys has been traced elsewhere. 18 The medulla contains a special center for the vasomotor nerves of the abdomen, which are in the domain of the splanchnic nerves. This center is excited reflexly by impulses reaching it through the depressor nerve of Sion from the heart, so that when that organ is overburdened it may be relieved by a fall of arterial pressure produced by dilatation of the abdominal vessels. Whether the connection of the medulla with the centers in the semilunar ganglion which preside directly over these vessels is made by way of the spinal cord or by way of the pneumogastric nerve is still undetermined, though the researches of Gaskell favor the former view. Gastric and intestinal disturbances are certainly produced by nervous lesions in the medulla, but whether they are due to vascular changes is uncertain. The vomiting of mucus and blood, and the large watery evacuations which accompany mental shock or anxiety, as well as the polyuria associated with mental effort, have been ascribed to irritation of local centers in the medulla governing the gastrointestinal and urinary organs by impulses received from the cortex above. The spleen is under the control of vasomotor centers, since section of the splenic branches of the semilunar ganglia will produce a great enlargement of the organ, and irritation of the cut end of these branches will produce contraction. 19 The medulla also contains a vasodilator center for the erectile tissues of the genital organs, irritation of which by mental action or local disease causes impulses to pass to the nervi erigentes by way of the spinal cord, resulting in a flow of blood to the parts. Although a center has been thought to exist controlling the circulation in the lungs, whose paralysis has been supposed to explain the occurrence of sudden pulmonary edema without other known cause, no definite facts regarding it are known. That the action of the heart is under the control of the medulla is a fact too well known to require more than a mention. The physiology of the nervous control of the heart cannot be discussed here. 14 Ausjanico, Arbeiten AUSD Physial, in Stit. Zoo. Leipzig, 1871. 15 M. Starr, Sensory Tract in Central Nervous System. Journ. Nerve. And Ment. Dis, July, 1884, pages 396 to 398. 16 Arch F. Psych. 13. 17 Ibid. 18 C. Tyson, Diabetes Mellitus, Pepper's System of Medicine, Volume 1. Eads, Diabetes Insipidus, Ibid, Volume 4. 19 Tarchanoff, Pfluger's Arch. 8. Ross. Diseases of the Nervous System, Volume 1. While these medullary centers are certainly influenced by impulses reaching them from the cerebral hemispheres, as is evident from the vasomotor symptoms produced by mental action, e.g. pallor from fright, blushing, etc., it is impossible to state in what portion of the hemispheres in man the higher vasomotor centers lie. Eulenberg and Landois locate them in the motor area in animals. 20 They are certainly beyond control of the will, and are wholly reflex in their action, a purely mental act in this case being the excitant of a purely physical result. Point 21. 20 Arch F. Path. Anat, B.D., 68. 21 In addition to the articles already cited, the reader is referred to Landois's Physiology, to Duval's article Vasomoteurs, in the Dictionnaire de Médecine et de Chirurgie. Volume 38. 1885, for a summary of vasomotor physiology, and to Gerhardt's Über Angioneuresen, Volkmann's Sammlung Klin. Vorträge, No. 209. Gaskell's researches, published in the Journal of Physiology, are the most recent and satisfactory. Pathogenesis. From this review of the physiology of the vasomotor system it becomes evident that disturbances of vascular tone may be produced by many different causes acting upon many various parts. They may be due to local affections of the part in which the symptoms are present, as in the case of erythema 22 after burns or frostbite, or congestion of any organ after injury. They may be due to affections of the vasomotor nerves passing to the part affected, as in the case of vascular changes due to peripheral nerve lesions. 23 They may be due to affections of the sympathetic ganglia connected with the part affected, as in the case of migraine. 24 Sudden flushing of one ear, certain cases of polyuria. 25 and Bastow's disease. 26 They may be due to lesions in the spinal cord affecting the vasomotor centers. 27 Or compressing the nerve roots on their way to and from the sympathetic ganglia. 28 As is the case in the various forms of myelitis and in Raynaud's disease or symmetrical gangrene, and in meningitis, tumors of the cord, or Pott's disease. They may also be caused by such conditions in the cord as cut off the vasomotor centers from the medullary centers, such as transverse myelitis from compression or traumatism. 29 They may be due to lesions of the medulla oblongata. 30 As is seen in some cases of polyuria and glycosuria. 31 And in cases of universal erythema. 32 Following acute fevers. They may be due to diseases of the cerebral hemispheres, as is evident from the vasomotor symptoms occurring in hemiplegia and hysteria. Finally, they may be of a reflex origin, dependent upon some obscure source of irritation in a part quite distant from the region in which the symptoms appear. Point 33. 22 Volume 4. 23 Volume 5 Neuritis. 24 Volume 5 Migraine. 25 Volume 4 Polyuria. 26 Volume 3. 27 Volume 5 Syringomyelitis. 28 Volume 5 Meningitis spinalis. 29 Volume 5 Transverse myelitis. 30 Volume 5 Medulla. 31 Volume 1 Diabetes mellitus. 32 Volume 4. 33 Volume 5. The diagnosis of the seat of the lesion in many cases of vasomotor neurosis may be made if the organ or the exact limitation of the area affected be ascertained, and the history of the case, together with the concurrent symptoms of other kinds, be considered. In some cases no organic cause can be found, and in these a reflex cause should be diligently searched for. Symptoms. A vasomotor affection may manifest itself either by a spasm or a paralysis of the vessels. In angiospasm the part affected becomes pale, and irritation no longer causes a vasomotor reflex. It looks shrunken, and if the skin over it is loose it may be thrown into folds or shriveled, presenting the appearance seen in the hands after long immersion in hot water. The lack of blood in the part arrests the processes of metabolism which are normally constant, and if the condition continues this may result in such a disturbance of nutrition that ulceration, or even gangrene, may ensue. The local anemia, combined with the cessation of metabolism, produces a fall of temperature in the affected part, which is then more easily affected by the temperature of the air than in a normal state. So that exposure to cold is very liable to cause freezing. These conditions necessarily produce an impairment of function, so that if the affection is located in the extremities, as the fingers, they are soon rendered useless. The term digiti mortui has been applied to this state. In the surface of the body angiospasm causes cutis anserina, pallor, numbness, tingling, slight anesthesia, and analgesia. If it occurs in a limb, the finer motions are imperfectly performed, and in time the nutrition of the muscles may be so impaired as to produce atrophy and paresis. It may even lead to gangrene. Notnagel has recorded 34 cases of sciatica in which the pain produced a reflex spasm of the vessels of the leg, which, persisting, resulted in partial paralysis, atrophy, lowering of temperature, pallor, and sensory disturbances. Ross mentions 35 the sudden appearance of circumscribed patches on the hands and forearms of washerwomen, in which there is a pallor, coldness, and partial anesthesia. These may be limited to the distribution of a single nerve, and may be accompanied by trophic affections. 34 Arch F. Psych. v. 35 Volume 1. Spasm of the veins may occur as well as of the arteries, 36 or independently of them. In the latter case the blood will not pass out of the capillaries. The part will then be blue, swollen, edematous, and painful. The temperature will be lowered by increased radiation of heat, and all the sensations and functions be impaired in greater or less degree. If this continues, nutrition may suffer, and in the end gangrene develop, which will take its course and lead to the throwing off of the part. Granger Stewart has described such a condition occurring in both hands and feet. 37 It may be likened to a severe form of Raynaud's disease. 36 Weiss, Symmetrische Gangrene, Wiener Klinik, 1882. 37 Granger Stewart, An Introduction to the Study of Nervous Diseases. Angioparalysis is more frequent than angiospasm, and may be due either to paralysis of the vasoconstrictors or to excitement of the vasodilators. It shows itself by a bright red or mottled appearance of the skin, an increase of local temperature, and more rapid processes of nutrition, together with an increase of secretion if the part is a gland or a mucous membrane. And an increase of sweat if it is the skin. In the latter case an increased sensitiveness to changes of temperature, a subjective sensation of heat, and hyperesthesia and hyperalgesia may occur. The hyperesthesia on the paralyzed side which is present in hemiparaplegia spinalis is ascribed to the vasomotor paralysis. But these symptoms soon give place to others. The dilatation of the vessels, which at first caused an increased flow of blood to the part, produces a slowing of the blood current in the part, just as a river runs less rapidly where it becomes wider. The slowing of the current in the skin allows of a more complete cooling of the part as the radiation of heat and the evaporation of moisture are increased, and the slowness of the renewal of blood impairs the processes of nutrition. So that to the first stage of redness, heat, and increased metabolism there ensues a stage of blueness, cold, and defective nutrition, and the function of the part may be impaired. In this stage it usually presents a mottled appearance, and may be slightly swollen and edematous, and the continued increase of perspiration gives it a clammy coldness to the touch. In all of these conditions severe pain, sometimes of a burning character, is a very distressing symptom, causalgia. These conditions are seen in peripheral nerve lesions, and give rise to the appearances which have been so admirably described by Mitchell. 38. 38 Injuries of nerves. A peculiar combination of symptoms may be mentioned here, to which Mitchell has given the name of erythromelalgia. 39 This disease begins with tenderness and pain in the soles of the feet, which are soon followed by a marked distension of the capillary vessels. The congestion is attended by a sensation of burning pain similar to that produced by a blister. The surface is at first of a dull dusky red color, later it appears purple. The redness is not uniformly distributed over the sole, but occurs in patches of irregular shape, being especially frequent over prominent parts exposed to pressure and friction, and the attacks seem to be brought on by long standing or walking. At first there is a rise of temperature in the affected surface, the arteries pulsate visibly, the veins are swollen, and there may be some edema. Later, the foot is cold and pale. Sensations of touch and temperature are normal, but the part is so extremely tender that walking is impossible. There is no paralysis. One or both feet may be affected, but the patches of redness are rarely symmetrical. The hands are occasionally affected. The condition may occur in paroxysms or may remain for some time. It resists all known methods of treatment, although applications of cold relieve the burning pain to some extent and the tenderness enforces rest. 39 America Journ. Of the Med. Sci. July, 1878. With angioparalysis may be classed the taches cerebrals of Trousseau, no longer considered diagnostic of meningitis, but denoting a weakened condition of vasoconstrictor action in the local ganglia of the vessel wall, which may occur upon local irritation of the skin in any severe disease affecting the nutrition of the general nervous system. Actual rupture of the capillaries in the course of vasomotor diseases is rarely observed, although the stigmata appearing in hysterical and cataleptic patients may be ascribed to this cause. In this connection tabetic ecchymoses may be mentioned, which appear suddenly without local injury, and resemble an ordinary bruise, running a similar course. They occur only in the course of locomotor ataxia. 40. 40 Strauss, Arch. The Neurology, Tome I. In addition to these forms of vasomotor affections, there is a condition of instability of vascular tone which manifests itself by sudden transient changes in the circulation of various organs. This is a functional affection, usually due to malnutrition. It is seen in many cases of neurasthenia and hysteria, and manifests itself by sudden flushes or pallor, alternations of heat and cold, local sweating, attacks of mental confusion. An inability to use any organ continuously from disturbance of the power of the vasodilators to maintain a condition of functional hyperemia. 41 Little is actually known about the causes of this state of the vascular system, although much has been written about it. For a fuller description, the article on neurasthenia may be consulted. 41 Angel, Arch for Psychiatry, 15. 618. Many functional derangements of the internal viscera have been ascribed to such vasomotor instability with more or less probability. 42 But hypothesis of this kind, however plausible, is evidently beyond confirmation. It is especially in affections of this kind that causes of reflex irritation are to be carefully sought. Cutaneous angioneuroses, such as have just been described, may affect any part of the body. They usually appear suddenly, producing much discomfort and an impairment of function in the part if it is an extremity. They disappear as rapidly as they come. The duration of such attacks varies from a few minutes to several days. They are very liable to recur. If it is the vessels under the control of the cervical sympathetic which are affected, the symptoms will be those of migraine or of lesion of the ganglia. 43 If it is the vessels in the extremities which are involved, the condition of digiti mortui or erythromelalgia or symmetrical gangrene. 44 may be produced. 42 Fox, the influence of the sympathetic system in disease, London, 1885. 43 C. 44 C. A singular epidemic occurred in France in 1828 and 1830 which was termed acrodynia. Many persons were suddenly seized with vomiting and purging, and soon after the onset the extremities became red or mottled in blotches, swollen and edematous, and hot, painful, and tender. The attacks lasted from a few days to 2 months, and during this time the skin became thick and hard, the muscles weak and subject to spasms, and the general health was impaired. Relapses occurred in many cases, but all finally recovered, and hence the exact nature of the disease was not ascertained. Course. In any case of vasomotor neurosis, the course of the disease and its termination will depend chiefly upon its cause. If the cause is some permanent lesion of the nervous system, the condition will remain, and in this case the termination will depend upon the severity of the symptoms. Angiospasm may be so severe as to lead to gangrene on the separation of the part affected, or may be so slight as to cause only subjective discomfort and a little pallor. Angioparalysis may lead to an extreme degree of congestion, which is attended by heat and pain at first, later by paresthesia and coolness, with increased liability of the part to be affected by changes in the surrounding air. This stage is succeeded by one of less marked dilatation of the vessels and a spontaneous partial recovery, although the more moderate symptoms may continue indefinitely and seriously impair the function of the part. If the cause is a temporary derangement of function in the vascular mechanism, is reflex irritation which can be removed, or is a curable organic disease, the symptoms will subside rapidly or gradually and perfect recovery may follow. If the condition is one of irritability in the vasomotor centers, producing alternations of flashing or pallor, such as is observed in nervous exhaustion, it may recur irregularly for a considerable length of time until the causative condition can be removed. Prognosis. The prognosis must be determined in each case by a consideration of the cause of the affection, of the nature of the symptoms, of the severity of the disease, and of the possibility of success in both symptomatic and causative treatment. In the angioparalytic cases, an eventual spontaneous relief from much of the discomfort may be promised, although the duration of the symptoms cannot be predicted. Treatment. Treatment must be directed primarily to removing or diminishing the severity of the cause. A review of the section on pathogenesis will indicate how wide a field this may include, and the reader must be referred to the special articles which are alluded to in that place for therapeutic measures. Special diligence is to be shown in searching for a source of reflex irritation. When the cause cannot be reached, and when the symptoms are of such severity as to demand immediate attention, treatment may be directed to them. In all conditions of vasomotor disease, it is important to shield the part from external injury, for if the vessels are dilated they are liable to rupture, and any abrasion of the surface may produce serious inflammation and ulceration. And if the vessels are contracted, any injury will be repaired slowly and imperfectly on account of the anemia, and may even hasten the approach of gangrene. Perfect rest, bandaging with cotton, and even the application of a light splint to the extremities will be advisable in cases of angiospasm. It is desirable to retain the animal heat, inasmuch as its supply is deficient. In angioparalysis, rest in a somewhat elevated position and applications of mild evaporating lotions are indicated in the early stage. Later, the limb may be bandaged. It is not advisable to attempt by tight bandaging to counteract the effect of the vascular paralysis, for the nutrition of the limb is liable to suffer and gangrene may be induced. Massage of a part affected with vasomotor symptoms is of great service, since the circulation can be increased in the veins, and thus indirectly in the capillaries, and the nutrition of the part can thus be favored. It is more efficacious in angioparalysis than in angiospasm. Too rough rubbing is of course to be avoided, lest the skin be injured. All counter-irritation is to be strictly forbidden. Electricity has been used with varying results. According to Erb, 45 moderate ferratic applications contract the vessels, strong ferratic applications, especially with the brush, dilate the vessels. The galvanic current at first contracts the vessels, but this is followed by a secondary dilatation, which will be greater and occur more rapidly the stronger the current used. 46 Cathetal closures contract the vessels. The anodal continuous current dilates them widely. Stable continuous currents through a nerve dilate the vessels which the nerve supplies. Inasmuch as vasoconstrictors and vasodilators pass together in many nerves, and are found together in all parts, it is impossible to apply electricity to either alone. In those cases, therefore, in which it has been ascertained which set of vasomotors is affected, it is not always possible to produce a direct effect upon that set by electrical treatment. Erb recommends, in conditions of vasomotor spasm, a trial of the galvanic current, the cathode on an indifferent point, the anode being applied over the vasomotor centers governing the part, and also over the area of the body which is affected. and held there while a moderate continuous current is passing, interruptions being avoided. Or, the cathode being placed on the neck, the anode may be applied to the nerves passing to the affected part. Or a strong continuous current may be sent through the nerve, its direction being changed several times during a moderately long application. Finally, the faradic brush applied to the part or a strong faradic current sent through its nerve may relax the spasm. In any case, all these methods should be tried before electrical treatment is abandoned. 45 Electrotherapy, 562. 46 To this statement Lauder-Brunton. Assents, Pharmacology. In vasomotor paralysis other methods are used. The cathode is placed on the part congested, and a weak galvanic current is employed with frequent interruptions or even with changes of the pole, or the cathode may be moved about upon the reddened skin while a mild continuous current is passing. A very weak faradic current with wet electrodes, or even a weak faradic current applied with a brush, may be of service. Here, again, various methods may be tried. If the extremities are affected, it may be well to immerse them in a basin of water which is connected with one pole of the battery, and the current directed in the manner just described, according to the case. It must be confessed that no definite results can be predicted from the use of electricity in these cases, and much more experience is needed before definite rules can be laid down. The records show that in apparently similar cases opposite methods of application have produced favorable effects, while in other cases all methods have failed. Too much reliance should not be placed in electrical treatment. Erythromelalgia is an obstinate affection, and symptomatic treatment, directed chiefly to quieting the pain by opium and allaying the sensation of burning by cool baths, must be resorted to. Internal remedies may be tried appropriate to the condition present. In angiospasm nitrite of amyl inhaled, or nitroglycerin 1/100 GRT, I.D., may give considerable relief, although both of these drugs are to be used with caution. Chloral hydrate is also of some service, and where the patient is in pain and suffers from insomnia this may fulfill several indications. In angioparalysis ergot has been used with advantage. Oxygen inhalations are of service. Chloride of potassium may also be tried. It is evident, however, that such remedies, acting as they do upon the general arterial system, are not to be depended upon in the treatment of local conditions, since they have no selective action upon the affected part. The majority of the drugs known as sedatives and antispasmodics have been used in these conditions, but the records of individual cases show that they are not of much avail. Theoretical therapeutic measures based upon experimentation on animals have been fully discussed by Lauder-Brunton, 47, but practical experience has not yet been sufficiently extensive to warrant any further statements. 47 Pharmacology, Therapeutics, and Materia Medica, pages 229 to 360, Leah Brothers, 1886. Symmetrical gangrene. Synonyms. Local asphyxia, asphyxie locale, Raynaud's disease, symmetrisch gangrene. Definition. Symmetrical gangrene is an affection of the nervous system characterized by arterial or venous spasm appearing in symmetrical parts of the body, especially in the phalanges of all the extremities, which may result in trophic changes or in gangrene. There are various stages in the disease, which have given rise to the various names by which it is known. The stage of local syncope, in which there occurs a moderate contraction of the arterioles and consequent pallor of the part, may be followed by a stage of local asphyxia, in which the complete contraction of the arterioles cuts off entirely the supply of arterial blood, and the regurgitation of venous blood produces cyanosis of the part. And this, if continued, may result in the gangrene of the part, which is then thrown off. Instead of a condition of local asphyxia, there may be a spasm of the smaller veins, resulting in a local erythema, which may go on to capillary stasis and then to gangrene. The spasm of the vessels may cease at any stage as suddenly as it began. And if this occurs in the first or second stage, no gangrene results. History. While isolated cases of this affection had been recorded as curiosities during the past 2 centuries, 48 the disease was first studied with care by Raynaud in his Thèses de Paris in 1862. He collected 28 cases which had been described with accuracy or had been personally observed in the hospitals of Paris. And after a thorough analysis of the symptoms defined the disease as a neurosis characterized by an exaggeration of the excitomotor power of the cord presiding over the vasomotor nerves. He called particular attention to the condition of spasm in the vessels, and proposed the name asphyxie locale to designate the peculiar appearance of the parts affected. He also noticed the resulting gangrene as a new variety of gangrene, not dependent upon embolism or upon changes of an atheromatous nature in the coats of the vessels. 48 Schrader, 1629, Hirschus, 1685, Bouquet, 1808, Moulin. 1830. Rackel, 1859, cited in full by Weiss, symmetrische Gangrene. Wiener Klinik, 1882. The condition was at once recognized by others, and several cases had been reported prior to 1873, when Raynaud published a more complete article on the subject in the Dictionnaire de médecine et de chirurgie under the title Gangrene symétrique. In 1874 he recorded 5 new cases in the Archives Générales de Médecine, Volume 1, pages 5 and 189. The disease, having been thus established as a definite nervous affection, began to be noticed in other countries than France. And Billroth in Vienna 49 were Mitchell 50 Mills 51A, MCL, Hamilton 52 and J. C. Warren 53 in this country, and many other careful observers, published cases, together with more or less complete articles upon the disease. In 1882, Weiss produced a monograph 54 upon the subject containing references to all the cases which had appeared, and this is still the most complete article to be found, although the essay of R. Lauer 55 and the discussion of the disease by the Berlin Medical Society 56 as well as the short articles of Schultz 57 and Lutz 58 deserve mention, for they contain additional observations of cases and numerous facts not to be found elsewhere. 49 Wiener Med, Wochensch, 1878, number 23. 50 America Journ. Of the Med, Sci, 1878, July. 51 Ibid, 1878, October. 52 N.Y. Med, Journ, 1874, October. 53 Boston SURG and Med, Journ, 1879, number 3. 54 Weiss, Wiener Klinik, 1882, Symmetrische Gangrene. Also Zeitschrift für Prack. Heilkunde, 1882. 55 Inog. Dessert, Strasbourg, 1884. 56 Zeitschrift für Klin. Med, 6. 1883. 57 Deuteronomy Arch F. Klin. Med, 35. 183, 1884. 58 Baer. Arstentel. Blatt, 1884, 31. 24. Symptoms. The disease begins suddenly in all cases, and the constitutional symptoms are less prominent than the local ones. In some cases there are noticed a certain degree of mental disturbance, a condition of depression with a tendency to sigh and cry without cause, disturbed sleep with unpleasant dreams, irritability, and headache. A loss of appetite and disorders of digestion may follow, and then the local symptoms appear. In other cases, which seem to be the majority, the local condition develops without any such premonitory disturbances of the nervous and digestive systems, although these may ensue. The local symptoms first noticed may be paresthesia or pain in all the extremities, usually limited to the tips of the fingers and the toes. These are continuous and severe, and are immediately followed, and occasionally preceded, by an appearance of ischemia or of cyanosis or of erythema, in the order of frequency named. 1. The fingers may look pale and dead, presenting the appearance of the so-called digiti mortui, and may be cold, painful, and anesthetic. If this condition is moderate in degree, a certain amount of blood will continue to flow through the contracted arterioles, and then it corresponds to the description given by Raynaud of syncope locale. If it is extreme, the part may be wholly deprived of arterial blood, and then a true local asphyxia is present. In this stage the patients usually suffer considerably, although some do not complain of pain until the next stage. The ischemia is attended with an impairment of sensation to touch, temperature, and pain, and finer motions become clumsy on account of the subjective numbness and actual anesthesia. At the same time, the fingers look shrunken, the skin being thrown into folds, as if the hand had been soaked in hot water, or they may appear as if frozen, the skin being hard and immovable. 59. The secretion of perspiration may be increased, and the fingers feel damp as well as cold, or it may be suspended. The local temperature is lowered. If the part is cut, little or no blood will flow. At this stage the arterial spasm may suddenly relax and the part return gradually to its normal condition, the cessation of the constriction of the arteries and the return of blood being usually accompanied by burning pain, which may last for some hours. The duration of such an attack may vary from a few moments to several days. If it continues longer, this stage is usually succeeded by the second stage, of cyanosis. 59. Finlayson, Medical Chronicle, 1885, number 4. 2. The stage of cyanosis results from one of two conditions: either the arterial spasm is so complete that no blood passes into the part, in which case venous blood from lack of vis a tergo or in response to gravitation regurgitates into the capillaries, distending them and producing a state of blueness. Or a venous spasm occurs, preventing the exit of blood from the part, which then becomes actively congested, and the blood in the capillaries, from want of renewal, soon becomes venous and produces the cyanotic appearance. The stage of ischemia may be so short that it is hardly noticed, so that the patient's attention is first attracted by the swollen, blue, and extremely painful condition. The skin may be stretched, the tissue infiltrated with products of exudation, which can be pressed out, as can also the venous blood, and the surface may itch as well as be painful. Anesthesia is rarely present in this stage, and there may even be hyperesthesia. The part is cool from the increased radiation of heat and cessation of the processes of metabolism, the local temperature being lowered. The small vessels on the surface will be visibly injected, and capillary ecchymoses may rarely be seen. There is less liability to difficulty in movement in this stage than in the former one, as the sensations of the part are not benumbed, but if present it is due to the swelling. This condition, like that in the former stage, may cease suddenly, the recovery of the normal appearance being, as a rule, slower than after a simple ischemia. The duration of this stage has varied from a few seconds to several days. It is usually followed by gangrene. 3. The condition of local erythema is described here because it may lead to gangrene, and has therefore been considered by Weiss as one of the early stages of the disease. As a rule, however, it is not followed by the death of the part, and the affection in these cases is probably one of erythromelalgia rather than of symmetrical gangrene. Like the stage of ischemia, the stage of erythema may appear suddenly. The part presents a bright red or a mottled appearance, is hot and swollen, and painful. The vessels are visibly injected, the local temperature is raised, the secretion of sweat may or may not be increased, and the patient feels a burning sensation rather than pain. Hyperesthesia to touch and temperature and pain is usually present, or the sensations are normal. The blood can be pressed out, but returns immediately. In this condition of hyperemia slight injuries lead frequently to an inflammatory process, ulcers may form in the pulps of the fingers or around the nails, and the eschars may appear dark and even gangrenous. Or an actual condition of gangrene may appear in the tips of the fingers, the exact method of its occurrence being a matter of dispute. The erythematous condition is much more likely to be permanent than are the other stages of the disease, another fact which has led to some hesitation in considering it a true stage. This condition of erythema may be due to a paralysis of the vasoconstrictors, the converse of the spasm occurring in ischemia. It has also been ascribed to an irritation of the vasodilators, and this appears to be the more probable hypothesis. 4. The stage of gangrene is always preceded by that of cyanosis, and the death of the tissue is due to the arrest of nutrition consequent upon a stasis of the blood. It is not necessary to invoke the injury of trophic nerves to explain its appearance. In the tips of the cyanotic fingers, on their palmar surface, beneath the epidermis, a small blister appears, filled with a dark serous fluid or with pus or blood. This soon ruptures, and a dark dry scab forms, beneath which an ulceration may go on destroying the corium, but not penetrating deeper. In the majority of cases the gangrene is limited to a small area of the pulps of the fingers, and only involves the superficial layers of the corium. The gangrenous spot is surrounded by a purple margin. When the sphacilis has separated, a scar remains which is frequently insensitive. In other cases, when the sphacilis is thrown off, it leaves a deep ulcer, which may look as if the lost tissue had been cut out with a punch, and this gradually granulates and heals. In still other cases, the entire skin of the terminal phalanx may become black and dry, presenting a true gangrenous appearance. Then a line of demarcation is formed, usually at the junction of the terminal with the middle phalanx. Separation of the gangrenous part occurs, and a stump is left covered with thin, glossy skin. This extensive gangrene, involving an entire phalanx, is the exception rather than the rule. While the gangrenous process is in progress in the tip of the finger, the nails cease to grow, and may become bulbous and rigid, the epidermis elsewhere may become dry and desquamate, and ulceration around the root of the nail may take place. With the completion of the stage of gangrene, which may last from 1 to 5 weeks according to its extent, the local symptoms terminate. It is the symmetrical distribution of the local symptoms just enumerated which is the peculiar characteristic of the disease. The fingers of both hands, the toes of both feet, symmetrically situated spots upon the back, trunk, thighs, legs, forearms, and arms, in the order of frequency named, are affected either singly or in combination. In the majority of cases fingers and toes are affected together, and a few spots are seen on the trunk. In many cases the toes escape. In a large number of cases the face has been affected, spots of cyanosis appearing on the nose or ears or lips. As a rule, the stage of gangrene only ensues in the tips of the extremities, but a few cases are recorded in which little areas of skin elsewhere have passed through all the stages of the disease. Pigmentation occurs in spots upon the body when the process does not go on to gangrene. Among the rare symptoms which have occurred in some cases are great impairment of temperature, pain, and electric sensations in the affected extremities. Swelling, pain, redness about, and effusion into, the joints, considerable loss of motion in the muscles of the hands and feet, with diminution of electric excitability, but no qualitative change. And oculopupillary changes ascribed to an irritation of the cervical sympathetic fibers at their origin in the spinal cord. In addition to the constitutional symptoms mentioned, which may usher in the disease and may continue during its course, there have been observed temporary albuminuria, glycosuria, and hematuria. Fever never occurs as a symptom of the disease, and if present must be ascribed to some other condition. The special senses have been affected in a few cases. In one case a spastic contraction of the retinal arteries alternated with attacks of ischemia in the extremities. 60. The intellect is usually unaffected, but Weiss observed a case in which transient aphasia occurred, which he attributes to local spasm in the arteries of the cortex. The patient could find words only after long thought, and spoke slowly and with difficulty. 60. Raynaud, Archkin. De Med, 1874. Galazowski. Examined the discs. Course and duration. The onset of the disease is sudden. The symptoms in the first 2 stages may last only for a few minutes and pass off, or the disease may pass through all the stages and terminate in gangrene. It is usual for the first stage of ischemia to last several days, varying in severity. For the second stage to last several days, and for the stage of gangrene to occupy about 3 weeks. The shortest duration of a single attack has been 10 days, the longest 5 months. If the gangrene begins simultaneously in all the fingers, the duration will be shorter than if it proceeds to one after another. In 1/3 of the cases a recurrence of the disease within a year of the first attack has been observed, and it is probable that the proportion would have been larger had all the patients been kept under observation. In some cases 3 and 4 attacks have succeeded each other with some rapidity, some of the attacks being much less severe and shorter than others. In some cases the condition of gangrene has developed only in 1 out of 3 attacks. When the condition is one of local erythema, the duration may be indefinite, the state becoming chronic and lasting for several years. Nature. The nature of the disease is a matter of deduction from the study of the symptoms, no autopsies having as yet been made. As already stated, the symptoms are explained on the theory of a vasoconstrictor irritation in the stages of ischemia and cyanosis, of a vasodilator irritation in the stage of erythema. Whether this irritation is the direct result of abnormal processes going on in the vasomotor centers in the spinal cord, or is the reflex result of irritation arising elsewhere, is undetermined. Raynaud held that it must be of central origin, since in his cases galvanization of the spinal cord modified the arterial spasm. The latter observation has not been confirmed by other observers. Weiss believes that the condition may occur in response to irritation arising in the skin, in the viscera, or in the brain, and thus prefers the theory of reflex origin. This theory is adopted by several observers, who find a source for such irritation in the female genital organs in their cases. Etiology. The disease occurs in adult life, only 2 cases having been observed in persons 50 years old. It is most frequent between the ages of 15 and 30, although children and adults beyond the age of 30 are about equally liable. Females are more liable to it than males, 4/5 of the recorded cases having been in women. It occurs more frequently in the winter months, exposure to cold being a common exciting cause. Other exciting causes are nervous exhaustion, especially occurring in those who are predisposed to nervous diseases by heredity. General weakness from anemia, malnutrition, or the occurrence of acute fever or exhausting disease, and mental agitation, a fright having preceded the attack in several cases. In women, menstrual disorders and uterine disease have been considered as etiological factors. Occupation has something to do with its occurrence, since washerwomen, waitresses, and chambermaids are the class most often affected. In many cases, however, no cause of local irritation can be found. Diagnosis. The diagnosis rests upon the development of vasomotor symptoms in the extremities, situated symmetrically, going on to gangrene, in a person not afflicted with cardiac disease or with endarteritis of any kind, and not having been exposed to frostbite or ergot poisoning. The age of the patient, the symmetrical position of the symptoms, the persistence of the pulse in the main arteries, and the limitation of the gangrene to the tips of the extremities distinguish it readily from senile gangrene. The history of the case, the absence of itching, and the presence of pain during the arterial spasm which passes off when the spasm ceases, serve to separate it clearly from chilblains. Congenital cyanosis is produced by cardiac anomalies, and the entire body is affected. Ergot poisoning can be ascertained by the history. Prognosis. Life is not endangered by this disease, no fatal cases having been recorded. Recovery from an attack is certain, but the duration cannot be stated, as it will depend in any case on the character, the extent, and the severity of the symptoms. The possibility of a recurrence of the attack should be stated to the patient. Treatment. The methods of treatment have varied, and none are wholly satisfactory. If the causes can be met, e.g. anemia, nervous exhaustion, they should be treated. If not, the disease itself may be attacked by means of electricity. Or the symptoms may be treated as they demand it. Electricity has been used by almost all observers. The faradic current produces an aggravation of all the symptoms except in the stage of erythema, and has been discarded. The galvanic current may be employed in several ways. 2 methods are in use. In the first, the positive pole is applied over the cervical region, and the negative pole over the lumbar region, a descending current being thus sent through the spinal cord. The current should be of moderate strength, not above 25 mA, few patients being able to endure the strength implied in Raynaud's statement that he used 64 cells of a Daniel battery. The duration of the application should be 10 minutes, and the electricity may be applied once daily. In the second method, the anode is applied over the brachial or lumbar plexus, as the case may be, and the cathode passed over the affected extremity, the current being constant and care being taken not to break it suddenly. The strength, duration, and frequency should be the same as in the first method. From these two methods, separately or combined, Raynaud claimed to have seen favorable results. His assertions have not been confirmed by other observers who have followed his directions closely, and hence considerable doubt at present prevails as to the efficacy of the electric current. The so-called electrical application to the cervical sympathetic is certainly useless. In the stage of erythema, a very weak faradic current applied to the hands in a bath may be of service. Many observers have found that the progress of the case to recovery was quite rapid if the limb were put at rest in an elevated position, were kept warm by cotton batting or similar bandaging, and were kept clean with antiseptic lotions when the stage of gangrene set in. Massage is to be used in all cases, the limbs or affected parts being gently rubbed with the dry hand or with aromatic liniments or oils. All local injury, however, and especially counter-irritation, are to be carefully avoided. General tonic treatment, especially iron and cod liver oil, is to be used in all cases. The pain occurring in the early stages is often so severe as to require the use of opium or other narcotics. And when the nervous symptoms are especially aggravated, and irritability and insomnia give the patient discomfort, bromide and chloral may be employed. Diseases of the cervical sympathetic. Etiology. Diseases of the cervical sympathetic ganglia or cord may be of two kinds, either irritative or destructive. 61 They are produced by pressure upon the cervical ganglia or upon the sympathetic cord between these ganglia, by tumors, especially aneurysms, and enlarged glands, by abscesses, and by cicatrices of old wounds in the neck. They are also due to extension of inflammation from a thickened pleura in phthisis and chronic pleuritis of the apex. They may be caused by injuries, such as stab wounds, gunshot wounds, etc. Any disease which produces marked irritation of peripheral branches of the sympathetic in the neck, or of the cerebrospinal cervical nerves, may cause reflex phenomena resembling the symptoms of actual disease. From such phenomena it is not justifiable to conclude that the sympathetic cord and ganglia are the seat of lesions, and the only cases which will be considered here are those in which actual disease was proven to be present by an autopsy. 61 Ogle, Medico-Chirurgical Transactions, Zli. 397-440. 1858, 27 cases, Poitou, Le Nerf Sympathétique, These de Paris. 1869, 19 cases, Eulenberg and Gutmann, Die Pathologie der Sympathicus, 1873. Nicoti, La Paralysie du Nerf. Sympathique cervicale, 1873, 25 cases, Seligmuller, Inog. Dissertation, 1876, Mitchell, Injuries of Nerves, Mobius. Pathologie der Sympathicus, Berlin. Klin. Watch, 1884, numbers 15-19. Inasmuch as the cervical sympathetic is in close anatomical connection with the spinal cord, especially with the 8th cervical to the 2nd dorsal segments, the so-called ciliospinal center of Budge. And as the functions of the sympathetic are dependent upon the integrity of the spinal cord, it is evident that any lesion of the nerves uniting it with the cord, or any lesion in the cord itself at the levels mentioned, may produce symptoms which resemble closely those of disease of the sympathetic. Thus, cervical pachymeningitis, myelitis, especially from injury of the cord, or hematomyelia, and diseases of the cervical vertebrae which produce either or both conditions, may cause a train of symptoms somewhat similar to those to be described. 62 A careful distinction must be made between primary and secondary disease of the sympathetic, between reflex and direct symptoms, between lesions in its substance and lesions in its governing centers in the spinal cord. The symptoms produced by affections of a reflex or central nature are rarely as numerous as those of disease of the sympathetic itself. An example of such a secondary affection is the combination of sympathetic symptoms occurring in progressive muscular atrophy. And, finally, since mental action of an emotional nature may cause flushing or pallor of the face, with profuse sweating and variations in the size of the pupil and prominence of the eyeballs, as well as palpitation or arrest of the heart. There is reason to believe that symptoms of sympathetic disease may be produced by cerebral lesions. 62 Ross, Diseases of the Nervous System, 2D edition, I. 686 to 688. Pathology. The pathological anatomy of the cervical sympathetic is obscure. This is probably owing to the fact that the ganglia are rarely examined, and pathologists have not been familiar with their histology. Lesions of the cervical sympathetic have been described in almost every imaginable form of disease, and at one time, when many obscure conditions were blindly termed sympathetic. The records were filled with descriptions of fatty degeneration or interstitial inflammation or pigment deposit in the ganglia. As no actual symptoms of disease of the cervical sympathetic, as now understood, were present in such cases, it is impossible to believe that the lesion was other than hypothetical. The conditions which have been observed in a few carefully studied cases of primary disease have been, 1. A parenchymatous inflammation of the cells of the ganglia, attended by swelling, loss of nuclei, granular and fatty degeneration, and by atrophy, together with a degeneration of the fibers issuing from the cells. 2. A sclerotic process in the connective tissue in and about the ganglia and in the nerves, resulting in such an increase in the interstitial tissue as to compress and injure the cells and axis cylinders. These may be observed together in the later stages of the disease. 3. In a number of cases the capillaries within and about the ganglia have been found dilated, tortuous, and varicose, and hemorrhages from them are not rare. Symptoms. The symptoms of irritation of the cervical sympathetic are dilatation of the pupil, widening of the palpebral fissure, protrusion of the eyeball, pallor of the entire side of the face and head, with slight fall of local temperature and possibly an increased secretion of perspiration, and an increased frequency of the heart. It is rarely that these are all observed in any case, dilatation of the pupil with slight pallor and rapid pulse being the only signs of irritation as a rule. Such irritation is a less common occurrence than might be supposed, many lesions which produce pressure even of a slight degree on the sympathetic having caused symptoms of a suspension of its function rather than of an increased activity. This is doubtless due to the non-metallated structure of the fibers, which thus lack protection from injury. The symptoms of destructive disease of the cervical sympathetic are the converse of those just mentioned, and they are all present when the part is seriously involved. The patient will then have a marked contraction of the pupil, which no longer responds to light or to irritation of the skin of the neck, but may change slightly in the act of accommodation. It resists the action of mydriatics. The vessels of the choroid and retina may be dilated, as well as those of the iris, in which case the patient will feel a sense of weariness on any long-continued attempt to use the eyes. There is no actual disturbance of vision, and the cornea is not usually flattened, as was formerly supposed. There is a noticeable narrowing of the palpebral fissure, the upper lid falling slightly as in a mild state of ptosis, and the lower lid being slightly elevated. This is due to the paralysis of the muscles of Muller in the eyelids, which are controlled by the sympathetic. It is present in 90% of the recorded cases, and in many the apparent size of the eye is reduced to half. Retraction of the eyeball is a less constant symptom, and one which develops only after the disease has existed some time. It is due partly to the paralysis of the orbital muscle of Muller, and partly to the decrease in the amount of fat in the orbit behind the eye. A marked symptom, and one which is constant, is a dilatation of the vessels of the face, conjunctiva, nasal mucous membrane, ear, and scalp. This is attended by redness, a subjective sense of heat, and an actual rise of local temperature, which may exceed that of the other side by 1.5 degrees Fahrenheit, measured in the auditory meatus or nose. This vascular congestion has persisted in some cases for 3 years. In others it has been followed much earlier, in 9 months, by a partial or complete return to the normal condition, and even when the local temperature remains higher on the affected side. The visible congestion and the sensation of heat may have disappeared. The dilatation, succeeded by the contraction, normal tone, of the vessels has led to a division of the disease into two stages, and in a few cases the affected side has become paler than the other in the second stage. In both stages the part affected is less sensitive to changes in the external temperature. An increased secretion of tears and of perspiration has been supposed to accompany dilatation of the vessels of the skin of the head inevitably. This is not a constant symptom, as the recent cases have demonstrated. And no definite statement of the effect of disease of the cervical sympathetic on the occurrence of dryness or dampness of the face can be made, both conditions having been observed. A difference between the degree of moisture on the two sides of the face on exposure to heat is usually present. Palpitation of the heart has been an annoying symptom to the patient in many cases, and is usually associated with a marked slowing of the pulse. This was reduced from 74 to 66 in Mobius case 63 and remained slow for some weeks. The frequency of the heart may, however, be increased after the first period of slowing, but never reaches a very high rate, 88 in the case cited. A slight atrophy of the affected side of the face has been observed in several cases, appearing after the disease has existed for some time. The muscles of the cheek feel flabby and are slightly sunken. But the condition does not approach in severity true facial hemiatrophy, nor is it sufficiently rapid to be considered due to atrophic disturbance. Changes in the secretion of saliva, dryness of the nasal mucous membrane, and symptoms referable to paralysis of the intracranial vessels, such as might be expected from the result of physiological division of the sympathetic, have only been occasionally observed. Glycosuria has been noted in a few cases. 64. 63 Berlin. Klin. Watch, 1884, number 16. 64 Gerhardt, Volkmann Sammlung Klin. Vortrage, number 209. Über Angioneurosen. Course. The course of the disease has been divided into two stages, as already mentioned, the majority of the symptoms remaining permanently from the onset. The second stage is characterized by the cessation of the dilatation of the vessels, by the appearance of retraction of the eyeball, and by the development of slight facial atrophy. In the cases where the sympathetic is extensively destroyed by the lesion no recovery is possible. When it is simply divided by a wound there has been a considerable degree of recovery, probably due to a spontaneous union of the divided ends and re-establishment of the function. From these facts the prognosis can be deduced. Diagnosis. The symptoms are so characteristic that there is no difficulty in reaching a diagnosis. The most important point in any case is to determine the cause, care being taken to consider all the possibilities already mentioned in discussing the causation. The symptoms of lesion are always unilateral. Treatment. If the cause can be removed, an indication for treatment is afforded. Sources of reflex irritation are to be eliminated. If the sympathetic has been divided by a wound, it may be well to unite the cut ends, as in suture of other nerves, although this has not yet been attempted, otherwise there is little hope from any method of treatment. Electricity has been applied in vain, and galvanization of the sympathetic in the neck is now regarded by all good authorities as useless. Diseases of the thoracic and abdominal sympathetic ganglia and cords have been suspected, but nothing definite is known of their symptoms or pathology. The statements which have recently been made regarding visceral neurosis not being based upon any cases in which post-mortem lesions were found. Trophic neuroses. Trophic nerves and nervous centers. The nutrition of the body depends upon the nutrition of the individual cells of which it is made up. Each cell has the power of appropriating from the blood such substances as will preserve its existence, enable it to perform its functions, and produce a successor. Whether this power is inherent in the cell or is controlled by the nervous system is a question upon which authorities are divided. Those who hold the first position deny the existence of trophic nervous centers and of trophic nerves from those centers to the organs and elements of the body, claiming that this hypothetical trophic system has not been demonstrated anatomically, and that the facts urged in its support are capable of another interpretation. Those who believe in the existence of a trophic system have been able to demonstrate the existence of fine peripheral nerve fibers passing to and ending in individual cells of the skin, glands, and other organs. 65 and have brought forward a large collection of facts which merit a careful examination. 66 They are as follows. 65 Berichter Section für Dermatologie, Versammlung. Deutscher Erst, Strasbourg, 1885, Viertelgerschrift für Dermatology und Syphilis, 1885, for Heft, S. 683. 66 Trophoneuresen, Real Cyclopädie F. D. Gesamt. Medicine, Volume 14, 1883, Erb, Ziemson's Cyclopedia, 11. Pages 408 to 423. Atrophy. When a nerve is cut, certain changes occur in it which are known as Wallerian degeneration. 67 This affects the peripheral end of a severed nerve, the peripheral end of a severed anterior nerve root, and the central end of a posterior nerve root. To maintain its integrity, a motor nerve must be in direct continuity with a normal cell of the anterior cornu of the spinal cord. A sensory nerve must be in connection with the intervertebral spinal ganglion on the posterior nerve root. Nerves which pass between two such ganglia do not degenerate when cut. The degeneration consists 68 in a coagulation of the myelin in the medullary sheath, a fatty degeneration of the coagulum, and a gradual absorption of the debris. The axis cylinder is compressed, and finally disintegrated, by a mass of protoplasm which develops about the nuclei of the interannular segments, and after undergoing fatty degeneration its debris becomes mingled with that of the myelin, and is also absorbed. The sheath of Schwann, whose nuclei have in the meantime increased by a process of subdivision, is partly filled by the protoplasm, from which the new axis cylinder develops if regeneration occurs, remaining as a fine thread of connective tissue when all other traces of the nerve fiber have disappeared. There may be a proliferation of cells of the endo and perineurium at the same time which aids in the transformation of the nerve into a connective tissue strand. This process of degeneration involves the terminal plates by which the nerves join the muscles, but the terminations of the sensory nerves, i.e. tactile corpuscles, do not appear to be affected. The central end of the cut nerve may display a similar change for a distance not greater than 1 cm. It usually develops a bulbous swelling of connective tissue, and retains its conducting power indefinitely. 67 Waller, Philosophe. Transactions, 1850. 2. Comptes rendus de l'Académique. Desai, 1852-55. 68 Ranvier, Leçons sur l'histologie du système nerveux. Paris, 1878, von Recklinghausen, Pathologie der Erinnerung, 1883. Degeneration in the tracts of the spinal cord occurs after various forms of lesion, 69, and is similar in its processes to degeneration in the peripheral nerves. The increase in the connective tissue elements is more noticeable in contrast with the parts unaffected, and from the density of the tract involved the result has been called sclerosis. The recent researches of Homan 70 have shown that the process of degeneration begins in the entire length of the affected tract, and does not proceed from the point of lesion onward, as was formerly supposed. 69 See Volume 5. Myelitis, the secondary sclerosis, p. 892, Schulze, Arch für Psych, 14. 2. 74 Schritt Medicine, 1885, No. 9. When a muscle is separated from its connection with the central nervous system, either by a division of the nerve passing to it or by a destruction of the cells in the anterior cornu of the spinal cord from which that nerve arises, it undergoes an atrophy which is peculiar in being immediate and rapidly progressive, thus contrasting strongly with the gradual and slighter atrophy from disuse in cases of cerebral paralysis where the cells mentioned and the nerve fibers are intact. There is at first a simple diminution in the number of the fibrillae of which the muscular fiber is made up, together with an increase in the interstitial connective tissue nuclei. Then an albuminoid and fatty degeneration of the muscular elements occurs, with a proliferation of muscle corpuscles or nuclei, and a gradual absorption of the debris. The interstitial connective tissue then increases rapidly, forming fibrous bands through the degenerated muscle which compress the few muscular fibers remaining. Until as a result the muscle is transformed into a mere ribbon of connective tissue without any power of contractility. 71 As these changes go on the electrical reactions change, the 3 degrees of reaction of degeneration corresponding to the 3 stages of atrophy described. 72 These phenomena of nerve and muscle degeneration are observed in traumatic or idiopathic neuritis, in acute and chronic poliomyelitis anterior, in general myelitis involving the anterior cornua, and in bulbar paralysis. 71 Hayem, G. Recherches sur l'anatomie pathologique de atrophies musculaires, Paris, 1873, Ross, Diseases of the Nervous System, Volume 1. 72 See Volume 5, Electric Reactions. The influence of the nervous system on the nutrition of the bones has also been ascertained. When a bone is developing, a lesion of the nerve to it, or of the deeper portion of the anterior cornua of the spinal cord from which these nerves arise, will modify and partly arrest its growth. This is often seen in anterior poliomyelitis and in hemiatrophy of the face occurring in children. In the adult a no less marked effect is produced, although the results are less noticeable. A condition known as osteoporosis is caused, consisting of an enlargement of the Haversian canals and an infiltration of fatty matter into them and an actual decrease in all the inorganic constituents of the bone, which loses in weight. Becomes thinner and more fragile, so that spontaneous fractures may occur. 73 This condition has been noticed more frequently in diseases of the spinal cord than in neuritis. It is said to occur in locomotor ataxia. It has been found in a few cases of long-standing hemiplegia and also in dementia paralytica, no explanation of its pathogeny in these instances, however, being offered. In a case of ataxia with a lesion in the medulla which involved the nuclei of the 5th, 9th, 10th, and 11th nerves on one side, all the teeth of the upper jaw on that side fell out within a few weeks, those in the lower jaw remaining. 74 Changes in the nutrition of the bones have also been recorded in cases of progressive muscular atrophy in the paralyzed limbs. 75. 73 Were Mitchell, America Journ. Of the Med. Sci. 1873, p. 113, Charcot, Arch de Phys. 1874. 74 Demange, Rev. De Medicine, 1882. 75 Friedreich, Progressive Muscle Atrophy. 1873. The condition of the skin and its appendages is influenced decidedly by changes in the nervous system, either in the nerves, in the spinal ganglia, or in the central gray matter. Here it is the sensory nerves which convey the trophic influence, not the motor nerves, as in the cases hitherto considered. And when the lesion-producing trophic changes in the skin is central, it is situated in the posterior cornua of the spinal cord or in the gray matter near the central canal. The glossy skin seen on the fingers after injuries to the nerves is a type of such atrophy from disturbance of trophic impulses. Glossy fingers present a smooth, shining appearance, are dry from the diminution in the secretion of sweat, feel soft and satin-like to the touch from the marked thinning of the skin, and frequently show a defective or irregular growth of the nails, which may be ridged, curved, or deformed. 76 They are red and mottled from accompanying vasomotor paralysis, and are usually hot and painful. Changes in the pigmentation of the skin and hair are recorded as a not infrequent accompaniment of severe neuralgia and as a result of great mental anxiety. Thus in several cases of supraorbital neuralgia the eyebrow on the affected side has turned white, in infraorbital neuralgia the beard has become gray, and in both the hair has been observed to fall out. 77 The sudden turning white of the hair is ascribed to a swelling of the hair by air within it. 78 In one case, frequently cited, the hair and nails fell out after a stroke of lightning. 76 Were Mitchell, Injuries of Nerves. See also Volume 4. 77 Seligmuller, Lehrbuch der Krankheiten die Peripheren. Nerven. 1882. 78 Arch F. Path. Anat, 35. 5, 575, Landois. When a gland is cut off from its nervous connection with the cord or cerebral axis by section of its nerves, its function is impaired and its nutrition suffers, so that after a time it loses weight and undergoes a progressive total atrophy. This has been proven experimentally in animals in the submaxillary gland. It has been observed in the testicle in man after division of the spermatic nerve, nelaton, and after destruction of the spinal cord by traumatic and idiopathic myelitis, Klebs, Foster. 79. The sweat glands are known to be under the control of a central nervous mechanism, as cases of hyperhidrosis, anhidrosis, and chromihidrosis prove. 80. And an atrophy of them and of the sebaceous glands has been observed. 81. After nervous lesions. 79. Cited by Samuel, Real Cyclop, Lock Sit. See also. Obolensky, Centralblatt für Medwissenschaft, 1867, 5, 497. 80. See Volume 4. Pages 583 to 586. 81. See Volume 4. Pages 683 ed. Seek. Progressive hemiatrophy of the face is treated elsewhere. The following case of progressive hemiatrophy of the entire body may be mentioned here. A boy, aged 14, dislocated his ankle, which in a few days became swollen, red, hot, and painful. The inflammation extended up the leg, but did not involve the knee, and soon subsided. After a short time the foot began to atrophy. The atrophy extended up the leg, and involved the thigh. It then progressed to the trunk and the arm, and lastly to the face on the affected side, until in the course of 2 years there had developed a unilateral atrophy of the entire body. Muscles, fat, and bones were all affected, but no difference in the skin or hair of the two sides was noticed. Fibrillary tremors were present in the muscles. The electric reactions were not altered, but were gradually lost. There was a hypersensitiveness to touch and to cold, but no other sensory disturbance. The boy was alive and fairly well when the case was reported. 82. It is unique. 82. Hushen, Schmidt's Jahrbuch, Volume XII. These various instances of atrophy cannot be ascribed to simple disuse, since they differ markedly in their pathological changes and in the rapidity of their progress from such atrophy. Nor are they to be referred to vasomotor disturbances, since in many cases no vascular changes are evident. Their distribution in the body often corresponds exactly with that of peripheral nerves, and they accompany nerve lesions too frequently to be explained on any theory of coincidence. There are many authorities, however, who refuse to ascribe them to a lesion of trophic nerves. 83. In regard to the degeneration of nerves, it is said that each nerve axis cylinder is a part of the nerve cell from which it arises, and hence destruction of the cell or division of the cylinder, by disturbing the unity of existence, results in the death of the part. The fiber shares all the changes of nutrition which the nerve cell undergoes, and if separated from it necessarily perishes. To this it is replied that trophic paths and motor paths are distinct at some points in their course, at least in the central nervous system, since each can be affected alone. Erb, who has studied this subject carefully. 84. Believes that trophic are distinct from motor centers in the spinal cord, but that both impulses may be conveyed by the same axis cylinder in the peripheral nerves, a middle ground which is widely accepted. It is now known that each axis cylinder is made up of several fibrils, so that this theory gains probability. This would also explain the occurrence of atrophy in the muscles, the trophic centers being affected when the muscle atrophies, and unaffected when it is paralyzed without atrophy. Mayer, however, denies this explanation of the muscular atrophy, holding that the motor system, cell, nerve, and muscle fiber, forms a nutritive as well as functional unit, and that the simple suspension of function, by interfering with the special conditions of nutrition attendant upon physiological excitement, is competent to cause a pathological change. To this it is replied that the parts of the motor system are not interdependent, since disease of the muscle does not produce degeneration of the nerve and of the cell. And the fact of a degeneration in a peripheral direction alone is evidence of central trophic influence. The attempt to ascribe trophic changes in the skin, nails, and hair to vasomotor disturbance has been equally unsuccessful in covering all the observed cases. 83 C. Handfield Jones, St. George's Hospital Reports. 1868, Volume 3. Pages 89 to 110. Sigmund Meyer, Hermann's Handbuch D. Physial, 2. Th2, Trophisch Nerven, 1879, Gowers, Diseases of the Brain, 1885. 84 Arch F. Psych, v. S. 445, 1875, also Ziemsons. Cyclo, Volume 13. America Trans, also Deuteronomy Arch F. Clin. Med. v. S. 54. Figure 58. Diagram of the arrangement and connection of motor and trophic centers and fibers in the spinal cord and motor nerve, after A, motor fiber of spinal cord from the brain to D, the motor cell, which is joined to the muscle M by the motor nerve. B, trophic cell in the spinal cord for the muscle, to which it is joined by the trophic fiber B. C, trophic cell in the spinal cord for the motor nerve, to which it is joined by the trophic fiber C. S, a fiber bringing sensory, reflex, impulses to the cell. If D is destroyed, the fibers from B and C perish with it, and the result is paralysis and atrophy of the muscle and degeneration in the motor nerve, e.g. poliomyelitis anterior. If B is destroyed, the muscle atrophies, and paralysis is a secondary result, e.g. progressive muscular atrophy. If C is destroyed, the nerve degenerates, and paralysis and atrophy of the muscle are secondary results, e.g. neuritis with reaction of degeneration. If A is destroyed, voluntary power is lost, but reflex power remains, and no atrophic changes occur, e.g. lateral sclerosis. If the motor nerve is cut between D and M, the result is the same beyond the division as when the motor cell is destroyed. Hypertrophy. Trophic changes are not limited to the process of atrophy. There are conditions of hypertrophy of supposed nervous origin. Samuel considers the hypertrophy of one testicle which attends atrophy of the other from section of its nerve as an example of this. It has been ascertained that one kidney hypertrophies when the other is atrophied or extirpated. When the spleen is removed, the lymphatic glands increase in size. But these facts are capable of another explanation, viz. that increased demand upon the organ leads to its increased growth. Hypertrophy of the skin and of the tongue is seen in cretins in contrast with the deformity of the body and atrophy of the limbs. A hemihypertrophy of the face has been noticed in several cases, the counterpart of hemiatrophy, and in one case a unilateral hypertrophy of the entire body was observed. 85 The local thickening of the skin known as ichthyosis hystrix, and other hypertrophies of the skin, certain deposits of pigment, and vitiligo, have been ascribed to nervous causes. Mitchell has recorded cases of abnormal growth of the nails and hair after injuries to the nerves, and similar phenomena have followed central lesions. He has also described a thickening of the skin of the first 3 fingers and of the back of the hand following a wound of the brachial plexus. These conditions of the skin and its appendages indicate an abnormal activity in the cells of the affected part, a rapid metabolism and reproduction, resulting in an undue production of tissue, apparently dependent on nervous impulses reaching the cells from a distance. The insane ear may be mentioned in this connection as a trophic disturbance due to central lesion. 85 Zeal, Fierco's Archive, Sci. S. 92. Myxedema, cachexypacator meek, is a disturbance of nutritive processes characterized by a production of mucin, which is deposited in all the tissues of the body, but especially in the subdermal connective tissue. 86 It is considered by the majority of authors a trophic neurosis, and is therefore considered here. 86 Sir William W. Gull, on a cretinoid state supervening in adult life, Trans Clin. SOC London, 1874, Volume 7. Ord, on myxedema, med. Chur. Trans, 1878, Volume 61. Mahomed, Lancet, 1881, 2. Number 26, Haddon, Brain, 1882, W. A. Hammond, Neurological Contributions, 1881, I. Ballet. Archives de Neurology, 1881, Volume 3. Schmitz. Jarbucher, Volume Klexics. Encyclopedia. 264, The Brown. Lectures, Victor Horsley, Lancet, January, 1886. Pathology. In the few autopsies which have been made, an increase in the connective tissue of all the organs has been found, in the meshes of which a thick, transparent, slimy substance, called animal gum, consisting of mucin, is present. This may compress and destroy the parenchyma of the organs involved. There is also found a thickening of the coats, adventitia and media, of the vessels. An atrophy of the thyroid gland has occurred in every case. An experimental extirpation of the thyroid in animals produces symptoms so nearly identical with those of myxedema that this is considered the chief pathological feature of the disease. Whether this atrophy is due to a compression by the mucin deposited, or is due to a disease of the trophic centers of the thyroid in the medulla, or is a primary affection of the gland, remains to be determined. Etiology. The actual causation is unknown. Cold and mental shock have been considered exciting causes in some cases. Women are much more liable to the disease than men, and it develops after the age of 40 in the majority of cases. It may occur in childhood and result in a cretinoid state. Syphilis and tuberculosis do not appear to be etiological factors. Symptoms. The disease begins gradually, and the nervous symptoms or the local edema may appear together or in succession. The patient notices a thickening of the skin, which becomes dry, rough, and scaly. The thickening is uniform and involves the entire body. It is most marked where the subdermal connective tissue is loose, as in the cheeks, lips, eyelids, and in all parts where the skin is thrown into folds. The hands and feet do not escape. The thickened skin is hard, and does not pit on pressure, thus differing from ordinary edematous swelling. It appears of a waxy color, and is free from perspiration, the sweat glands becoming atrophied from pressure. The hair may fall out or become woolly and brittle, and may change its color. In a few cases spots of pigment have appeared on various regions. 87 The nails are brittle. The teeth are carious. The mucous membranes show similar changes, and the mouth and tongue, rectum and vagina, may be so swollen as to impair their respective functions. Digestive disturbances, constipation alternating with diarrhea, and uterine hemorrhages, which occur, are ascribed to this cause. Albumin is occasionally found in the urine, but is not a constant symptom. The nervous symptoms are constant. The patients complain of paresthesia and anesthesia of the extremities or over the entire body, and the special senses may be impaired, as well as the tactile sense. They are very liable to severe attacks of neuralgia. They suffer from subjective sensations of cold, and are easily affected by changes of temperature. Motion is interfered with, tremors occur early, movements become slow and awkward, the gait is unsteady, the voice is rough and nasal. But no true paralysis or muscular atrophy has been observed. The patellotendon reflex is occasionally lost, but not in all cases. 87 Allen McLean Hamilton, Journ. Nerve. And Ment. Dis. 1885, April. These symptoms have been ascribed to the pressure of the mucin upon the terminal filaments of the nerves, and also to changes in the central nervous system. That the latter theory is probably correct is shown by the occurrence of mental symptoms in the majority of cases. The patients become apathetic and all mental action is slowly performed. Indifference to surroundings, loss of memory, and inability to concentrate the attention may be succeeded by transient delirium, hallucinations, and occasionally by delusions of persecution, and the patient finally lapses into a state of imbecility. If the disease develops in early life, education is impossible, and the patient remains in an infantile condition. Whether the changes in the nervous system are due to pressure by deposit of mucin, hadin, or are due to an altered nutrition of the most delicate tissues of the body consequent upon the general metabolic derangement, Horsley, is undetermined. In experimental myxedema the degenerative processes have been found in the nerve cells. There are no symptoms referable to the heart or lungs, and if cirrhosis of the kidney and liver develop, their symptoms supervene upon and are secondary to those of myxedema. High arterial tension has been noticed in the majority of the cases. The course of the disease is a chronic one, and is progressive. There are, however, intermissions in the severity of the symptoms in some cases. Recovery does not occur. Diagnosis. The diagnosis from the accumulation of fat is made by observing the thickening of the nose, lips, fingers, and tongue, and the changes in the skin and its appendages. Scleroderma is not universal like myxedema. In scleroderma the skin is harder and more adherent to subjacent parts, is not transparent and waxy, and the nervous symptoms are wanting. Cretinism seems to be closely allied to myxedema, but is only observed before the age of 7 and is accompanied by hypertrophy of the thyroid gland. Treatment. The treatment is only palliative. Simple nutritious diet, especially milk diet, with the use of such tonics as iron and quinine, has been found useful. The progress of the disease is hastened by exposure to cold, and in a very warm climate the symptoms may remain stationary for several years. Jaborandi or pilocarpine has been used in some cases with a moderate degree of success. Nitroglycerin, Gr. 1/100, has also been of benefit. For the paresthesia and anesthesia of the early stage the phoratic brush has been applied, and for the motor weakness the phoratic current, with the effect of relieving but not curing these symptoms. During the attacks of neuralgia morphine may be employed. Inflammation. The most important trophic disturbances are those which consist of an actual disintegration of tissue. These are very numerous. Herpes zoster, certain forms of eczema and pemphigus, lepra anesthetica, scleroderma, acute ulceration of the fingers, perforating ulcer of the foot, acute bed sores, keratitis with anesthesia of the cornea, sympathetic ophthalmia, and various forms of joint disease, are examples of such trophic diseases. 88 For the discussion of the skin and eye diseases mentioned the reader is referred to special articles on those subjects. In regard to lepra anesthetica, it may be mentioned that in this disease lesions have been found both in the sensory nerves and in the posterior cornua of the spinal cord. 89. 88 Loire, Trophoneuroses, Nouveau Dictionnaire de Médecine et Chirurgie Pratique, 1885. 89 Fierco, Nerven lepra, Geschwulst, 2. 521. Skiricher, Travaux du Laboratoire de Vulpian, 1879. I have reported 90 a case of acute ulceration of the ends of the fingers and toes occurring in an anemic girl aged 12, and persisting for more than a year, associated with cyanosis of the hands and feet, and with a tendency to rapid ulceration of any part of the body which happened to be exposed to pressure. The hair of the eyebrows, eyelids, and to a less extent that of the scalp, fell out during the disease. There was no local asphyxia and no appearance of gangrene, hence the case was not one of Raynaud's disease. Its symmetrical distribution, the lack of any constitutional organic disease or of any local cause for the production of the ulceration, and the anemic and nervous condition present, all pointed to a disturbance of the central nervous system. It did not yield to treatment, either local or general or electrical. Mills has seen a similar case. 91. 90 Journal Nerve and Ment. Disease, February, 1886, Clinical Cases. 91 Mills, America Journ. Med. Sci., October, 1878. Perforating ulcer of the foot begins on the sole, beneath any of the metatarsophalangeal articulations, preferably the first or the fifth, or under the heel, as a small pustule under the epidermis. This ruptures, and the ulcer which results begins to extend in a direction vertical to the surface, involving the deeper tissues or even opening into the joint and destroying the bone. It appears rather like a sinus than an ulcer, and is remarkable from the fact that it is not painful and is insensitive to touch, although it may prevent the patient from walking on account of extreme tenderness. The epidermis around the sinus is thickened and insensitive, and there may be anesthesia of the entire sole of the foot, and even of the leg, although this is due to the neuritis present, which is also the cause of the ulcer, rather than to the ulceration. The circulation is sluggish in the affected extremity, it becomes cyanotic on exposure to cold, and seems peculiarly liable to become edematous. The edema may go on to suppuration, and involve the articulations, and ankylosis of the smaller joints may follow. This, too, is to be traced to the neuritis. The skin of the foot becomes pigmented, and may be dry or covered with offensive sweat. As the patient cannot walk while the ulcer remains, the condition demands treatment. Rest, moist warm applications, antiseptic lotions, scraping out the sinus, and other surgical means appropriate to the treatment of ulcers and sinuses do not often prove of benefit. And in obstinate cases recourse has been had to amputation of the foot. Electrical treatment has been tried in vain. Such perforating ulcers may occur symmetrically on both feet, and may be numerous. They also occur rarely on the hands. They have been observed not infrequently in locomotor ataxia, occurring either early or late in the disease, 92, and have appeared in patients suffering from dementia paralytica. The only constant lesion found is a degeneration of the peripheral nerves supplying the affected part. 92 For bibliography see Ross, Diseases of Nervous System. 2d edition, I. and Blum, Berliner Klin. Wochen, 1875, Numbers 13 to 15. Acute bed sores, decubitus, develop in many cases of spinal and cerebral disease, but not in all. It is argued that anesthesia of a part or simple pressure upon a part or irritation of an anesthetic part will not explain their occurrence, and that they must be traced to a destruction of trophic centers in the cord or brain. No amount of attention to the position and cleanliness of the patient is thought to be sufficient to prevent them in some cases, and their progress is often so rapid as to remove them from the category of simple ulceration. Their most frequent seat is upon the buttocks, over the sacrum, on the heels, and over the scapulae, but it is believed that in the conditions in which they appear in these places pressure on any part may cause one. They begin within a few hours after the occurrence of the lesion as irregular mottled patches of redness, in which there soon appear small or large vesicles filled with dark serum. These rupture, leaving little areas of ulcerated surface, which soon unite to form a large ulcer with softened, infiltrated, and bloody base and ragged edges. The tissues around and within the ulcer have a tendency to slough and to become gangrenous, and the process goes on rapidly until a considerable area of the surface is completely destroyed, together with the deeper structures, fat, muscles, and fasciae, down to the bone, which may become necrosed. Acute cystitis is so frequently associated with acute bedsore that it is traced to the same nervous cause, though here, again, another explanation is possible. The constitutional disturbance produced by these two affections may be increased by a true septicemia, to which the patient succumbs, or metastatic abscesses may be formed, and pyemia cause death. Or, lastly, the ulcer on the back may lay bare the vertebrae and erode their ligaments, thus opening a way for the extension of suppuration to the meninges of the spinal cord. The duration may be from a few days to 2 weeks, and the prognosis is very grave. Chronic bedsores develop in a similar manner, although all the processes described occur more slowly and are much less severe. They do not show the tendency to extend so widely or so deeply, nor to become gangrenous. They remain stationary after attaining a certain size, and the tissues seem to lack all tendency to reproduction and repair. When the central lesion which they follow begins to pass away they heal, sometimes local treatment is successful. But in many cases they persist for years, always threatening the life of the patient from the possibility of their sudden aggravation or from the occurrence of the complications already mentioned in connection with the acute process. Since neither form of decubitus occurs after lesion of the anterior cornua of the spinal cord, nor in sclerosis of the posterior or lateral columns, Nor in those cases of locomotor ataxia in which extensive invasion of the posterior cornua is present, while they are particularly frequent as a complication of general myelitis, hemorrhage in the cord, and syringomyelitis. It is argued that the trophic centers whose destruction is the cause of these bed sores lie in the central gray matter of the cord, near to the central canal. In unilateral lesion of the cord, the bed sore occurs on the anesthetic side of the body, i.e., on the side opposite to the seat of the lesion, a fact which may indicate a decussation of the trophic nerve fibers in the cord. 93 But which has also been urged in proof of the theory that the sore is always due to irritation of an insensitive surface. 93 Recklinghausen believes that these cases of disturbance of nutrition can be explained by injury of anesthetic parts in which vasomotor disturbances of central origin exist. Handbuch D. Path. D. Ernährung, pages 236, 237. The treatment of bed sores belongs to the domain of surgery, the same methods being pursued as in the case of any large ulcer. The application of electricity to the sore has been tried, but the results are not sufficiently encouraging to warrant its recommendation. Joint affections of neurotic origin are discussed in the articles upon locomotor ataxia, hemiplegia, and hysteria. It is evident from this review that the nervous centers have some influence upon the activity of the cells of which the body is made up, and that they control the processes of growth, function, repair, and reproduction. The facts are too numerous, too varied, and too positive to admit of any other explanation. Trophic disturbances must therefore be considered as a set of symptoms referable to various lesions of the nervous system. It is evident from the preceding discussion that they may be produced by disease of the peripheral nerves, by disease of the ganglionic cells, which nourish those nerves, by disease of the spinal cord, especially in the region of the central gray matter, and, finally, by disease of the brain. Whether in the last condition the effect is a direct one, or is produced secondarily by an irritation of the spinal centers, cannot yet be determined. There are no trophic centers as yet localized in the cerebrum, but the pathological facts already mentioned warrant the conclusion that such centers will not long elude search. Certain facts observed in cases of infantile hemiplegia point to the motor area of the cortex as the seat of trophic centers for the motor mechanisms. Since it is found that when the motor cortex is destroyed in early life, the bones and muscles which it controls fail to develop properly. Trophic centers for sensory mechanisms are not yet discovered. Certain investigations of Luciani recently published 94 point to the cerebellum as the part of the brain which governs the general nutrition of the body, but these need confirmation. 94 Alienist and Neurologist, July, 1885. Conclusion. While an attempt has been made here to consider vasomotor and trophic neuroses separately, it must be admitted that in very many conditions the two are coincident. This follows inevitably from what has been stated regarding the localization of the vasomotor and trophic centers in the spinal cord, and regarding the course of the vasomotor and trophic nerves from the spinal centers to the periphery. These two classes of centers and nerves lie side by side in the central and peripheral organs, and it is less surprising that they should be jointly affected than that one should ever be involved alone. In any case of lesion of the peripheral nerves or of the central nervous system they may be expected. In all cases they are to be regarded as symptoms of such lesions rather than as distinct diseases. Index to Volume V. A. Abdomen, state of, in lead colic. In tubercular meningitis. Abscess of the brain. Of the spinal cord. Achromatopsia, hysterical. Aconite and akinesia, use of, in neuralgia. Hypodermically in exacerbations of cerebral syphilis. Acoustic sensory disturbances in nervous diseases. Acrodynia. Acute affections produced by heat. Alcoholism. Cerebral anemia. Encephalitis. Myelitis, spinal. Poisoning by alcohol in lethal doses. Simple meningitis. Spinal meningitis. Pachymeningitis. Esthesitic system of encephalon, localization of lesions in. Of spinal cord, localization of lesions in. Affective mental disease. Age, influence on causation of acute spinal meningitis. Of catalepsy. Of cerebral anemia. Of chorea. Of chronic lead poisoning. Of disseminated sclerosis. Of embolism and thrombosis of cerebral veins. Of epilepsy. Of family form of tabes dorsalis. Of general paralysis of the insane. Of hematoma of the dura mater. Of hysteria. Of hysteroepilepsy. Of insanity. Of intracranial hemorrhage and apoplexy. Of labioglossolaryngeal paralysis. Of migraine. Of myxedema. Of neuralgia. Of paralysis agitans. Of progressive unilateral facial atrophy. Of syphilitic affections of nerve centers. Of tabes dorsalis. Of the opium habit. Of thrombosis of cerebral veins and sinuses. Of tubercular meningitis. Of tumors of the brain. Spinal cord. Of writer's cramp. Relation of. To limitation of the myelitis in infantile paralysis. Agraphia in hemiplegia. Akinesis in nervous diseases, definition of. Alalia, c. Alexia in nervous diseases. Albuminuria in chronic lead poisoning. Alcohol, influence on causation of acute meningitis. Of cerebral hyperemia. Of intracranial hemorrhage and apoplexy. Of tabes dorsalis. Of writer's cramp. Use of, in alcoholism. In cerebral anemia. In heat exhaustion. In insomnia. In the chloral habit. In the opium habit. In thermic fever. Alcoholic abuse as a cause of epilepsy. Insanity. Alcoholism. Classification. Definition. Diagnosis. Of acute alcoholism. Of chronic alcoholism. Of dipsomania. Of hereditary alcoholism. Etiology. Alcohol, physiological action of. Alcoholic beverages, varieties and characters of. Exciting causes. Heredity, influence on causation. Moral, social, and personal condition. Influence on causation. Predisposing causes. History. Pathological action of alcohol. Acute alcoholism. Symptoms. Effects in persons of unsound mind. Effects of different alcohols. Of acute narcotic poisoning. Of acute poisoning in lethal doses. Of convulsive form. Of corrosive poisoning. Of irregular form. Of maniacal form. Of ordinary form. Pathological anatomy. Varieties. Chronic alcoholism. Symptoms, anatomical changes, etc. Alcoholic cachexia in. Atheroma in. Biliary catarrh in. Blood, disorders of. Blood vessels, disorders of. Cerebral. Delirium, alcoholic, and delirium tremens. Dyspeptic. Genitourinary disorders. Glands, disorders of. Heart, disorders of. Insanity. Alcoholic. Intestinal disorders. Kidneys, disorders of. Larynx, disorders of. Liver, disorders of. Locomotive apparatus, disorders of. Lungs, disorders of. Moral sense, perversion of. Motion, disorders of. Mouth and throat, disorders of. Muscles. Disorders of. Nervous system, disorders of. Obesity in. Paralysis, alcoholic. Pleury, disorders of. Psychical disorders. Respiratory system, disorders of. Sensibility, general, disorders of. Skin, disorders of. Special sense, disorders of. Spinal disorders. Stomach, disorders of. Tremor in. Visceral derangements. Will and intellect in. Dipsomania. Symptoms and nature. Hereditary alcoholism, symptoms and forms. Prognosis. Synonyms. Treatment. Alcohol, withdrawal of. Ammonia, use of. Baths and douches, use of. Bromides, use of. Cannabis indica, basidia, and hyoscyamus, use of. Chloral, use of. Coca and cocaine, use of. Diet in. Emetics in. Iron, use of. Hypophosphites in cod liver oil, use of. Of acute form. Of chronic form. Of delirium tremens. Of dipsomania and hereditary forms. Peraldehyde, use of. Prophylaxis. Quinine and opium, use of. Strychnia, use of. Alcoholism, influence on causation of insanity. Alicuria in tabes dorsalis. Alum, use of, in lead colic. Amaurosis in chronic lead poisoning. Amenorrhea in the insane, treatment. Ammonia, use of, in acute alcoholism. In thrombosis of cerebral veins and sinuses. Ammonium of copper, use, in neuralgia. Ammonium chloride, use, in neuralgia. Amnesia in nervous diseases. Amputation, question of, in tetanus. Amyl nitrite, use of, in angina pectoris. In catalepsy. In cerebral anemia. In chorea. In epilepsy. In hysteria. In hysteroepilepsy. In migraine. In vasomotor neuroses. Amyotrophic lateral sclerosis. Anemia as a cause of neuralgia. Of thrombosis of cerebral veins and sinuses. Of vertigo. Anclerosis, influence on causation of hysteria. General, as a cause of spinal anemia. Of the brain. Of the spine. Anemic headache. Anesthesia, hysterical. In acute myelitis. In chronic alcoholism. Spinal meningitis. In hemiplegia. In hysteroepilepsy. In injuries of nerves. In neuritis. In spinal meningeal hemorrhage. Meningitis. Syphilis. In symmetrical gangrene. In tumors of the brain. Of the spinal cord. In unilateral spinal paralysis. Of peripheral origin. Causes. Diagnosis. Symptoms. Treatment. Varieties of, in nervous diseases. Analgesia, definition of. Hysterical. Angina pectoris, c. Angiomata in brain tumors. Angioparalysis in vasomotor neuroses. Angiospasm in vasomotor neuroses. Anhidrosis in progressive unilateral facial atrophy. Ankylosing in amyotrophic lateral sclerosis. In diffuse spinal sclerosis. In nervous diseases. In spastic spinal paralysis. Anterior cornua, changes in amyotrophic lateral sclerosis. In infantile spinal paralysis. Antipyrin, use, in thermic fever. Antispasmodics, use, in hysteria. Anus and rectum, neuralgia of. Aphasia in nervous diseases. In cerebral anemia. Hemorrhage. Syphilis. Hemiplegia, characters and varieties of. Postepileptic. Aphonia, hysterical. Apoplexy. Of the brain, meningeal. Apoplectic attack, symptoms of. Constitution. Peculiarities of. Apoplectiform attacks in tumors of the brain. Type of acute myelitis. Argyll-Robertson pupil in nervous diseases. In tabes dorsalis. Arsenic, use of, in chorea. In malarial form of cerebral anemia. In neuralgia. In paralysis adjutans. In tetanus. In tremor. In writer's cramp. Arteries, cerebral, atheroma of. In cerebral meningeal hemorrhage. Diseases of, in intracranial hemorrhage and apoplexy. Arterial spasm in spinal anemia. Arthralgia, the. Of chronic lead poisoning. Arthropathies and hemiplegia of apoplexy and intracranial hemorrhage. In tabes dorsalis. Asafoetida, use, in hysteria. Assimilation, alterations of, in nervous diseases. Asthma, hysterical. Asylums in the treatment of opium and alcohol habit, question of. Treatment of insane by removal to. Ataxia in tabes dorsalis. In tumors of the brain. In tumors of the spinal cord. Muscular, in general paralysis of the insane. Ataxic tremor. In nervous diseases. Atheroma, in chronic alcoholism. Of the cerebral arteries. Athetosis, definition and symptoms. Pathology, prognosis, and treatment. Atmospheric and thermic influences as cause of neuralgia. Atrophy. Degenerative. In nervous diseases. Facial, progressive unilateral. In amyotrophic lateral sclerosis. Muscular, in chronic lead poisoning. In hemiplegia from apoplexy. In labioglossolaryngeal paralysis. In nervous diseases. In neuralgia. In tumors of the brain. In tumors of the spinal cord. Of anterior gray cornua in infantile spinal paralysis. Of bones and muscles in atrophic infantile paralysis. Of brain. Atropia, use of, in heat exhaustion. In labioglossolaryngeal paralysis. In tremor of spinal sclerosis. In writer's cramp. Ori of epilepsy, characters. Oral vertigo, causes and symptoms. Auras in migraine. Autographic women. Automatism. B. Base of brain, focal lesions of. Baths, use of, in alcoholism. In chorea. In heat exhaustion. In the opium habit. In thermic fever. In tremor. Cold, use of, in spinal sclerosis. Hot, use of, in spinal sclerosis. Sulfur, use of. In chronic lead poisoning. Value of, in hysteria. Warm, use of, in acute myelitis. Bed sores. In tumors of spinal cord. Malignant, in acute myelitis. Belladonna, use of, in epilepsy. In infantile spinal paralysis. Bell's palsy. Biliary catarrh. In chronic alcoholism. Bismuth, use of, in vomiting of the opium habit. Bladder, disorders of, in chronic alcoholism. In tabes dorsalis. In tumors of the brain. Of the spinal cord. Bleeding, in acute myelitis. Simple meningitis. In Bell's palsy. In cerebral hemorrhage and apoplexy. Hyperemia. In exacerbations of cerebral syphilis. In hematoma of the dura mater. In spinal hyperemia. In tetanus. In thermic fever. Blindness, hysterical. In cerebral anemia. Word dash, in nervous diseases. Blisters, use of, in epilepsy. In hematoma of dura mater. In tetanus. In thermic fever. In writer's cramp. Blood, changes in chronic alcoholism. In the chloral habit. In thermic fever. Blood vessels, changes in chronic alcoholism. Bluish line upon the gums, significance of, in chronic lead poisoning. Blushing, in hysteria. Bones, atrophy of. Changes in alcoholism. State of, in general paralysis of the insane. Brachial neuralgia. Brain and spinal cord. Anemia and hyperemia of the abscess. Diagnosis. Etiology. Morbid anatomy. Prognosis. Symptomatology. Treatment. Medical. Derivatives. Mercury. Surgical. Emptying contents. Anemia. Diagnosis. Etiology. Morbid anatomy. Appearances of. In cerebral anemia. Symptomatology. Treatment. Alcoholic stimulants. Amyl nitrite. Cannabis. Cold pack. Massage. Morphine. Hyperemia. Differential diagnosis. Etiology. Symptomatology. Treatment. Baths. Bleeding. Bromides. Cathartics. Cautery. Chloral. Derivation. Diet. Ergot. Hypnotics. Pediluvia. Inflammation. Abscess in. Acute encephalitis of Strumpel in. Accompanying endocarditis. Miliary form. Of septic origin. Post-paralytic phenomena of. Sequelae of. Brain and spinal cord. Concussion of the. Definition and morbid anatomy. Diagnosis. Symptoms. Mental state. Pulse and temperature in. Pupils, state of. Treatment, bromide of potassium, heat and cold, use. Of reaction. Stimulants, use of. Brain, atrophy and hypertrophy of. Atrophy during childhood. Causes, symptoms, and treatment. Of the fully developed. Causes, morbid anatomy, and symptoms. Treatment. Hypertrophy. Course, diagnosis, prognosis, symptoms, and treatment. Etiology and morbid anatomy. Brain and its envelopes, tumors of. And membranes, changes in acute simple meningitis. In alcoholism. In cerebral meningeal hemorrhage. In external pachymeningitis. In general paralysis of the insane. In hematoma of the dura mater. In tubercular meningitis. And spinal cord, diseases of membranes of. Lesions of, in insanity. Microcephalic, size of. Softening of. In children. State of, in chronic hydrocephalus. Syphilis of. Brain cortex, syphilis of, c. Brain, gross appearances of, in brain tumors. Brain tire, treatment of. Breathing, hysterical. Bright's disease as a cause of intracranial hemorrhage and apoplexy. Bromate of potassium, use of, in epilepsy. Bromide of nickel, use of. In epilepsy. Bromide of potassium, use of, in acute simple meningitis. In acute spinal meningitis. In chronic cerebral meningitis. In concussion of spine. In hematoma of the dura mater. In hysteroepilepsy. In insanity. In melancholia. In migraine. In tetanus. In tumors of the brain. Bromides, use of, in alcoholism. In cerebral anemia. Hyperemia. In chorea. In epilepsy. In insomnia. In migraine. In spinal sclerosis. In the opium habit. In tubercular meningitis. In vertigo. Bronchi. Disorders and lesions of, in chronic alcoholism. C. Cachexia, alcoholic, characters. Caffeine, use of, in migraine. In neuralgia. Caisson disease, a form of spinal hyperemia. Calabar bean, use of, in tetanus. In tetanus neonatorum. Cancer of the brain. Cannabis indica, habitual addiction to. Use of, in alcoholism. In brain tumors. In cerebral anemia. In migraine. In the opium habit. In tetanus. Capillary cerebral embolism. Capsicum, use of, in alcoholism. Carbuncles, as a cause of thrombosis of cerebral veins and sinuses. Caries of teeth, as a cause of neuralgia. Caries of temporal bone, as a cause of tubercular meningitis. Carotids, ligation of, as a cause of cerebral anemia. Catalepsy. Definition and synonyms. Diagnosis. From apoplexy and intoxication. From epilepsy. From simulation. From tetanus. Etiology. Age, influence on causation. Imitation, influence on causation. Reflex irritation. Sex and puberty. History. Pathology and duration. Prognosis. Symptoms. Of cataleptoid phenomena in the insane. Of hypnotic catalepsy. Of unilateral catalepsy. Onset of seizures, mode of. Pulse, respiration, and temperature in. Reflex irritability, changes in. Sensation, disturbances of. Wax-like flexibility in. Treatment. Cold douche, use of. Electricity. Use of. Nitrite of amyl and nitroglycerin, use of. Music, use of. Purgatives and tonics, use of. Cataleptoid phenomena in the insane. Cathartics in cerebral abscess. In cerebral hemorrhage. In cerebral hyperemia. Cauterization in vertigo. Cautery, use of, in cerebral hyperemia. In spinal sclerosis. Cephalic souffle, diagnostic significance of. Cerebellum, focal lesions of. Tumors of, symptoms. Cerebral anemia. From emotional disturbance. From ligature of carotid. Arteries. Occlusion of. Congestion, active, insomnia from. Hyperemia in the insane, treatment. Meningeal hemorrhage. Meningitis, chronic. Neurasthenia. Paralysis. Pia mater, congestion of. Inflammation of. Symptoms of thermic fever. Syphilitic insanity. Tissue, alterations of, in epilepsy. Veins and sinuses, thrombosis of. Occlusion of. Cerebrospinal sclerosis, multiple. Cervical sympathetic, diseases of. Etiology and pathology. Course and diagnosis. Symptoms. Eye and pupil, changes in. Heart. Disorders in. Of irritation of. Of destructive disease of. Secretions, changes in. Treatment. Cervicobrachial neuralgia. Occipital neuralgia. Charcot's joint disease in tabes dorsalis. Shane-Stokes phenomenon. Respiration in tubercular meningitis. Childbearing and cerebral anemia. Childhood, headache in. Insanity of. Children, cerebral hemorrhage in. Hysteria in, treatment. Softening of brain in. Chloral, abuse of, c. Use of, in acute simple meningitis. In alcoholism. In cerebral anemia. Hyperemia. In chorea. In epilepsy. In hysteria. In insanity. In insomnia. In migraine. In tetanus. In the opium habit. In tubercular meningitis. In vasomotor neuroses. Chloroform, habitual addiction to. Use of, in hysteria. In neuralgia. In tetanus. Choked disc, in tumors of brain. Cholesteatomata, in brain tumors. Chorea. Definition. Diagnosis and prognosis. Duration. Etiology. Age and sex. Influence on causation. Climate, season, and race. Heredity, influence on causation. Rheumatism, influence on causation. Reflex irritation and eczema. Scarlet fever and pregnancy. Social condition and overstudy. History and synonyms. Morbid anatomy and pathology. Symptoms. During sleep. Heart, state of, in. Mental condition in. Movements, characters, and description of. Paralysis and post-paralytic stage of. Pulse and temperature in. Sensibility and reflexes in. Speech in. Treatment. Arsenic, use of. Cimicifuga and conium, use of. Electricity, use of. Iron and zinc salts, use of. Nitrite of amyl, bromides, etc. Use. Strychnia, use of. Chorea, hysterical. In tumors of the brain. Post-paralytic. Chronic alcoholism etc. Cerebral anemia of adults. Meningitis. Delirium tremens. Hydrocephalus. Lead poisoning. Myelitis. Spinal meningitis. Pachymeningitis. Cicatrices, myelolytic. Cimicifuga, use of, in chorea. Circular insanity. Circulation, obstructed. As a cause of spinal hyperemia. Classification of alcoholism. Of chronic lead poisoning. Of mental diseases. Clavus hystericus. Cleanliness, importance in cerebral hemorrhage and apoplexy. Climate, change of, value in neurasthenia. In neuralgia. In spinal sclerosis. Influence on causation of chronic lead poisoning. Of epilepsy. Of hysteroepilepsy. Of thermic fever. Climate and season, influence on causation of chorea. Of hysteria. Climacteric insanity. Period, cerebral hyperemia in. Climatic and atmospheric conditions, influence on causation of tetanus. Clonic spasms, in nervous diseases. Clonus, significance in nervous diseases. Clot, of intracranial hemorrhage, changes in. Clubfoot, in family form of tabes dorsalis. In infantile spinal paralysis. Coca and cocaine, habitual addiction to. Use of, in alcoholism. In the opium habit. Cod liver oil, use of, in chronic alcoholism. Hydrocephalus. In general paralysis of the insane. In neuralgia. In tubercular meningitis. Cold, influence on causation of Bell's palsy. Of congestion of spinal membranes. Of neuralgia. Of neuritis. Of tetanus. Use of, in concussion of the brain. In external pachymeningitis. In thermic fever. Cold and wet. As a cause of disseminated sclerosis. Of tabes dorsalis. Cold pack, use of, in cerebral anemia. Colic, of chronic lead poisoning. Coma. Alcoholic, characters of. Description of, in nervous diseases. In abscess of the brain. In acute spinal meningitis. In cerebral anemia. In chronic lead poisoning. In tubercular meningitis. Complicating insanity. Complications of hysteria. Of progressive muscular atrophy with atrophic spinal paralysis. Unilateral facial atrophy. Of tumors of the brain. Spinal cord. Compression of nerve trunks, in hysteroepilepsy. Concussion of the brain. Spinal cord. Condition of brain in sleep. Confusional insanity, primary. Congestion of cerebral dura mater. Of pia mater. Of spinal meningitis. Conium, use of, in chorea. In paralysis agitans. In tetanus. Conjunctivitis in the chloral habit. Consciousness, double, in nervous diseases. Loss of, in cerebral hemorrhage and apoplexy. In nervous diseases. In occlusion of cerebral vessels. Perverted, in catalepsy. Constitutional diseases, influence on causation of neuralgia. Affective mental disease. Constipation in chronic hydrocephalus. In chronic lead colic. In tubercular meningitis. In tumors of the brain. Constriction about waist, sense of, in acute spinal pachymeningitis. In disseminated sclerosis. In spinal meningeal hemorrhage. In spinal syphilis. In tabes dorsalis. In tumors of spinal cord. Contact sense in tabes dorsalis. Contractures, hysterical. In disseminated sclerosis. In hemiplegia. In hysteroepilepsy. In infantile spinal paralysis. In inflammation of the brain. In secondary sclerosis. In tumors of the brain. Convulsions in abscess of the brain. In atrophy of the brain. In chronic lead poisoning. In hysteria. In infantile spinal paralysis. In spina bifida. In thrombosis of cerebral veins and sinuses. In tubercular meningitis. In tumors of the brain. Convulsive disorders, local. Form of acute alcoholism. Coordination, disturbance of, in tabes dorsalis. In family form of tabes dorsalis. Copodyscinesia, c. Cord, spinal, lesions of, in alcoholism. In tetanus. Corrosive poisoning from alcohol. Counterirritation, use of, in acute simple meningitis. Spinal meningitis. In cerebral meningeal hemorrhage. In chronic cerebral meningitis. Spinal meningitis. In concussion of the spine. In external pachymeningitis. In infantile spinal paralysis. In hematoma of dura mater. In neuralgia. In neuritis, 4. In sciatica. In symmetrical gangrene. In tubercular meningitis. Coup de soleil. Course of diseases of cervical sympathetic. Of ecstasy. Of family form of tabes dorsalis. Of general paralysis of the insane. Of hysteria. Of hysteroepilepsy. Of infantile spinal paralysis. Of insanity. Of myxedema. Of simple acute meningitis. Of symmetrical gangrene. Of the opium habit. Of vasomotor neuroses. Of writer's cramp. Cramp, writers. Cranial conformation, vices of, as a cause of epilepsy. Craniocerebral topography, in localization of nervous lesions. Cranium, changes in. In chronic alcoholism. In chronic hydrocephalus. Cretinism. Crises clitoridian. Crises in tabes dorsalis. Croton chloral, use, in epileptiform facial neuralgia. In migraine. Croton oil, use of, in cerebral hemorrhage and apoplexy. Cry of tubercular meningitis. Curare, use of, in tetanus. In tremors of spinal sclerosis. Cutaneous sensibility, disorders of, in epilepsy. Cyanotic stage of symmetrical gangrene. D. Dancing mania, the. Deafness, hysterical. Word dash, in nervous diseases. Death, apparent. Mode of, in delirium tremens. Defecation, hysterical disorders of. Definition of alcoholism. Of amyotrophic lateral spinal sclerosis. Of apoplexy. Of athetosis. Of atrophy of the brain. Of catalepsy. Of chorea. Of chronic hydrocephalus. Lead poisoning. Of eclampsia. Of ecstasy. Of epilepsy. Of hematoma of the dura mater. Of hysteria. Of hysteroepilepsy. Of infantile spinal paralysis. Of insanity. Of labioglossolaryngeal paralysis. Of neural disorders of writers and artisans. Of neuralgia. Of progressive unilateral facial atrophy. Of spina bifida. Of stigmatization. Of symmetrical gangrene. Of tetanus. Of trance. Of tremor. Of tubercular meningitis. Of tumors of the brain. Spinal cord. Of unilateral spinal paralysis. Of vasomotor and trophic neuroses. Of vertigo. Deformities, in tabes dorsalis. In infantile spinal paralysis. Degenerative changes in atrophy. Deglutition, difficult, in amyotrophic lateral sclerosis. In Bell's palsy. In cerebral hemorrhage and apoplexy. In labioglossolaryngeal paralysis. Delirium, acute. Chronic, in alcoholic insanity. In acute simple meningitis. In alcoholism. In chronic lead poisoning. In nervous disease. Of cerebral anemia. Tremens. Delusional insanity, secondary. Primary. Delusions, character of, in insanity. In general paralysis of the insane. In catatonia. Varieties of, in nervous diseases. With melancholia. Dementia, in alcoholism. Of general paralysis of the insane. Paretic, in inflammation of the brain. In spastic spinal paralysis. And simple, in disseminated sclerosis. Primary. Secondary. Senile. Terminal. Depression in cerebral anemia. In mental disease. Durkheim and Parker on artificial induction of convulsive seizures. Development of language. Diabetes, influence on causation of neuralgia. Diagnosis of abscess of the brain. Of acute mania. Of acute myelitis. Of acute narcotic poisoning from alcohol. Of acute simple meningitis. Spinal meningitis. Pachymeningitis. Of apoplexy. Of anesthesia of peripheral origin. Of athetosis. Of Bell's palsy. Of capillary embolism. Of catalepsy. Of cerebral anemia. Embolism. Hemorrhage. Hyperemia. Meningeal hemorrhage. Syphilis. Of chorea. Of chronic cerebral meningitis. Hydrocephalus. Of chronic lead poisoning. Of combined form of sclerosis. Of concussion of the brain. Spine. Of congestion of spinal membranes. Of diffuse sclerosis. Of diseases of cervical sympathetic. Of disseminated sclerosis. Of ecstasy. Of epilepsy. Of external pachymeningitis. Of family form of tabes dorsalis. Of functional nervous diseases. Of gastralgia. Of general paralysis of the insane. Of hematoma of dura mater. Of headache. Of hydrancephaloid. Of hypertrophy of the brain. Of hysteria. Of hysteroepilepsy. Of infantile spinal paralysis. Of insanity. Of labioglossolaryngeal paralysis. Of migraine. Of multiple neuritis. Of myxedema. Of nerve injuries. Of neuralgia. Of neuritis. Of neuromata. Of organic nervous diseases. Of paralysis agitans. Of progressive unilateral facial atrophy. Of simulation of sleep. Of spastic spinal paralysis. Of special paralyses in infantile spinal paralysis. Of spina bifida. Of spinal meningeal hemorrhage. Of symmetrical gangrene. Of syphilis of brain cortex. Of tabes dorsalis. Of the chloral habit. Of the opium habit. Of thermic fever. Of thrombosis of cerebral veins and sinuses. Of tubercular meningitis. Of tumors of brain. Of spinal cord. Of vasomotor neuroses. Of vertigo. Of writer's cramp. Principles of, in nervous diseases. Diaphragm. Hysterical paralysis of. Diarrheal affections of children as a cause of cerebral anemia. Diet in acute simple meningitis. In acute spinal meningitis. In alcoholism. In apoplexy. In cerebral anemia. In cerebral meningeal hemorrhage. In chronic hydrocephalus. In epilepsy. In external pachymeningitis. In gastralgia. In hematoma of the dura mater. In hyperemia of the brain. In the opium habit. In tubercular meningitis. In tumors of the brain. Influence on causation of chronic lead poisoning. Diffuse myelitis. Sclerosis. Digestive disorders as a cause of headache. In chronic hydrocephalus. In neurasthenia. In tubercular meningitis. Of chronic alcoholism. Of the chloral habit. Of the opium habit. Symptoms of hysteroepilepsy. Of migraine. Of myxedema. Of tetanus. Of thermic fever. Digitalis, use of, in alcoholism. In epilepsy. In thermic fever. Digiti mortui. Diplopia in disseminated sclerosis. In nervous diseases. In tabes dorsalis. In tumors of the brain. Dipsomania. Disease of one lateral half of the spinal cord. Thomson's. Diseases, mental. Of nervous system, general semiology of. Of peripheral nerves. Of the membranes of the brain and spinal cord. Dislocation in infantile paralysis. Disorders of sleep. Of speech. Dizziness in general paralysis of the insane. Double consciousness in nervous diseases. Vision in nervous diseases. Doubting insanity. Douche, cold, in catalepsy. In ecstasy. In spinal sclerosis. Dreams, C. Dropsy of the head, C. Sleeping. Dura mater, cerebral congestion. Cerebral hematoma of, hemorrhagic pachymeningitis. Definition, etiology, and symptoms. Diagnosis. Duration and pathology. Prognosis. Treatment. Cerebral inflammation of, pachymeningitis. External pachymeningitis. Diagnosis and prognosis. Etiology and symptoms. Pathological anatomy. Treatment. Internal pachymeningitis. Treatment. Spinal, acute inflammation of. Duration of acute mania. Of acute myelitis. Of acute spinal meningitis. Of amyotrophic spinal sclerosis. Of catalepsy. Of chorea. Of chronic hydrocephalus. Of delirium tremens. Of ecstasy. Of family form of tabes dorsalis. Of hematoma of the dura mater. Of hysteria. Of hysteroepilepsy. Of progressive unilateral facial atrophy. Of spina bifida. Of symmetrical gangrene. Of tabes dorsalis. Of tubercular meningitis. Of tumors of the brain. Of the spinal cord. Of vertigo. Of writer's cramp. Dyskinesis, definition. In nervous diseases. Dyslalia. Dyspepsia, headache from. Dyspeptic symptoms of chronic alcoholism. Dysphagia, hysterical. Ear affections, hysterical. Influence on causation of acute pachymeningitis. Of external pachymeningitis. Disorders of, as a cause of abscess of the brain. Of epilepsy. Of vertigo. In progressive unilateral facial atrophy. Middle, disease of. As a cause of thrombosis of cerebral veins and sinuses. Eclampsia. Definition, etiology, and symptoms. Ecstasy. Definition. Course, diagnosis, and duration. Etiology. History and synonyms. Prognosis. Symptoms. Treatment. Eczema as a cause of chorea. Education, improper, as a cause of hysteria. Of speech in aphasia of hemiplegia. Relation of, to hysteria. Electrical reactions in amyotrophic lateral sclerosis. In Bell's palsy. In diffuse sclerosis. In infantile paralysis. In spastic spinal paralysis. Of injured and divided nerves. Electricity, use of, in Bell's palsy. In catalepsy. In chronic lead poisoning. In hysteria. In hysteroepilepsy. In infantile spinal paralysis. In labioglossolaryngeal paralysis. In migraine. In multiple neuritis. In myelitis, acute. In myxedema. In nerve injuries. In neuralgia. In neurasthenia. In neuritis. In painless facial spasm. In paralysis agitans. Of intracranial hemorrhage. In progressive unilateral facial atrophy. In sciatica. In spinal sclerosis. In symmetrical gangrene. In torticollis. In vasomotor neuroses. In writer's cramp. Emboli, source of, in occlusion of cerebral arteries. Embolic origin of abscess of the brain. Theory of origin of chorea. Embolism, capillary. And thrombosis of cerebral arteries. Of spinal cord. Emetics, use of, in alcoholism. In hysteria. Emotional attitudes in hysteroepilepsy. Causes of hysteroepilepsy. State, in general paralysis of the insane. States, abnormal, in nervous diseases. Strain, influence on causation of insanity. Emprosthotonos in tetanus. Encephalitis, acute, of strumple. Encephalic mass. Localization of lesions in. Endocarditis, ulcerative, as a cause of abscess of the brain. As a cause of capillary embolism. Encephalopathy, of chronic lead poisoning. Enchondromatous brain tumors. Enophthalmos in progressive unilateral facial atrophy. Enterocolitis of infancy, relation to thermic fever. Epilepsy. Definition and history. Diagnosis. From syncope. From vertigo. From uremic convulsions. In children. In malingerers. Etiology. Age and sex, influence on causation. Exanthemata, relation of, to. Eccentric irritating causes. Exciting causes. Gastric causes. Peripheral origin. Preputial irritation as a cause. Reflex causes. Sexual causes. Syphilis, influence on causation. Toxic causes. Traumatic causes. Morbid anatomy and pathology. Alterations of cerebral tissue in. Huglings-Jackson's cortical theory. Medullary theory of origin. Theory of epileptic zones. Prodromata. Oral, characters of. Cerebral disturbances. Cutaneous disorders. Hearing and vision, disorders of. Motor disturbances. Saliva, increase of. Prognosis. Age, influence on recovery. Menstruation, marriage, and pregnancy, influence on recovery. Symptoms. Frequency of attacks. Of immediate and remote effects of paroxysms. Physical. Post-epileptic aphasia. Psychical. Tendency to mania in. Of irregular forms. Of light attacks, or petit mal. Of major attacks. Convulsions, characters. Cutaneous state, in. Duration of attacks. Eyes, state of, in. Pulse and temperature in. Tendon reflexes in. Tongue biting, significance. Urine, state of. Of psychical or masked forms. Of sensory epilepsy. Hallucinations in. Synonyms. Treatment. Abortants, use. Amyl nitrite, use. Belladonna and ergot, use. Blisters, use. Bromide, use of. Bromate of potassium, use. Cod liver oil and hypophosphites, use. Diet in. Digitalis, use. Galvanism, use. Iodide of potassium, use. Nitroglycerin, use. Of status epilepticus. Strychnia. Use. Surgical measures. Epilepsy, alcoholic. Influence on causation of migraine. Epileptic attacks in cerebral syphilis. Following hemiplegia. Epileptic insanity. Epileptiform facial neuralgia. Epistaxis in tumors of the brain. Ergot, use of. In acute myelitis. In acute spinal meningitis. In cerebral hyperemia. In epilepsy. In migraine. In infantile spinal paralysis. In insanity. In spinal hyperemia. Meningeal hemorrhage. Ergodin, use of, in spinal sclerosis. Erotomania. Eruptions in nervous diseases. Simulated, in hysteria. Erysipelas as a cause of cerebral hyperemia. Of thrombosis of cerebral veins and sinuses. Erythema, local, in symmetrical gangrene. Erythromelalgia. Essential vertigo. Ether. Habitual addiction to. Use of, in chorea. In neuralgia. In tetanus. Etiology of abscess of the brain. Of acute simple meningitis. Of acute spinal meningitis. Of alcoholism. Of atrophy of the brain. Of Bell's palsy. Of capillary embolism. Of catalepsy. Of cerebral anemia. Of cerebral hyperemia. Of cerebral meningeal hemorrhage. Of chorea. Of chronic hydrocephalus. Lead poisoning. Of combined forms of sclerosis. Of congestion of the cerebral pia mater. Of spinal membranes. Of diseases of cervical sympathetic. Of disseminated sclerosis. Of eclampsia. Of ecstasy. Of epilepsy. Of external pachymeningitis. Of family form of tabes dorsalis. Of general paralysis of the insane. Of hematoma of dura mater. Of hypertrophy of the brain. Of hysteria. Of hysteroepilepsy. Of infantile spinal paralysis. Of insanity. Of intracranial hemorrhage and apoplexy. Of labioglossolaryngeal paralysis. Of neural disorders of writers and artisans. Of migraine. Of multiple neuritis. Of myxedema. Of neuralgia. Of neurasthenia. Of neuritis. Of neuromata. Of occlusion of cerebral arteries. Of progressive unilateral facial atrophy. Of sciatica. Of spastic spinal paralysis. Of spina bifida. Of spinal hemorrhage. Of spinal hyperemia. Of spinal meningeal hemorrhage. Of symmetrical gangrene. Of tabes dorsalis. Of tetanus. Of tetanus neonatorum. Of the chloral habit. Of the opium habit. Of thermic fever. Of thrombosis of cerebral veins and sinuses. Of torticollis. Of tubercular meningitis. Of tumors of the brain. Of the spine. Of vertigo. Of writer's cramp. General, of syphilitic affections of nerve centers. Exaltation, in nervous diseases. Exanthemata, as a cause of epilepsy. Of vertigo. Excesses, influence on causation of general paralysis of the insane. Of insanity. Excision of the tumor in spina bifida. Exciting causes of insanity. Exercise, necessity of, in hysteria. Exhausting diseases as a cause of cerebral anemia. Of tremor. Exhaustion, insomnia from. Exposure to cold and wet as a cause of tabes dorsalis. Eye affections, hysterical. In progressive unilateral facial atrophy. Eye strain, headache from. Eyes, state of, in cerebral hemorrhage and apoplexy. In chronic hydrocephalus. In epilepsy. In tubercular meningitis. Disorders of, as a cause of vertigo. In cerebral anemia. Hyperemia. In diseases of cervical sympathetic. In disseminated sclerosis. In tabes dorsalis. In the chloral habit. In the opium habit. In tumors of the brain. F. Facial atrophy, unilateral progressive. Expression in Bell's palsy. In cerebral hemorrhage and apoplexy. In chorea. In paralysis agitans. Nerve, paralysis of, in atrophic spinal paralysis. Nerve, peripheral paralysis of, Bell's palsy. Diagnosis. Etiology. Symptoms. Facial expression. Muscles and organs affected. Reactions, electrical, in. Special senses and sensibility in. Treatment. Bleeding and counterirritation in. Electricity. Iodide of potassium. Mechanical appliances and massages. Neuralgia. Epileptiform. Spasm, painless. Facies hysterica. Faith cure. Family form of tabes dorsalis. Phoratic reactions, significance, in diagnosis of nervous lesions. Fasting girls. Saints. Fatty heart, in chronic alcoholism. Febrile insomnia. Feeding, forced, in neurasthenia. Feet, condition of, in advanced tabes dorsalis. In diffuse sclerosis. Festination in paralysis agitans. Fever, thermic. And cerebral anemia. Fibrillary contractions in nervous diseases. Fifth nerve, neuralgias of. Flexibility, wax-like, in catalepsy. Fontanelles, state of, in chronic hydrocephalus. In tubercular meningitis. Frauds of hysterical patients. Frequency of epileptic attacks. Friedreich's disease. Front tap. In diffuse spinal sclerosis. Functional nervous diseases, diagnosis of. G. Gait in chronic lead poisoning. In diffuse sclerosis. In general paralysis of the insane. In paralysis agitans. In spastic spinal paralysis. In tabes dorsalis. Galvanic reactions, significance of, in diagnosis of nervous lesions. Galvanism. Use in insanity. Ganglionic elements, condition of, in abscess of the brain. Gangrene in vasomotor neuroses. Definition, history, and synonyms. Duration, course, and nature. Etiology and diagnosis. Of Raynaud's disease. Prognosis. Symmetrical. Symptoms. Treatment. Electricity. Massage, rest, and tonics, use. Opium, use. Gastric crises in tabes dorsalis. Disorders, as a cause of epilepsy. Vertigo. Gastralgia, c. Gelsemium, use, in neuralgia. In painless facial spasm. General paralysis of the insane. Genital organs, disorders of, in chronic alcoholism. Genitourinary disorders of the chloral habit. Of the opium habit. Genius, relations of, to insanity. Glandular system, atrophy of. Gliomatous tumors of the brain. Gold, use of, in hemiplegia. And sodium chloride, use of, in hysteria. Gout, relation of, to chronic lead poisoning. To hysteria. Guarana, use, in migraine. Gummatous brain syphilis. Brain tumors. Gums, state of, in chronic lead poisoning. Gustatory sensory disturbances in nervous diseases. Gymnastics, value of, in hysteria. In writer's cramp. Gynecological treatment of hysteria. H. Habit, influence on causation of alcoholism. Opium and kindred affections. Hematoma of the dura mater. Hematorachis. Hair, changes in progressive unilateral facial atrophy. Hallucinations in alcoholism. In cerebral anemia. Hyperemia. In delirium tremens. In hysteroepilepsy. In nervous diseases. In the opium habit. Handwriting in general paralysis of the insane. In paralysis agitans. Head, changes in chronic hydrocephalus. Retraction of, in acute simple meningitis. Retraction of, in tubercular meningitis. Headache. Diagnosis. Duration. Symptoms. From dyspepsia. From eye strain. From sunstroke. Of anemic and congestive form. Of hysterical and toxic form. Of organic and neurasthenic form. Of rheumatic. Pyrexial and syphilitic form. Of sympathetic form. Synonyms. Treatment. Headache in abscess of the brain. In acute simple meningitis. In anemia of the brain. In cerebral anemia. Meningeal hemorrhage. Syphilis. In children. In chronic cerebral meningitis. In external pachymeningitis. In hematoma of the dura mater. In hyperemia of the brain. In the chloral habit. In the opium habit. In thermic fever. In tubercular meningitis. In tumors of the brain. Spinal cord. Periodical or sick. Head pressure, sense of, in cerebral hyperemia. Hearing, disorders of, in alcoholism. In Bell's palsy. In cerebral hyperemia. In hemiplegia. In neuralgia. In progressive unilateral facial atrophy. In tumors of the brain. Heart, disorders of, in angina pectoris. In chronic alcoholism. In disease of cervical sympathetic. In labioglossolaryngeal paralysis. In neurasthenia. In tabes dorsalis. In the chloral habit. In the opium habit. Influence on causation of embolism and thrombosis of cerebral veins. Of intracranial hemorrhage and apoplexy. Heat, affections produced by exposure to. Heat exhaustion. Pathology and treatment. Heat, use of, in concussion of the spine. Hebephrenia. Hemianesthesia, hysterical. Hemianopsia in nervous diseases. In tumors of the brain. Hemicrania angioparalytica. Spastica. Hemiparaplegia in nervous diseases. Hemiplegia, hysterical. In cerebral hemorrhage and occlusion of cerebral vessels. In cerebral meningeal hemorrhage. In infantile spinal paralysis. Varieties in nervous diseases. Hemispasm in nervous diseases. Hemorrhage as a cause of cerebral anemia. Cerebral meningeal. Intracranial. Spinal meningeal. Hemorrhages of spinal cord. Hemorrhagic pachymeningitis. Hepatitis, parenchymatous and interstitial, in chronic alcoholism. Hereditary alcoholism. Ataxia. Tabes. Heredity, influence on causation of alcoholism. Of angina pectoris. Of cerebral hyperemia. Of chorea. Of chronic hydrocephalus. Of copodyskinesia. Of epilepsy. Of general paralysis of the insane. Of hysteria. Of insanity. Of intracranial hemorrhage and apoplexy. Of migraine. Of neuralgia. Of syphilitic affections of nerve centers. Of tabes dorsalis. Of tremor. Of tubercular meningitis. Of tumors of the brain. History of alcoholism. Of catalepsy. Of chorea. Of chronic lead poisoning. Of ecstasy. Of epilepsy. Of general paralysis of the insane. Of hysteria. Of hysteroepilepsy. Of insanity. Of labioglossolaryngeal paralysis. Of neural disorders of writers and artisans. Of progressive unilateral facial atrophy. Of spina bifida. Of symmetrical gangrene. Of tabes dorsalis. Of the opium habit. Of tubercular meningitis. Home, removal from, question of, in treatment of opium and chloral habit. Home treatment of the insane. Homicidal insanity. Huglings-Jackson on origin of epilepsy. Hydrobromic acid, use, in epilepsy. Hydrocele, spinal. Hydrocephalus, chronic. Definition and synonyms. Diagnosis. Duration. Etiology. Pathological anatomy and prognosis. Spurious, in cerebral anemia. Symptoms. Treatment. By compression. By evacuation of the fluid by puncture. Medicinal. Hydropathic treatment of hysteria. Of neuralgia. Hydrorachis, C. Hygienic treatment of chronic hydrocephalus. Of hemiplegia. Of hysteria. Of neuralgia. Of tubercular meningitis. Hyoscyamine. Use, in painless facial spasm. In torticollis. Hyoscyamus, use, in alcoholism. In brain tumors. In paralysis agitans. In tremor. In tremors of spinal sclerosis. In tubercular meningitis. Hyperemia of the brain. Spinal. Hyperesthesia, hysterical. In acute spinal meningitis. In acute spinal pachymeningitis. In chronic alcoholism. In chronic spinal meningitis. In multiple neuritis. In symmetrical gangrene. In tumors of the brain. Of the spinal cord. Hyperesthesiae, varieties of. In nervous diseases. Hyperkinesis, in nervous diseases. Hypertrophy. Of the brain. Hypnotic catalepsy, hypnotism. Hypnotics, use, in cerebral hyperemia. Hypnotism. Hypochondriacal form of general paralysis of the insane. Insanity. Hypochondriasis. Hypophosphites, use, in alcoholism. In general paralysis of the insane. Hysteria. Course, complications, and duration. Definition. Diagnosis. From acute mania. From general nervousness. From hypochondria. From multiple cerebrospinal sclerosis. From neurotic temperament. From neurasthenia. From spastic spinal paralysis. From spondylitis. From true joint affections. Of hysterical blindness and deafness. Of hysterical paralyses. Etiology. Age. Influence of. Anemia and chlorosis, influence of. Diatheses, gouty and tisical, influence of. Education, influence of. Heredity, influence of. Imitation, influence of. Kidneys, movable, influence of. Local and sexual irritation, influence of. Menstrual disorders, influence of. Race, climate, and social position, influence of. Sex, influence of. History. Pathology. Prognosis. Symptoms. Aphonia. Breathing, peculiarities of. Chorea. Clavis hystericus. Contractures. Convulsions and general spasms. Dysphagia. Ear affections. Erotomania. Eye affections. Facies hysterica. Frauds and deceptions. Insanity. Joint affections. Local spasms. Locomotor ataxia. Mental state. Nymphomania. Pain. Paralyses. Varieties and characters. Phantom tumors. Rectal. Sensorial affections. Simulating pregnancy. Smell and taste, perversion of. Spinal irritation. Temperature and pulse. Urinary secretion, state of. Vaginismus. Vomiting. Synonyms. Treatment. Baths. Use of, in. Bromides, use of. Chloroform, use of. Climatic. Cold, use of. Education, necessity of proper. Electricity, use of. Emetics in controlling seizures. Exercise and gymnastics, use in. Gold and sodium chloride, use of. Gynecological. Question of. Harsh measures, questionable value of. Hydrotherapy in children. Iron and zinc salts, use in. Massage and Swedish movements. Metallotherapy. Mind and faith cures, value of. Mitchell's rest cure. Moral. Musk, valerian, asafoetida. Etc. Nitrite of amyl. Of contractures. Of paralyses. Of paroxysms. Opium, use of. Oophorectomy, question of. Prophylactic and hygienic. Sea bathing in. Hysteria as a cause of disseminated sclerosis. Of vertigo. Distinguished from brain tumors. Hysterical headache. Insanity. Hysteroepilepsy. Definition and synonyms. Diagnosis. From true epilepsy. From simulation. Duration and course. Etiology. Age, influence of. Emotional. Painful menstruation. Sex, race, and climate. History. Pathology. Prognosis. Symptoms. Anesthesia. Contracture. Digestive. Hallucinations. Hysteroepileptogenic zones, significance of. Of contortions and great movements. Of delirium. Of emotional attitudes. Of epileptoid period. Of irregular types. Of regular types. Of paroxysms. Ovarian hyperesthesia. Pressure, effect of. Permanent. Prodromal. Treatment. Compression of nerve trunks. Electricity, use of. Metallic salts, use of. Metallotherapy. Nitrite of amyl and nitroglycerin. Oophorectomy. Question of. Potassium bromide, use of. Torsion of abdominal walls to arrest paroxysms. Varieties. Ice, use of, in acute simple meningitis. In cerebral meningeal hemorrhage. In neuritis. In tubercular meningitis. Idiocy, intellectual and moral. Ill health, influence on causation of insanity. Illusions in nervous diseases. Imbecility. intellectual and moral. In inflammation of the brain. Imitation, influence on causation of catalepsy. Of hysteria. Impotence in tumors of spinal cord. Impulsive insanity. Incoordination in nervous diseases. Inebriety, trance state in. Infantile spinalparalysis. Anatomical lesions. Atrophy of anterior spinal horns, characters, etc. Nerve roots and anterior columns of the cord. Autopsies, tables of. Microscopic lesions. Theories interpreting the lesions of the cord. Regarding origin, premature. Complication with progressive muscular atrophy. Course of. Definitions. Deformities of atrophic paralysis. Criticism of theory of muscular antagonism. Dislocations in. Mechanism of. Muscular contraction in. Relation of weight and muscular forces. Diagnosis. From cerebral paralysis. From diphtheritic paralysis. From diseases of bony skeleton and articulations. From hematomyelitis. From lesions of peripheral nerves. From progressive muscular atrophy. From pseudoparalysis of syphilitic children. Of special paralysis. Atrophy in. Loss of phoratic contractility. Negative symptoms. Temperature of skin. Etiology. Blood poisons, influence of. Cold, influence of. Traumatism, influence of. History, clinical, summary of. Invasion, mode of. Pathogeny. Consequence of limitation of the myelitis to anterior horns of spinal cord. Relation between limitation of the myelitis and age. Trophic lesions of. Prodromata. Acute specific and apparatic diseases. Convulsions. Fever, duration of. Hemiplegia. Immunity of certain muscles and nerves. Paralysis, characters of. Crossed, and paralysis of trunk. Locality of permanent. Of facial nerve. Significance and original extent of. Paralyzed muscles, combinations of. Prognosis. Special paralyses. Influence on locomotion. Symptoms in detail. Synonyms. Treatment. Belladonna, use. Counterirritation. Electricity. Ergot. Heat, use of. Ice. Iodide of potassium. Locomotion, importance of maintenance of. Massage and Swedish movements. Mechanical appliances. Stretching and manipulation of contracted and atrophied muscles. Strychnia, use of. Tenotomy, indications for. Inflammation as atrophic neurosis. Of brain. Of external surface of dura mater of brain. Of nerves. Of the dura mater of the brain. Injuries, influence on causation of intracranial hemorrhage and apoplexy. Of peripheral nerves. Insane, acute alcoholism in the. Cataleptic phenomena in. Temperament, peculiarities of. Insanity, see also. Alcoholic. Cerebral syphilitic. Chronic alcoholic. Circular. Doubting. Epileptic. From gross cerebral lesions. Homicidal. Hypochondriacal. Hysterical. Impulsive. Increase of, question of. Influence on causation of hematoma of the dura mater. Of the opium habit. Menstrual. Moral. Of childhood. Of lactation. Primary. Primary, confusional and delusional. Periodic. Puerperal. Secondary, delusional. Suicidal. Syphilitic. Terminations of, in delirium tremens. Transitory. Insomnia. In cerebral anemia. In delirium tremens. In the chloral habit. In the insane, treatment. In the opium habit. Intellect, state of, in alcoholism. In symmetrical gangrene. Intellectual pursuits, as a cause of intracranial hemorrhage and apoplexy. Intercostal neuralgia. Intermarriage, influence on causation of insanity. Intermittent neuralgia of supraorbital nerve. Intestines, disorders of, in chronic alcoholism. Intracranial hemorrhage and occlusion of cerebral vessels, apoplexy. Softening of the brain, cerebral paralysis. Atheroma of the cerebral arteries. Diagnosis. Prophylaxis and treatment. Capillary embolism. Diagnosis. Etiology and morbid anatomy. Prognosis and treatment. Symptoms. Intracranial hemorrhage. Appearances of old. Clots, characters of, and changes in. Definition of apoplexy. Etiology. Age. Alcohol. Apoplectic constitution, characteristics of. Bright's disease. Exciting causes. Heart disease. Heredity and sex. Intellectual pursuits. Narcotic poisons. Obstruction to circulation. Season. Situation of. Traumatism. Miliary aneurysms, causes, seat, and characters of. Pathology of hemorrhagic apoplexy. Symptoms. Consciousness, loss of, onset and degrees of. Temporary loss of. Significance and causes of. Eyes, state of. Facial expression. Headache and paresthesia as premonitory signs. Hemiplegia. Mental disturbances and aberrations of special senses. Muscular relaxation. Paralysis. Pulse, state of. Respiration. Retinal hemorrhages. Sensibility, state of. Speech. Sphincters, state of. Swallowing. Temperature. Tongue, state of. Vertigo, significance of. Vomiting. Vessels, cerebral, state of, in. Occlusion of the cerebral arteries. Diagnosis between hemorrhage, embolism, and thrombosis. From apoplectiform attacks of intracranial syphilis. From comatose form of pernicious intermittent fever. From diabetic coma and sunstroke. From epilepsy. From hysteria. From injuries to the head. From meningitis of the vertex. From narcotic poisoning. From uremia. Localization of lesions in. Etiology. Age, influence of. Heart and arteries, disease of. Heart weakness and hemic dyscrasia. Morbid anatomy. Cerebral substance, changes in, produced by emboli and thrombi. Emboli and thrombi, seat of. Source of. Regions of brain usually involved in softening. Prognosis. Symptoms. Aphasia. Arthropathies. Atrophy, muscular. Chorea, post-paralytic. Mental condition. Motor paralysis, duration and course. Reflexes, increased, rigidity in contracture. Sensation, state of. Temperature. Urine, state of. Word blindness. Treatment. Of cerebral embolism. Of attack. Prophylaxis. Of cerebral hemorrhage. Artificial respiration. Bleeding and purgatives. Cleanliness, necessity of. Prophylaxis. Surgical measures. Of cerebral thrombosis. Of paralysis and later symptoms. Electricity, use of. Iodide of potassium and phosphorus. Use. Massage, use. Silver, gold, and strychnia, use. Re-education of faculty of speech. Softening of the brain. Thrombosis of the cerebral veins and sinuses. Diagnosis. Localization of the thrombus. Etiology. Age. Anemia, simple, as a cause. Carbuncles and erysipelas as a cause. Ear, diseases of Marantic form. Special diseases most likely to result from. Prognosis. Symptoms. Dependent on disturbances of cerebral function. Dependent on congestion and compression of other structures. Treatment. Ammonia, use of. Prophylactic. Surgical measures. Iodide of potassium, use of, after intracranial hemorrhage and apoplexy. In acute spinal meningitis. In Bell's palsy. In cerebral meningeal hemorrhage. Syphilis. In chronic cerebral meningitis. In chronic lead poisoning. In epilepsy. In general paralysis of the insane. In hematoma of dura mater. In multiple neuritis. In neuritis. In spinal sclerosis. In thrombosis of cerebral veins and sinuses. In tubercular meningitis. Iodine, injection of, into sac of spina bifida. Use of, in acute spinal meningitis. In chronic spinal meningitis. An iodide of potassium, use of, in spinal meningeal hemorrhage. Iridoplegia in tabes dorsalis. Iron. Use of, in alcoholism. In catalepsy. In chorea. In chronic hydrocephalus. In hysteria. In hysteroepilepsy. In neuralgia. In spinal meningeal hemorrhage. In tubercular meningitis. Irritability in tubercular meningitis. Irritable breast of Astley-Cooper. Irritation, local, influence on causation of hysteria. J. Jaw reflex, in amyotrophic lateral sclerosis. Jerking malady, hysterical nature of. Joint affections, hysterical. In tabes dorsalis. Of chronic lead poisoning. Jumpers, the hysterical nature of. Jumping chorea. K. Catatonia. Kidneys, disorders of, in chronic alcoholism. In the chloral habit. In the opium habit. Movable, as a cause of hysteria. Kinesiotic system of encephalon, lesions. Of spinal cord, localization of lesions in. Kleptomania. Knee jerk. Alterations, in general paralysis of the insane. In amyotrophic lateral sclerosis. In chorea. In diffuse spinal sclerosis. In disseminated sclerosis. In epilepsy. In hemiplegia. In nervous diseases. In spastic spinal paralysis. In spinal syphilis. In tabes dorsalis. In the chloral habit. In tumors of the spinal cord. Significance in diagnosis of hysteria. L. Lactation, prolonged, as a cause of epilepsy. Labioglossolaryngeal paralysis, progressive. Definition. Diagnosis. Etiology. History. Pathological anatomy. Symptoms. Articulation, difficulty of, characters of. Deglutition, difficult. Facial expression. Heart, disorders of. Paralysis and atrophy of muscles of neck and extremities. Respiration, disturbances of. Tongue, condition of. Synonyms. Treatment. Diet. Electricity. Metallic salts and quinine. Language, development of. Laryngeal vertigo. Larynx, disorders and lesions of, in chronic alcoholism. Lateral sclerosis. Lead, mode of action of, in the system. Lead poisoning, chronic. Channels of introduction into body. Classification, definition, and history. Diagnosis. Etiology. Age, sex, and diet, influence of. Exciting causes. Occupation, influence of. Season and climate, influence of. Morbid anatomy and pathology. Prognosis. Symptoms. Albuminuria in. Amaurosis in. Bluish line upon gums. Significance of. Disturbances of nutrition. In animals. Of lead colic. Of the arthralgia. Of the encephalopathy. Of the paralysis. Synonyms. Treatment. Alum, use. Electricity in massage, use. Opium, use, in colic. Potassium iodide, use. Prophylaxis. Sulfuric acid and magnesium sulfate, use. Lead tremors. Leptomeningitis, cerebral. Spinal. Lesions in the nervous system, localization of. Lethargy. In cerebral anemia. Lucid. Levenstein's method of treating the opium habit. Ligation of the sac of spina bifida. Lipomatous tumors of the brain. Lithemic insomnia. Liver, changes in, and disorders of, in chronic alcoholism. Local convulsive disorders. Localization of functions of spinal cord, table showing. Localization of lesions in the nervous system. Craniocerebral topography. In base of brain. In cerebellum. In encephalic mass. In medulla oblongata. In peripheral nervous system. In spinal cord. Localization of abscess of the brain. Of cerebral hemorrhage and embolism. Of thrombosis of cerebral veins and sinuses. Of tumors of the brain. Of the spine. Lock spasm of writer's cramp. Locomotion, influence of special paralyses of, in infantile spinal paralysis. Locomotor ataxia. Hysterical. Lordosis in atrophic infantile paralysis. Lumbo-abdominal neuralgia. Lungs, disorders of, in chronic alcoholism. In the opium habit. Lupulin, use of, in the opium habit. M. Magnesium sulfate, use of, in chronic lead poisoning. Main N. Griff in chronic spinal pachymeningitis. Malaria as a cause of cerebral anemia. Influence of, on the causation of chorea. Malarial epilepsy. Neuralgias. Male sex. Prevalence of hysteria in. Malnutrition of brain in infants. Malt liquors, characters of intoxication from. Mammillary neuralgia. Mania. Chronic. Following epilepsy. In alcoholism. Maniacal excitement in general paralysis of the insane. Form of acute alcoholism. Of general paralysis of the insane. Marriage, influence on recovery from epilepsy. Question of, in the insane temperament. Massage, use of, in hemiplegia. In hysteria. In infantile spinal paralysis. In lead palsy. In melancholia. In neuralgia. In neurasthenia. In progressive unilateral facial atrophy. In symmetrical gangrene. In vasomotor neuroses. In writer's cramp. Mastoid cells, inflammation of, as a cause of thrombosis of cerebral veins and sinuses. Masturbation, influence on causation of cerebral anemia. Of epilepsy. Of insanity. In the insane, treatment of. Of hysteria, treatment of. Mechanical appliances, use of, in infantile spinal paralysis. In writer's cramp. Restraint and treatment of the insane. Medulla oblongata, degeneration of, in labioglossolaryngeal paralysis. Localization of lesions in. Medullary centers of the vasomotor system. Megalopsia in nervous diseases. Melancholia. Agitata. Cerebral nutrition in alcoholism. In children. In general paralysis of the insane. Membranes, spinal, congestion of. Memory, loss of, significance of, in nervous diseases. Meniere's disease. Meningeal cerebral hemorrhage. Diagnosis. Etiology. Pathological anatomy. Prognosis. Symptoms. Synonyms. Treatment. Meningeal spinal hemorrhage. Meningitis, acute. And chronic, following thermic fever. Spinal. Chronic spinal. Meningitis, tubercular. Definition, synonyms, and history. Diagnosis. From acute simple meningitis. From eclampsia. From gastrointestinal affections. From hydrancephaloid disease. From typhoid fever. Etiology. Age and sex, influence of. Exciting causes. Hereditary tendency to tuberculosis and scrofulоsis. Season, influence of. Pathological anatomy and duration. Prophylaxis. Prognosis. Symptoms. Abdomen, state of. Cerebral. Constipation. Cry. Decubitus. Eyes, state of. Headache. In the adult. Paralysis and convulsions. Prodromal. Pulse, respiration. And temperature. Pupils, state of. Sensitiveness to light. Strabismus. Stupor. Tongue, state of. Vomiting. Treatment. Bromides, chloral, and hyoscyamus. Counterirritation, value of. Diet in. Iodide of potassium, use. Menorrhagia and amenorrhea in the insane, treatment of. Menstrual disorders, influence on causation of hysteria. In the opium habit. Insanity. Menstruation, influence on recovery from epilepsy. On causation of cerebral hyperemia. Of spinal hyperemia. Painful, influence on causation of hysteroepilepsy. Mental condition in acute spinal meningitis. In atrophy of the brain. In chorea. In chronic hydrocephalus. In delirium tremens. In disseminated spinal sclerosis. In hemiplegia. In hysteria. In tabes dorsalis. In tumors of the brain. Of the spine. Defects and degeneration, states of. Deterioration, primary. Mental diseases. Insanity. Causation. Age, influence of. Alcohol and nerve stimulants, abuse of. Drugs. Abuse of. Emotions and mental strain. Classification of. Definition of. Diagnosis of. Exciting causes. Heredity. Ill health, disease, etc. Intermarriage. Occupation. Pulmonary consumption, relation to. Sex. Social position. Vicious early training. History. Morbid anatomy and pathology. Prevalence. Prognosis. Mortality. Percentage of recoveries. Treatment. Asylums. Methods of commitment to. Objection to. Question of removal to. Galvanism, use. Home, removal from, question of. Home. Mechanical restraint in. Medicines, value of, in. Of cerebral hyperemia in. Of constipation in. Of insomnia in. Of intercurrent diseases in. Of masturbation in. Of menorrhagia and amenorrhea in. Preventive. Rest and sleep, value of, in. Sedatives and narcotics, use in. Insanity complicating. Insanity from specific poisons. Organic. General paralysis of the insane. Definition. Diagnosis. Etiology. Age and sex. Excesses, influence of. Heredity. Mental shock. Syphilis. History. Morbid anatomy and pathology. Prognosis. Symptoms. Delusions, characters. Mental. Moral sense. Perversion of. Of demented and paralytic form. Of hypochondriacal form. Onset, mode of. Physical symptoms. Ataxia. Bones, state. Gait. Handwriting. Hyperesthesia. Knee-jerk, significance. Pupils, state. Remissions. Sexual functions in. Speech. Alteration in. Urine in. Prodromal. Temperature in. With melancholia. With mania. Synonyms. Treatment. Cod liver oil, use. Ergot, use. Hypophosphites, use. Potassium bromide and iodide, use. Rest and quiet, value. Insanity, chronic alcoholic. From gross lesions of brain. Secondary delusional. Terminal dementia. Treatment. States of mental defect and degeneration. Circular insanity. Constitutional affective mental disease. Prognosis. Treatment. Epileptic insanity. Hypochondriacal insanity. Hysterical insanity. Idiocy. Classification. Impulsive insanity, or instinctive monomania. Dipsomania. Erotomania. Homicidal insanity. Nymphomania and satyriasis. Pyromania and kleptomania. Treatment. Suicidal insanity. Insane temperament. Treatment. Moral insanity. Symptoms. Treatment. Periodic insanity. Primary insanity. Prognosis and treatment. Psychoneuroses. Affective mental disease. Prognosis and treatment. Climacteric insanity. Delirium, acute. Dementia. Primary. Secondary. Treatment. Doubting insanity. Hebephrenia. Treatment. Hypochondriasis. Prognosis and treatment. Insanity of childhood. Catatonia. Mania. Acute. Treatment. Simple. Treatment. Melancholia. Agitata. Duration and prognosis. In children. Simple. Treatment. Asylums, removal to. Narcotics and sedatives, use. Tonics, use. With delusions. With stupor. Menstrual insanity. Primary confusional insanity. Primary delusional insanity. Primary mental deterioration or brain atrophy. Puerperal insanity. Senile dementia. Insanity. Transitory insanity. Mental emotion, influence on causation of neurasthenia. Influences as a cause of cerebral anemia. Shocks. Influence on causation of general paralysis of the insane. Strain, influence on causation of insanity. Symptoms of external pachymeningitis. Of general paralysis of the insane. Mercurial tremor. Mercury, use of, in cerebral hyperemia. In chronic spinal meningitis. In hematoma of the dura mater. In spinal sclerosis. In tetanus. In tubercular meningitis. Metallic salts, use, in catalepsy. In labioglossolaryngeal paralysis. In progressive unilateral facial atrophy. Metallotherapy, use, in hysteria. In hysteroepilepsy. Metastasis as a cause of cerebral abscess. Microcephalism. Migraine. Diagnosis and prognosis. Etiology. Age and sex, influence of. Heredity, influence of. Pathology and morbid anatomy. Symptoms. Circulation, disorders of. Digestive. Pain, seat and character. Paroxysms, characters of. Synonyms. Treatment. Bromides, use. Caffeine and guarana, use. Cannabis indica, use. Climate, change of. Ergot, use. Galvanism, use. In childhood. Indications for. Morphia, use. Muriate of ammonium and chloral, use. Nitrite of amyl and nitroglycerin. Cania, use. Miliary aneurysms, relation of, to cerebral form of encephalitis. Hemorrhage. Tubercles in tubercular meningitis. Seat and character. Mimicry in hysteria. Mind cure in hysteria. Myriacid, the hysterical nature of. Mitchell's rest cure in hysteria. In neurasthenia. Monoplegia, hysterical. In nervous diseases. Monospasm in nervous diseases. Moral insanity. Management of spinal sclerosis. Sense, deterioration of, in chronic alcoholism. Treatment of hysteria. Morbid anatomy of abscess of the brain. Of acute simple meningitis. Of acute spinal meningitis. Of acute spinal myelitis. Of amyotrophic lateral sclerosis. Of cerebral anemia. Of cerebral hemorrhage. Of cerebral hyperemia. Of cerebral meningeal hemorrhage. Of chorea. Of chronic spinal meningitis. Of chronic spinal pachymeningitis. Of congestion of cerebral pia mater. Of congestion of spinal membranes. Of delusional insanity. Of diffuse sclerosis. Of disseminated sclerosis. Of external pachymeningitis. Of family form of tabes dorsalis. Of infantile spinal paralysis. Of insanity. Of internal pachymeningitis. Of neuritis. Of paralysis agitans. Of secondary sclerosis. Of spastic spinal paralysis. Of spina bifida. Of spinal meningeal hemorrhage. Of tabes dorsalis. Of tetanus. Of tubercular meningitis. Morbid anatomy and pathology of chronic lead poisoning. Of epilepsy. Of writer's cramp. Morbid somnolence. Morphia, use, in acute simple meningitis. In cerebral anemia. In hysteria. In migraine. In multiple neuritis. In neuritis. In spinal sclerosis. In thermic fever. In the treatment of the opium habit. In tumors of the brain. In vertigo. Morphia, in progressive unilateral facial atrophy. Morphine habit. Mortality of chorea. Of insanity. Of tetanus. Motility. Disturbances of, in spinal syphilis. Motion, disorders of, in chorea. In chronic alcoholism. In diffuse spinal sclerosis. Motor paralysis in unilateral paralysis of spinal cord. Motor symptoms of thermic fever. Weakness, in spinal hyperemia. Motory symptoms of nervous diseases. Multiple and multiple degenerative neuritis. Diagnosis. Etiology. Nature and history. Pathology. Prognosis. Symptoms. Onset. Pain, characters. Paresis and atrophy of muscles. Sensation, disturbances of. Treatment. Electricity. Morphia. Salicylate of sodium and iodide of potassium. Rest. Multiple cerebrospinal sclerosis. Muscles, atrophy of. Changes in alcoholism. In injuries to peripheral nerves. Degeneration of. In labioglossolaryngеal paralysis. Employed in telegraphy. In writing. Involved in infantile spinal paralysis. Rigidity of, in paralysis agitans. Muscular ataxia, in general paralysis of the insane. Atrophy in chronic spinal pachymeningitis. In nervous diseases. In poisoning by lead. In progressive unilateral facial atrophy. Progressive, complicated with infantile spinal paralysis. Contraction, in acute spinal meningitis. System, state of, in the chloral habit. Rigidity in diffuse spinal sclerosis. Music, use of, in treatment of catalepsy. Musk, use of, in hysteria. Murmurs, valvular, in chorea. Myelitis, simple acute. Ascending and descending. Clinical history. Diagnosis. Influence of poisons on cord. Limitation of inflammatory process. Myelolytic cicatrices. Morbid anatomy. Prognosis and duration. Treatment. Derivation and bloodletting. Electricity. Management of bed sores. Management of bladder troubles. Position. Rest. Strychnia. Warm baths. Myelitis, chronic. In unilateral spinal paralysis. Myxedema. N. Narcolepsy. Narcotic poisoning, acute, from alcohol. Narcotics, influence on causation of catalepsy. Narcotics and sedatives, value, in melancholia. Nature of stigmata. Of symmetrical gangrene. Nausea and vomiting in lead colic. In the opium habit. Neglect, treatment of hysteria by. Nerve centers, syphilitic affections of. Nerve roots, degeneration of, in infantile spinal paralysis. Lesions of, in tabes dorsalis. Nerve section in neuralgia. In tetanus. Nerve stretching in athetosis. In neuralgia. In spinal sclerosis. In writer's cramp. Nerve trunks, lesions, in multiple neuritis. In neuritis. Nerves, inflammation of. Anatomical changes in divided nerves and muscles. Changes in. In chronic alcoholism. Diagnosis of. Divided, pain, seat and characters of. Electrical reactions in. Immediate results of injuries to. Injuries and irritation of, as a cause of neuralgia. Treatment of. Lesions of, in neuralgia. Peripheral diseases of. Changes in chronic alcoholism. Injuries of. Regeneration and reunion of divided nerves and muscles. Sensation, disorders of. Skin, state of. Symptoms of incomplete destruction of. Trophic disorders. Vasomotor, origin of. Nervous diseases, general semiology of. Disorders of chronic hydrocephalus. Of chronic lead poisoning. Of spina bifida. Of the chloral habit. Symptoms of myxedema. System, disorders of, in alcoholism. In the opium habit. Nervous system. Localization of lesions in the craniocerebral topography. In encephalic mass. In systematic lesions. In focal lesions. In base of brain. In cerebellum. In medulla oblongata. In peripheral nervous system. In spinal cord. Of esthesiodic system. Of kinesodic system. Nervous system, general semiology of diseases of. Motory symptoms. Psychic symptoms. Sensory symptoms. Trophic symptoms. Principles of diagnosis in diseases of. In functional diseases of. In organic diseases of. Neuralgia. Definition, general, of. Diagnosis and pathology, general, of. Etiology, general, of. Age and sex. Atmospheric and thermic influences. Constitutional diseases. Injuries and irritation of nerves. Reflex and sympathetic causes. Symptomatology. General. Of migraine. Of superficial neuralgias. Muscles, spasm and atrophy of. Pain, characters and distribution. Periodicity of attacks. Points douloureux. Secreting organs, disorders of. Sensation, altered. Skin, disorders of. Special senses in. Urine, condition. Vision, disorders of. Of visceral neuralgias. Pain, characters. Secretion of visceral organs, disorders of. Treatment, general. Aconite and echinacea, use. Belladonna and atropia, use. Change of climate. Cocaine, use. Counterirritation, use. Diet. Electricity, use. Hydropathy. Hygiene. Injection of water, chloroform, and other substances. Iron, arsenic, and cod liver oil, use. Massage. Neurectomy. Nerve stretching. Opium, use. Phosphorus and gelsemium, use. Turpentine, oil of, use. Use of ammonium sulfate of copper, salicylate of sodium, tonka, caffeine, and sal ammoniac. Varieties, migraine and periodical headache. Etiology and clinical relations. Age and sex. Prognosis. Symptoms. Auras and visual hallucinations. Sensation, disorders of. Pain. Treatment of. Cannabis indica, iodide and bromide of potassium, and caffeine. Diet. Electricity. Nitrite of amyl. Neuralgias of the fifth nerve. Anal and rectal neuralgia and uterine and ovarian neuralgia. Angina pectoris. Cervicobrachial and brachial neuralgia. Epileptiform or tic douloureux. Facial neuralgia, ordinary. Treatment. Gastralgia. Intercostal neuralgia. Intermittent neuralgia of the supraorbital. Lumbo-abdominal neuralgia. Mammillary neuralgia, irritable breast of Astley-Cooper. Occipito and cervico-occipital neuralgias. Sciatica. Treatment. Visceral neuralgia. Neuralgia complicating progressive unilateral facial atrophy. Neuralgias in tumors of the brain. Neuralgic pains in hemiplegia. NURSTHNIA, definition. Etiology. Symptoms. Digestive disorders. Heart disorders. Muscular strength, loss of. Of brain exhaustion. Sensation and special senses, disturbances of. Sexual disorders. Vasomotor disturbances. Treatment. Change of climate. Rest cure, method of carrying out. Neurasthenia as a cause of vertigo. Neurasthenic headache. Neuritis. Etiology. Diagnosis. Morbid anatomy. Symptoms. Motor. Pain, characters. Reflex paralyses. Trophic. Sensation, altered. Treatment. Counterirritation in. Galvanism. Morphia in. Salicylate of sodium and iodide of potassium. Neuritis as a result of neuralgia. Neuromata. Definition. Diagnosis. Etiology. Heredity and traumatism. Nature, varieties, etc. Symptoms. Treatment. In tumors of the brain. neuromimesis, neuroretinitis in tubercular meningitis, and optic neuritis in tumors of the brain, neuroses, trophic, vasomotor, nickel bromide, use, in epilepsy, night terrors, nitroglycerin, use, in catalepsy, in epilepsy, in hysteroepilepsy, in migraine, in myxedema, in vasomotor neuroses, numbness and formication in nervous diseases, and tingling in hysteria. Nutrition, bad, influence on causation of catalepsy. Disturbances of. In chronic lead poisoning. Nymphomania. In hysteria. Nystagmus in disseminated sclerosis. In family form of tabes dorsalis. O. Obesity and alcoholism. Occipital neuralgia. Occupation, influence on causation of alcoholism. Of chronic lead poisoning. Of hysteria. Of the opium habit. Ocular causes of vertigo. Edema as a complication of cerebral anemia. In thrombosis of cerebral veins and sinuses. Olfactory sensory disturbances in nervous diseases. Onset of epileptic fit, mode of. Of tetanus, mode of. Opisthotonos in acute spinal meningitis. In hysteroepilepsy. In tetanus. In tetanus neonatorum. Opium, abuse of, as a cause of tremor. Opium habit and kindred affections. Cannabis indica, habitual addiction to. Treatment. Chloral habit, the. Diagnosis. Etiology and synonyms. Prognosis. Prophylaxis. Symptoms. Circulatory. Digestive and respiratory disorders. Genitourinary disorders. Muscular system, disorders of. Nervous system, disorders of. Of abrupt discontinuance of drug. Psychical derangements. Skin, disorders of. Treatment. Curative. Chloroform. Habitual addiction to. Treatment. Cocaine, habitual addiction to. Treatment. Ether, habitual addiction to. Treatment. Opium habit, the. Diagnosis. Etiology. Age, sex, occupation, and luxurious habits, influence on causation. Exciting causes. Insanity, influence on causation. Predisposing causes. History. Prognosis. Prophylaxis. Symptoms. Digestive. Genitourinary disorders. Nervous system, derangements of. Of chronic poisoning. Of withdrawal of drug. Physiognomy in. Respiratory and circulatory disorders. Sexual disorders. Temperature in. Synonyms. Treatment. Abrupt withdrawal of drug, Levenstein's method. Alcohol and stimulants, use of. Baths, use. Bromides, chloral, lupulin, and paraldehyde, use of. Coca. Cocaine, and cannabis indica, use of. Curative. Diet in. Gradual diminution of drug. Of digestive disorders. Of nervous symptoms and insomnia. Opium, use of, in. Removal from home, question of. Paraldehyde, habitual addiction to. Treatment. Opium. Use of, in hysteria. In insomnia. In lead colic. In melancholia. In neuralgia. In spinal concussion. In symmetrical gangrene. In tetanus. In the treatment of the morphia habit. In tubercular meningitis. Physiological action of. Ophthalmoscopic appearances in cerebral anemia. In cerebral hyperemia. Examination in tumors of the brain. Optic nerve, atrophy of, in disseminated sclerosis. In tabes dorsalis. Optic sensory disturbances in nervous diseases. Oophorectomy. Question of, in hysteria. In hysteroepilepsy. Organic headache. Mental diseases. Nervous diseases, diagnosis of. Osmic acid, hypodermic use, in neuralgia. Osteomata in tumors of the brain. Osteomyelitis, as a cause of cerebral abscess. Ovarian neuralgia. Pressure, effect of, in hysteroepilepsy. Overexertion as a cause of disseminated sclerosis. Of spinal hyperemia. Overstudy, influence on causation of chorea. Overwork, influence on causation of cerebral hyperemia. Of neurasthenia. Oxygen, inhalations in vasomotor neuroses. P. Pacchionian bodies, seat and nature, in brain tumors. Pachymeningitis. Acute spinal. Chronic spinal. External. Hemorrhagic. Internal. Pain, in angina pectoris. In cerebral syphilis. In diffuse spinal sclerosis. In disseminated sclerosis. In family form of tabes dorsalis. In gastralgia. In hysteria. In injuries of peripheral nerves. In intercostal neuralgia. In lead colic. In hyperemia of the brain. In migraine, seat, characters, and origin of. In multiple neuritis. In nervous diseases, varieties of. In neuritis. In neuromata. In sciatica. In spinal syphilis. In superficial neuralgia. In symmetrical gangrene. In writer's cramp. Influence on causation of the opium habit. Seat and character. In acute spinal meningitis. Spinal pachymeningitis. In chronic spinal meningitis. Spinal pachymeningitis. In external pachymeningitis. In spinal meningeal hemorrhage. In tabes dorsalis. In tubercular meningitis. In tumors of the brain. In tumors of the spinal cord. Pain sense in tabes dorsalis. Painter's colic. Palsy, lead. Pancreas, changes in chronic alcoholism. Paracentesis in chronic hydrocephalus. Of the sac in spina bifida. Paresthesia, hysterical. In migraine. In nervous diseases, general. In progressive unilateral facial atrophy. In spinal syphilis. In spinal hyperemia. Paralalia. Paraldehyde, habitual addiction to. Use, in alcoholism. In the opium habit. Paralysis agitans. Diagnosis. Etiology and morbid anatomy. Symptoms. Synonyms. Treatment. Paralysis, alcoholic. Atrophic, of infants. Cerebral. Festinins. Hysterical. In acute myelitis. In acute spinal meningitis. In atrophy of the brain. In cerebral hemorrhage. Meningeal hemorrhage. Syphilis. In chorea. In chronic hydrocephalus. Spinal pachymeningitis. In encephalitis. In hematoma of the dura mater. In infantile spinal paralysis. In nervous diseases, definition of. In spina bifida. In the chloral habit. In tubercular meningitis. In thrombosis of cerebral veins and sinuses. In tumors of the brain. Of the spinal cord. Labioglossolaryngeal. Localized, in nervous diseases. Of chronic lead poisoning. Of the insane, general. Spinal spastic. Spinal unilateral. Stage of, in writer's cramp. Paraplegia, hysterical. In acute myelitis. In nervous diseases. In tumors of spinal cord. Paraplegic spasm in nervous diseases. Paresis in general paralysis of the insane. And paralysis in multiple neuritis. Paretic dementia of alcoholism. Paroxysms of epilepsy, characters of hysteroepilepsy, characters of vertigo, characters. Patellar reflex, alterations of, in acute myelitis. In amyotrophic lateral sclerosis. In chorea. In diffuse sclerosis. In disseminated, cerebrospinal, sclerosis. In epilepsy. In general paralysis of the insane. In hemiplegia. In spastic spinal paralysis. In spinal syphilis. In tabes dorsalis. In tumors of the spinal cord. Significance in diagnosis of hysteria. Tendon reflex in nervous diseases. Pathogenesis of vasomotor neuroses. Of infantile spinal paralysis. Pathological action of alcohol. Anatomy of acute alcoholism. Pathology of athetosis. Of brain syphilis. Of diseases of cervical sympathetic. Of catalepsy. Of chorea. Of chronic hydrocephalus. Lead poisoning. Of hysteria. Of hysteroepilepsy. Of insanity. Of neuralgia. Of progressive unilateral facial atrophy. Of tremor. Of tubercular meningitis. Of tumors of brain. Of spinal cord. And morbid anatomy of atrophy of the brain. Of general paralysis of the insane. Of hematoma of the dura mater. Of hypertrophy of the brain. Of labioglossolaryngeal paralysis. Of migraine. Of multiple neuritis. Of spina bifida. Of unilateral spinal paralysis. Perforating ulcer of the foot. Periodic insanity. Periodicity of attacks of migraine. Of neuralgias. Peripheral causes of epilepsy. Nerves, diseases of. Injuries of. Nervous system, localization of lesions in. Pernicious anemia, cerebral symptoms in. Petit mal, symptoms of. Phantom tumors, in hysteria. Phosphorus, use. In neuralgia. In paralysis agitans. In sequelae of intracranial hemorrhage. Photophobia in cerebral hyperemia. Phthisis, influence of alcoholism on production of. Of neuralgia. Relation of, to hysteria. To mental diseases. Physicians. Responsibility of, in the formation of the opium habit. Physiognomy of acute alcoholism. Of acute simple meningitis. Of delirium tremens. Of labioglossolaryngeal paralysis. Of the opium habit. Of tubercular meningitis. Physiological action of alcohol. Physiology of dreams. Of spastic spinal paralysis. Of speech. Of tabes dorsalis. Of the vasomotor neuroses. Pia mater, cerebral, chronic inflammation of, chronic cerebral meningitis. Congestion of. Symptoms. Morbid anatomy, and treatment. Inflammation of, acute leptomeningitis. Diagnosis and pathological anatomy. Duration and course. Etiology and synonyms. Prognosis. Symptoms. Treatment. Bleeding in. Counterirritation, use. Diet in. Morphia, chloral. Bromides, etc. Use in. Kinea, use in. Pigment scales and flakes, as a cause of capillary embolism. Pilocarpine, use, in myxedema. Pisidia, use, in alcoholism. Pleury, disorders of, in chronic alcoholism. Pneumonia, in alcoholism. Points douloureux. In neuralgia. Poisoning of blood, influence on causation of infantile paralysis. Polyneuritis. polyuria in cerebral syphilis. In hemiplegia. In tumors of the brain. Porencephaly. Position, influence of, in cerebral anemia. Post-epileptic aphasia. Post-febrile insanity in cerebral anemia. Post-mortem examination, methods of, in tumors of the brain. Post-paralytic chorea. Posterior columns, lesions of, in tabes dorsalis. Posterior spinal sclerosis. Pregnancy. Influence, on causation of chorea. On recovery from epilepsy. Simulation of, in hysteria. Pregnant women, occurrence of hysteria among. Preputial irritation as a cause of epilepsy. Prevalence of insanity. Prevention of insanity. Of intracranial hemorrhage, and apoplexy. Of tetanus neonatorum. Priapism in tumors of spinal cord. Prodromal symptoms of acute simple meningitis. Of tubercular meningitis. Prodromata of acute myelitis. Of disseminated sclerosis. Of epilepsy. Of general paralysis of the insane. Of infantile spinal paralysis. Of intracranial hemorrhage and apoplexy. Prognosis of acute simple meningitis. Spinal meningitis. Spinal pachymeningitis. Of alcoholism. Of amyotrophic lateral sclerosis. Of apoplexy, cerebral hemorrhage, etc. Of athetosis. Of catalepsy. Of cerebral abscess. Of cerebral meningeal hemorrhage. Syphilis. Of chorea. Of chronic hydrocephalus. Lead poisoning. Spinal meningitis. Of constitutional affective mental disease. Of diffuse spinal sclerosis. Of ecstasy. Of epilepsy. Of external pachymeningitis. Of general paralysis of the insane. Of hematoma of the dura mater. Of hypertrophy of the brain. Of hysteria. Of hysterical insanity. Of hysteroepilepsy. Of hypochondriasis. Of infantile spinal paralysis. Of insanity. Of labioglossolaryngеal paralysis. Of melancholia. Of migraine. Of multiple neuritis. Of peripheral anesthesia. Of primary delusional insanity. Of progressive unilateral facial atrophy. Of spina bifida. Of spinal concussion. Of spinal meningeal hemorrhage. Of symmetrical gangrene. Of tetanus. Of tetanus neonatorum. Of the chloral habit. Of the opium habit. Of thrombosis of cerebral veins and sinuses. Of torticollis. Of tremor. Of tubercular meningitis. Of tumors of the brain. Of the spine. Of unilateral spinal paralysis. Of vasomotor neuroses. Of vertigo. Of writer's cramp. Progressive muscular atrophy in chronic lead poisoning. Progressive unilateral facial atrophy. Definition, synonyms. And history. Diagnosis. Duration, termination, and complications. Etiology. Symptoms. Atrophy, seat and characters. Perspiration, modifications of. Pulsation of carotids, weakness of. Sensation, modifications of. Skin and hair, changes in. Special senses, state of. Temperature of affected parts. Treatment and prognosis. Prophylaxis of abscess of the brain. Of alcoholism. Of cerebral hemorrhage and apoplexy. Of chronic lead poisoning. Of hysteria. Of the chloral habit. Of the opium habit. Of thermic fever. Of thrombosis of cerebral veins and sinuses. Of tubercular meningitis. Of writer's cramp. Propulsion in paralysis agitans. Psammomata in tumors of the brain. Pseudoparalysis in nervous diseases. Psychic causes of epilepsy. Symptoms of nervous diseases. Psychical derangements of chronic alcoholism. Of the chloral habit. Symptoms of syphilis of the brain cortex etc. Psychoneuroses, c. Ptosis, hysterical. In tabes dorsalis. Puberty, influence on causation of catalepsy. Of migraine. Influence on cerebral anemia. Puerperal insanity. Tetanus. Pulmonary consumption, relation to mental diseases. Pulsation of carotids, weakness of. In progressive unilateral facial atrophy. Pulse, state of, in acute alcoholism. In acute simple meningitis. In acute spinal meningitis. In catalepsy. In cerebral anemia. In cerebral hemorrhage and apoplexy. In chorea. In concussion of the brain. In epilepsy. In hematoma of the dura mater. In hysteria. In migraine. In tetanus. In the chloral habit. In the opium habit. In thermic fever. In tubercular meningitis. And respiration in delirium tremens. Pupils, dilatation of, in migraine. Cause of. Hysterical dilatation of. In acute simple meningitis. In cerebral anemia. In chronic hydrocephalus. In concussion of the brain. In diseases of the cervical sympathetic. In disseminated sclerosis. In epileptic fit. In general paralysis of the insane. In tabes dorsalis. In tubercular meningitis. Loss of reflex of, in nervous diseases. Pus, characters of, in abscess of the brain. Pyramidal tract, derangements of, in amyotrophic lateral sclerosis. Pyromania. Q. Chania, use of, in acute simple meningitis. In alcoholism. In chronic lead poisoning. In intermittent neuralgia of supraorbital. In labioglossolaryngeal paralysis. In migraine. In neuralgia. In paralysis agitans. In sciatica. In spinal meningeal hemorrhage. In thermic fever. In vertigo. R. Race, influence on causation of chorea. Of hysteria. Of hysteroepilepsy. Of thermic fever. Railway sickness. Rectum, hysterical disorders of. Reflex causes of epilepsy. Of neuralgia. Irritability, changes in catalepsy. Irritation as a cause of catalepsy. Of chorea. Movements, abnormal, in nervous diseases. Of patellar tendon in nervous diseases. Paralyses in spinal anemia. Paralysis in neuritis. Reflexes, active, in spinal hyperemia. Exaggerated. In spinal syphilis. In acute spinal myelitis. In amyotrophic lateral spinal sclerosis. In chorea. In combined forms of sclerosis. In diffuse sclerosis. In disseminated sclerosis. In hemiplegia. In spastic spinal paralysis. In tabes dorsalis. In tumors of the brain. Of the spinal cord. Tenderness in epilepsy. Vasomotor. Religious feeling, extreme, as a cause of ecstasy. Remissions in general paralysis of the insane. In tubercular meningitis. Respiration, artificial. In cerebral hemorrhage. In acute spinal meningitis. In anemia of the brain. In catalepsy. In cerebral hemorrhage and apoplexy. In concussion of the brain. In labioglossolaryngeal paralysis. In the chloral habit. In thermic fever. In tubercular meningitis. In tumors of the brain. Rest, value of, in apoplexy. In concussion of the brain. In hyperemia of the spine. In melancholia. In myelitis, acute. In neuritis. In symmetrical gangrene. In writer's cramp. In vasomotor neuroses. And quiet, value in general paralysis of the insane. Rest cure, value of, in hysteria. In migraine. In neurasthenia. Retropulsion in paralysis agitans. Raynaud's disease. Rheumatic headache. Rheumatism. Influence on causation of chorea. Of meningitis, acute. Rigidity in hemiplegia of intracranial hemorrhage and apoplexy. Rigors in acute simple meningitis. Spinal meningitis. Romberg symptoms of tabes dorsalis. S. Salam convulsions. Salicylate of sodium, use, in acute simple meningitis. In neuralgia. In neuritis and multiple neuritis. Sarcomatous tumors of the brain. Satyriasis. Scarlatina, influence on causation of chorea. Schistosarcus. Sciatica. C. Sclerosis, secondary, of spinal cord. Sclerosis of crossed pyramidal tracts as a cause of spastic spinal paralysis. Amyotrophic lateral spinal. Definition. Duration. Morbid anatomy. Prognosis. Symptoms. Combined forms of spinal. Diffuse. Morbid anatomy. Prognosis. Symptomatology. Disseminated, cerebrospinal. Diagnosis. Etiology. Morbid anatomy. Symptoms. Posterior spinal. Treatment of. Climate. Cold baths. Cold douches. Ergot in early stages. Ferratic wire brush. Galvanism. Hot springs. Management of special symptoms and complications. Mercury. Mixed treatment. Moral treatment. Nerve stretching. Nitrate of silver. Peripheral treatment. Static electricity. Tremors of sclerotic affections. Sclerotic process in tabes dorsalis. In general paralysis of the insane. Scrofulosis, influence on causation of chronic hydrocephalus. Of tubercular meningitis. Scoliosis in infantile spinal paralysis. Sea bathing, use, in hysteria. Seasickness. Season, influence on causation of chronic lead poisoning. Of hyperemia of the brain. Of intracranial hemorrhage and apoplexy. Of tubercular meningitis. Secretions, altered, in diseases of cervical sympathetic. In nervous diseases. Sedatives and narcotics, use of, in insanity. Self-concentration, relation to trance and ecstasy. Self-deception of hysterical patients. Semiology, general, of nervous diseases. Senile dementia. Insanity. Sensation, disturbances of. In catalepsy. In chronic lead poisoning. In hemiplegia. In injuries to peripheral nerves. In multiple neuritis. In the chloral habit. In tumors of the brain. Of the spinal cord. Modifications of, in acute myelitis. Spinal meningitis. Pachymeningitis. In cerebral atrophy and hypertrophy. Syphilis. In chronic spinal meningitis. Pachymeningitis. In neuritis. In neuromata. In progressive unilateral facial atrophy. In symmetrical gangrene. In tabes dorsalis. Perversion of. In delirium tremens. In diffuse spinal sclerosis. In spinal hyperemia. Meningeal hemorrhage. Syphilis. Senses, special, disorders of, in alcoholism. In cerebral anemia. In cerebral hemorrhage and apoplexy. In cerebral hypertrophy and atrophy. In nervous diseases. In neuralgia. In neurasthenia. In progressive unilateral facial atrophy. In symmetrical gangrene. Sensibility, alterations of, topographical distribution in nervous diseases. Disorders of, in chronic alcoholism. In chorea. Loss of, in nervous diseases. Sensorial affections of hysteria. Of special senses, in nervous diseases. Sensory disturbances in cerebral anemia. Epilepsy. Symptoms of nervous diseases. Sequelae of thermic fever. Serous apoplexy. Sex. Influence on causation of acute spinal meningitis. Of catalepsy. Of cerebral anemia. Hyperemia. Of chorea. Of chronic lead poisoning. Of disseminated, cerebrospinal, sclerosis. Of ecstasy. Of epilepsy. Of family form of tabes dorsalis. Of general paralysis of the insane. Of hematoma of the dura mater. Of hysteria. Of hysteroepilepsy. Of intracranial hemorrhage and apoplexy. Of migraine. Of myxedema. Of neuralgia. Of paralysis agitans. Of progressive unilateral facial atrophy. Of simple acute meningitis. Of tabes dorsalis. Of tetanus. Of the choral habit. Of the opium habit. Of tubercular meningitis. Of tumors of the brain. Spinal cord. Of writer's cramp. Sexual disorders, of chronic alcoholism. Of hyperemia of the brain. Of neurasthenia. Of the opium habit. Of tumors of the spinal cord. Excess, as a cause of spastic spinal paralysis. Of spinal hyperemia. Of tabes dorsalis. Of vertigo. Excitement, as a cause of ecstasy. Function. In general paralysis of the insane. In tabes dorsalis. Instincts, perverted, in insane temperament. Irritation, as a cause of hysteria. Of reflex paralysis. Perversions, in general paralysis of the insane. Shaking palsy. Sick headache. Silver. Use of, in hemiplegia. In labioglossolaryngeal paralysis. In spastic spinal paralysis. Simulation of sleep. Simulations of hysterical patients. Skin, atrophy of, changes in injuries to peripheral nerves. Condition of, in neuralgia. Disorders of, in chronic alcoholism. In hysteria. In myxedema. In neuritis. In progressive unilateral facial atrophy. In tabes dorsalis. In the chloral habit. In the opium habit. In vasomotor neuroses. Sleep and its disorders. Apparent death. Test of. Circulation of blood in. Brain, state of, during sleep. Coma. Disorders of, in cerebral anemia. Hyperemia. Syphilis. Dreams, physiology of. Effect of, on choreic movements. Hypotheses concerning nature of sleep. Insomnia. In the opium habit. Febrile form of. From active cerebral congestion. From exhaustion. Lethemic form of. Treatment. Lethargy. Lucid. Night terrors. Sleeping dropsy. Somnambulism. Treatment. Sleeping dropsy. Smell, disorders of, in alcoholism. In hemiplegia. In neuralgia. In tumors of the brain. And taste, perversion of, in hysteria. Social condition, influence on causation of chorea. Of hysteria. Of insanity. Sodium bromide, use, in epilepsy. Softening of the brain. Red and yellow. In abscess of the brain. Of the cord in acute spinal myelitis. In spinal hemorrhage and embolism. Somnambulism. Artificial. Somnolence, morbid. In tubercular meningitis. Spasm and twitching of muscles in tumors of spinal cord. Characters and seat in writer's cramp. Painless facial. Spasms, general, in hysteria. In neuritis. In tetanus, characters. Local, in hysteria. In tumors of the brain. Varieties, in nervous diseases. Spastic spinal paralysis. Specific poisons. Insanity from. Speech, development of. Speech, disorders of. Classification. Eulalia. Treatment. Dyslalia, or stuttering. Treatment. Paralalia, or stammering. Treatment. Speech, disorders of, in amyotrophic lateral spinal sclerosis. In Bell's palsy. In cerebral hemorrhage and apoplexy. In chorea. In disseminated, cerebrospinal, sclerosis. In hemiplegia. In labioglossolarynggeal paralysis. In paralysis agitans. In the opium habit. In tumors of the brain. Physiology of. Spina bifida. Definition, etiology, history, and synonyms. Diagnosis. Pathology and morbid anatomy. Prognosis. Symptoms. Treatment. Excision and ligation. Injection of iodine. Paracentesis. Spinal anemia. Treatment. Cord, affections of, chronic. Inflammatory, and degenerative. And its envelopes, tumors of. Disease of one lateral half of. Definition. Diagnosis. Prognosis. Symptoms. Anesthesia. Paralysis, seat. Synonyms. Treatment. Diseases of membranes of. Embolism, thrombosis, hemorrhage. An abscess of. Etiology. Morbid anatomy of. Symptoms of. Treatment. Localization of lesions in. Lesions of, in alcoholism. In tabes dorsalis. In tetanus. Disorders in alcoholism. Dura mater, acute inflammation of. Diagnosis and prognosis. Morbid anatomy, symptoms, and treatment. Chronic inflammation of. Exhaustion. Hyperemia. Inflammation. Irritation. Etiology. Hysterical. Passive. Symptomatology. Treatment. Ergotin. Local bloodletting. Rest. Membranes, congestion of. Etiology. Symptoms, morbid anatomy, and treatment. Inflammation and hemorrhage of. Meningeal hemorrhage. Diagnosis and prognosis. Pathological anatomy. Synonyms, etiology, and symptoms. Treatment. Meningitis, acute. Diagnosis and prognosis. Etiology and synonyms. Morbid anatomy and symptoms. Treatment. Chronic. Diagnosis, prognosis, and treatment. Symptoms and synonyms. Myelitis, acute. Paralysis, spastic. Sclerosis, posterior. Syphilis, C. Spine, concussion of. Diagnosis. Prognosis. Symptoms. Treatment. Spirits, characters of intoxication from. Spleen, changes in chronic alcoholism. Springs, hot, value of, in spinal sclerosis. Staggering, significance, in nervous diseases. In tabes dorsalis. Stammering. Starvation as a cause of cerebral anemia. Condition of brain in. Status epilepticus, prognosis of. Vertiginosis, the treatment of stigmatization, theories concerning origin, stimulants, use, in heat exhaustion, in collapse in opium habit, in thermic fever, stomach, disorders of and changes in chronic alcoholism, strabismus in chronic hydrocephalus, in tubercular meningitis, strychnia, use, in alcoholism, in chorea, in infantile spinal paralysis, in intracranial hemorrhage and apoplexy, in labioglossolaryngeal paralysis, in paralysis adjutans, in spinal hyperemia, in writer's cramp, myelitis, acute, stupor in tubercular meningitis, melancholia with stuttering, suicidal insanity, tendency, in general paralysis of the insane, sumbul, use, in hysteria, sun, exposure to, as a cause of acute meningitis, sunstroke, c. Headache from influence on causation of cerebral hyperemia, superficial neuralgia, supposed discharge as a cause of cerebral hyperemia, of spinal hyperemia, supraorbital nerve, intermittent neuralgia of surgical treatment of abscess of the brain, of facial neuralgia, of tumors of the brain, sweating, absence of, in progressive unilateral facial atrophy, in the opium habit, Swedish movement, use, in hysteria, in infantile spinal paralysis, sympathetic cervical, diseases of headache, neuralgias, symmetrical gangrene, symptoms of abscess of the brain, of acute alcoholism etc., of acute cerebral anemia, of acute myelitis, of acute simple meningitis, of acute spinal meningitis, pachymeningitis, of amyotrophic lateral sclerosis, of angina pectoris, of apoplexy, of athetosis, of atrophy of the brain, of Bell's palsy, of capillary embolism, of catalepsy, of cerebral anemia, of cerebral hyperemia, of cerebral meningeal hemorrhage, of cerebral softening, of cerebral syphilis, of chorea, of chronic alcoholism, of chronic cerebral meningitis, of chronic hydrocephalus, of chronic lead poisoning, of chronic spinal meningitis, of chronic spinal pachymeningitis, of combined forms of sclerosis, of concussion of the brain, of concussion of the spine, of congestion of cerebral dura mater, of spinal membranes, of the pia mater, of delirium tremens, of diffuse spinal sclerosis, of disease of cervical sympathetic, of disseminated, cerebrospinal, sclerosis, of ecstasy, of epilepsy, of external pachymeningitis, of family form of tabes dorsalis, of gastralgia, of general paralysis of the insane, of hematoma of dura mater, of headache, of heat exhaustion, of hebephrenia, of hypertrophy of the brain, of hypochondriasis, of hemiplegia, of hypertrophy of the brain, of hysteria, of hysteroepilepsy, of infantile spinal paralysis, of inflammation of the brain, of injuries to nerves, of insanity, of insomnia, of intermittent neuralgia of supraorbital, of internal pachymeningitis, of intracranial hemorrhage and apoplexy, of labioglossolaryngeal paralysis, of melancholia, of migraine, of moral insanity, of multiple neuritis, of myxedema, of nervous diseases, motory, psychic, sensory, trophic, of neuralgia, of neurasthenia, of neuritis, Of neuromata. Of occlusion of cerebral vessels. Of painless facial spasm. Of paralysis agitans. Of primary insanity. Of progressive unilateral facial atrophy. Of sciatica. Of secondary sclerosis. Of spastic spinal paralysis. Of spina bifida. Of spinal hemorrhage. Hyperemia. Meningeal hemorrhage. Syphilis. Of symmetrical gangrene. Of tabes dorsalis. Of tetanus. Of the chloral habit. Of the insane temperament. Of the opium habit. Of thermic fever. Of Thomson's disease. Of thrombosis of cerebral veins and sinuses. Of torticollis. Of trance. Of tremor. Of tubercular meningitis. In the adult. Of tumors of the brain. Of the spinal cord. Of unilateral spinal paralysis. Of vertigo. Of visceral neuralgia. Of writer's cramp. Syncope in cerebral anemia. Treatment of syncopic seizures in cerebral anemia. Syphilis as a cause of disseminated sclerosis. Of epilepsy. Of general paralysis of the insane. Of insanity. Of spinal meningitis, acute. Of tabes dorsalis. Of tumors of the brain. Syphilitic affections of the nerve centers. Brain cortex, syphilitic disease of. Diagnosis. Symptoms etc. Relation to general paralysis of the insane. Brain syphilis, gammatus. Diagnosis. Pathology. Prognosis. Symptoms and clinical history. Aphasia in. Epileptic attacks in. Eye ground, changes in, importance of. Headache, seat and characters. Of cerebral meningeal syphilis. Onset, mode of. Paralysis, mode of onset, seat and characters. Prodromes. Psychical symptoms. Sleep, disorders of. Special senses, modifications of. Treatment. Aconite, hypodermic use. Bloodletting, use. Mercurials. Use. Of the accidents or exacerbations of the disease. Potassium iodide, use. Woods, use. Etiology, general. Time of development of symptoms after specific infection. Spinal syphilis. Diagnosis. Lesions. Relation to acute and subacute myelitis. And to acute ascending paralysis. Symptoms. Motility, disturbances of. Pain in. Sensation, perversions of. Syphilitic diseases of brain, in general paralysis of the insane. Headaches. Inflammation of spinal cord in diffuse sclerosis. Insanity. Tabes dorsalis. Diagnosis. Etiology. History. Morbid anatomy of. Physiology of. Symptomatology. The family form of. Diagnosis. Etiology. Morbid anatomy. Prognosis. Symptoms. Table of 100 cases of brain tumor. Of 50 cases of spinal tumor. Taches cerebrals. Tarantismus, origin and nature of. Taste, disorders of, in alcoholism. In hemiplegia. In neuralgia. In progressive unilateral facial atrophy. In tumors of brain. Tea and coffee as causes of tremor. Telegraphy. Influence on causation of writer's cramp. Temperature in acute simple meningitis. In cerebral hemorrhage and apoplexy. In cerebral hyperemia. In cerebral meningeal hemorrhage. In chorea. In concussion of the brain. In epilepsy. In general paralysis of the insane. In hemiplegia. In hysteria. In infantile spinal paralysis. In tabes dorsalis. In tetanus. In tetanus neonatorum. In the opium habit. In thermic fever. In tubercular meningitis. In tumors of the spinal cord. Of face, in progressive unilateral facial atrophy. Of head, in tumors of brain. Tendon reflexes in chorea. In epilepsy. Tenotomy in writer's cramp. Indications for, in infantile spinal paralysis. Terminal dementia. Termination of chorea. Of progressive unilateral facial atrophy. Of tumors of brain. Of spinal cord. Tetanus. Definition. Diagnosis. From hysterical spasm and cerebrospinal meningitis. From strychnia poisoning and hydrophobia. Etiology. Age, race, and sex. Influence on causation. Atmospheric and climatic conditions. Theories regarding origin. Traumatic causes. Morbid anatomy. Prognosis. Symptoms. Digestive and urinary organs, disorders of. Mental condition in. Prodromata. Pulse and temperature in. Spasms, seat and characters of. Treatment. Alcohol, use. Bleeding, use. Calabar bean and cannabis indica, use. Chloral and potassium bromide, use. Conium, use. Curare, use. Mercury, use. Opium, use. Preventive. Surgical measures. Tobacco and anesthetics, use. Tetanus neonatorum. Etiology. Sims on displacement of occipital bone as a cause. Morbid anatomy. Symptoms. Treatment. Tetanus, puerperal, treatment. Thermic fever. Diagnosis. Etiology. Alcohol. Influence on causation. Race, influence on causation. Postmortem changes in and theories of the disease. Sequelae. Symptoms. Cerebral. Digestive disorders. Enterocolitis of infancy, relation of, to. Motor system, disturbances of. Synonyms. Treatment and prophylaxis. Antipyrin, use. Bleeding, use. Blisters, use. Cold and cold baths, use. Morphia, use. Of cerebral. Of pyrexia. Of sequelae. Thomson's disease. Thrombosis of cerebral veins and sinuses. Of spinal cord. Tic douloureux. Tinnitus aurium in hyperemia. In nervous diseases. In tabes dorsalis. Tinnitus in cerebral anemia. Titubation, in nervous diseases. Tobacco, abuse of, influence on causation of alcoholism. Of tabes dorsalis. Of tremor. Of writer's cramp. Use. In tetanus. Tongue biting in epilepsy. State of, in cerebral hemorrhage and apoplexy. In labioglossolaryngeal paralysis. In tubercular meningitis. Tonic spasms in nervous diseases. Tonics, use, in catalepsy. In melancholia. Tonka, use. In neuralgia. Torsion of abdominal walls in treatment of hysteroepilepsy. Torticollis. Etiology. Prognosis. Symptoms. Treatment. Electricity, use. Exsection of spinal accessory nerve. Toxic causes of epilepsy. Headaches. Tracheotomy in tetanus. Trance, lethargy, and morbid somnolence. Symptoms. Theories concerning nature. Transitory insanity. Traumatism, influence on causation of abscess of the brain. Of acute spinal meningitis. Of cerebral hemorrhage and apoplexy. Of cerebral hyperemia. Of cerebral meningeal hemorrhage. Of concussion of the spine. Of colpodyskinesia. Of epilepsy. Of external pachymeningitis. Of infantile spinal paralysis. Of neuritis. Of progressive unilateral facial atrophy. Of spinal anemia. Of syphilitic affections of the nerve centers. Of tabes dorsalis. Of the spinal cord. Of tumors of the brain. Treatment of abscess of the brain. Of acute simple meningitis. Of acute spinal meningitis. Of acute spinal pachymeningitis. Of alalia. Of alcoholic insanity. Of alcoholism. Of angina pectoris. Of athetosis. Of atheroma of cerebral arteries. Of atrophy of the brain. Of Bell's palsy. Of capillary embolism. Of catalepsy. Of cerebral anemia. Of cerebral embolism. Of cerebral hemorrhage. Of cerebral hyperemia. Of cerebral meningeal hemorrhage. Of cerebral syphilis. Of cerebral thrombosis. Of chorea. Of chronic cerebral meningitis. Of chronic hydrocephalus. Of chronic lead poisoning. Of chronic spinal meningitis. Of climacteric insanity. Of concussion of brain. Of spinal cord. Of congestion of cerebral pia mater. Of spinal membranes. Of constitutional affective mental disease. Of delusional insanity. Of dementia. Primary and secondary. Of disease of cervical sympathetic. Of disorders of speech. Of ecstasy. Of epilepsy. Of epileptiform facial neuralgia. Of external pachymeningitis. Of gastralgia. Of general paralysis of the insane. Of hematoma of the dura mater. Of headache. Of heat exhaustion. Of hebephrenia. Of hypertrophy of brain. Of hypochondriacal insanity. Of hypochondriasis. Of hysteria. Of hysterical insanity. Of hysteroepilepsy. Of impulsive insanity. Of infantile spinal paralysis. Of insane temperament. Of insanity. Of insomnia. Of intercostal neuralgia. Of internal pachymeningitis. Of intermittent neuralgia of supraorbital nerve. Of lead colic. Of labioglossolaryngeal paralysis. Of mania. Acute. Of melancholia. Of migraine. Of moral insanity. Of myelitis, acute. Of myxedema. Of nerve injuries. Of neuralgia. Of neurasthenia. Of neuritis. Of neuromata. Of painless facial spasm. Of paralysis agitans. Of perforating ulcer of foot. Of primary brain atrophy. Of primary insanity. Of progressive unilateral facial atrophy. Of puerperal tetanus. Of sciatica. Of senile dementia. Of senile insanity. Of somnambulism. Of spina bifida. Of spinal anemia. Of spinal hemorrhage. Of spinal hyperemia. Of spinal meningeal hemorrhage. Of spinal sclerosis. Of stammering and stuttering. Of symmetrical gangrene. Of syncope. Of syphilitic insanity. Of tabes dorsalis. Of terminal dementia. Of tetanus. Of tetanus neonatorum. Of the chloral habit. Of the opium habit. Of thermic fever. Of thrombosis of cerebral veins and sinuses. Of torticollis. Of tremor. Of tubercular meningitis. Of tumors of brain. Of tumors of spinal cord. Of unilateral spinal paralysis. Of vasomotor neuroses. Of vertigo. Of writer's cramp. Tremor. Etiology. Symptoms. Treatment. Tremor, ataxic, in nervous diseases. Hysterical. In alcoholism. In delirium tremens. In disseminated sclerosis. In nervous diseases. In paralysis agitans. In spinal syphilis. In the chloral habit. In the opium habit. In writer's cramp. Muscular, in general paralysis of the insane. Of sclerotic affections, treatment. Trephining, question of, in abscess of the brain. In cerebral hemorrhage and apoplexy. In epilepsy. In tumors of the brain. Trismus. Trophic changes in injuries to peripheral nerves. Disturbances in tumors of the brain. In writer's cramp. Of tabes dorsalis. Lesions in infantile spinal paralysis. Nerve centers. Trophic neuroses. Atrophy. Of glandular and cutaneous systems. Of muscles and bones. Wallerian degeneration. Hypertrophy. Inflammation. Bed sores, acute and chronic. Ulceration of fingers, acute. Ulceration, perforating, of the foot. Myxedema. Course and symptoms. Etiology and pathology. Diagnosis. Treatment. Electricity and tonics. Nitroglycerin. Trophic nerves and nervous centers. Symptoms of nervous diseases. Of neuritis. Tubercles, miliary, seat and character. In tubercular meningitis. Tubercular brain tumors. Meningitis, C. In the adult. Simulated by cerebral anemia. Tumor of spina bifida, size, characters, etc. Tumors of the brain and its envelopes. Complications and sequelae. Definition. Diagnosis. From cerebral abscess. From cerebral symptoms of Bright's disease. From chronic hydrocephalus and softening. From dementia and mania. From early stage of posterior spinal sclerosis. From hysteria and malaria. From meningitis. From various forms of apoplexy. Localization of tumors of brain. Duration, course, and termination. Etiology. Age and sex, influence of. Echinococci and cysticerci, influence of. Heredity, influence of. Injuries, influence of. Syphilis, influence of. Pathology. Methods of making post-mortem examination in cases of brain tumors. Varieties, structure, seat, and frequency. Prognosis. Symptoms. Apoplectic attacks in. Ataxia and muscular atrophy in. Bladder, disorders of. Choked disc, neuroretinitis and optic retinitis in. Chorea and choreic movements. Constipation in. Contractures and rigidity in. Epistaxis and hemorrhages from mucous surfaces in. Eye, disorders of. Headache, characters and seat. Hearing, taste, and smell, altered. Mental disturbances. Neuralgias in. Of multiple tumors. Pain on pressure upon head. Paralysis. Seat and characters. Reflexes, altered. Sensation, perversions of. Spasms, local and general, in. Temperature of head in. Trophic disturbances and disturbances of respiration. Vertigo in. Vomiting in. Will, impairment of, and defects of speech. Treatment. Ergot, cannabis indica, and hyoscyamus, use. Leeches, use. Morphia and potassium bromide, use. Surgical. Tumors of the spinal cord and its envelopes. Definition. Diagnosis. From caries of spinal vertebrae. From hysteria. From metallic and infectious diseases. From spinal congestion, hemorrhage, and meningitis. From traumatism, sclerosis, aneurysm, and neuritis. Localization of spinal tumors. Duration and termination. Etiology. Age and sex, influence of. Traumatism. Influence of. Pathology. Characters, seat, and varieties of tumors. Vascular changes. Symptoms. Ataxia and atrophy in bladder, urinary and sexual disorders. Eye disorders. Headache in. Mental disturbances in. Pain, seat and characters. Paralysis and paresis. Reflexes, altered in. Sensation, alterations of. Sense of constriction about waist. Spasms and twitchings in. Temperature of body in. Vomiting in. Treatment. Tumors, phantom, in hysteria. Turpentine, use of, in neuralgia. Tympanitis, hysterical. Typhoid fever as a cause of abscess of the brain. Of anemia of the brain. Typhus fever as a cause of hyperemia of the brain. Ulcer of foot in tabes dorsalis. Ulcerations in nervous diseases. Ulcers, perforating, of the foot. Unconsciousness, in cerebral meningeal hemorrhage. Unilateral catalepsy, symptoms. Epilepsy. Facial atrophy, progressive. Preponderance of symptoms in cerebral anemia. Spinal paralysis. Urine, state of, in brain tumors. In cerebral hemorrhage and hemiplegia. In chronic lead poisoning. In epilepsy. In general paralysis of the insane. In hysteria. In myxedema. In neuralgia. In symmetrical gangrene. In tabes dorsalis. In the chloral habit. In the opium habit. Uterine and ovarian irritation as a cause of reflex paralysis. Uterus and ovaries, neuralgia of. Vaginismus, hysterical. Valix as painful points in migraine. Varieties of hysteroepilepsy. Vasoconstrictors, action of. Vasodilators, action of. Vasomotor cerebral disturbances in general paralysis of the insane. Disturbances in writer's cramp. Nerves, origin of. Vasomotor neuroses. Course. Diagnosis. Pathogenesis. Physiology. Local vascular tone in. Medullary centers in. Origin of the vasomotor nerves. Vasoconstrictors. Vasodilators. Vasomotor reflexes. Vasomotor tracts. Prognosis. Symptoms. Acrodynia. Angiospasm and angioparalysis. Cutaneous angioneuroses. Digiti mortui and gangrene. Erythromelalgia. Functional, derangements of internal viscera. Ruptured capillaries in. Sensation, disturbances of. Taches cerebrals in. Treatment. Amyl nitrite and nitroglycerin. Chloral hydrate and chloride of potassium in. Rest, massage, and electricity in. Vasomotor and trophic neuroses. Definition. Reflexes. Symptoms of general paralysis of the insane. Theory of pathology of hysteria. Tracts of the spinal cord. Venous congestion in cerebral hyperemia. Ventricles of brain in cerebral anemia. Veratrum, use, in tumors of spinal sclerosis. Verbigeration, in catatonia. Vertigo. Definition. Diagnosis. Etiology. Blood poisoning, influence of. Excessive venery, influence of. Mechanical causes. Of oral form. Of essential form. Of gastric and senile form. Of laryngeal form. Of neurasthenic, hysteric, and anemic forms. Of ocular form. Prognosis and duration. Symptoms. Of oral form. Of essential form. Of gastric and senile form. Of laryngeal form. Of neurasthenic, hysteric, and anemic forms. Of ocular form. Of status vertiginosus. Treatment. Bromides and hydrobromic acid. Cauterization, use of. Diet. Morphia, use. Nitrite of amyl and nitroglycerin, use. Of oral form. Of gastric and senile form. Of optic form. Of status vertiginosus. Kinea, use. Vertigo, in abscess of the brain. In cerebral anemia. In tumors of the brain. Vessels of cerebrum, changes in chronic alcoholism. State of, in cerebral abscess. Violence, significance of, in nervous diseases. Violin playing as a cause of copodyscinesia. Firco on origin of progressive unilateral facial atrophy. Visceral derangements of chronic alcoholism. Disturbances in diffuse sclerosis. Neuralgias. Vision, disorders of, in cerebral anemia. In diseases of the cervical sympathetic. In disseminated spinal sclerosis. In epilepsy. In neuralgias. In tabes dorsalis. Hallucinations of, in migraine. Vitreous degeneration of cerebral cortex in disseminated sclerosis. Vomiting, hysterical. In acute simple meningitis. In anemia of the brain. In apoplexy and cerebral hemorrhage. In cerebral meningeal hemorrhage. In chronic hydrocephalus. In chronic lead poisoning. In concussion of the brain. In infantile spinal paralysis. In migraine. In the opium habit. In tubercular meningitis. In tumors of the brain. W. Wallerian degeneration. Washerwomen's anesthesia. Wasting diseases, influence on causation of copodyscinesia. Water, hypodermically, in neuralgia. Influence on causation of chronic lead poisoning. Wax-like flexibility in catalepsy. Welsh fasting girl. Westphal herb symptom of tabes dorsalis. Wet pack, use, in neuralgia. Will, impairment of, in tumors of the brain. And intellect, state of, in alcoholism. Wines, character of intoxication from. Wire brush, ferratic. In spinal sclerosis. Witchcraft, hysterical nature of. Woods, the use of, in cerebral syphilis. Word blindness, in hemiplegia. In nervous diseases. Word deafness, in nervous diseases. Worms, influence on causation of epilepsy. Wrist drop. Writers and artisans, neural disorders of. Definition, history, and synonyms. Differential diagnosis. From palsy from pressure. From paralysis agitans and multiple sclerosis. From paresis from slight lesions. From progressive muscular atrophy. From tenosynovitis. Duration and course. Etiology. Action of muscles used in telegraphy. Action of muscles used in writing. Age and sex, influence of. Cigarette smoking as a cause of. Hereditary influence and nervous temperament. Manner of writing and holding the pen. Musical instrument playing. Telegraphy. Wasting diseases and traumatism. Pathology and morbid anatomy. Prognosis. Prophylaxis. Symptoms. Cramp and spasm, characters and muscles affected. Electrical reactions in. General. Lock spasm in. Pain and modification of sensation in. Paresis and paralysis, characters and seat. Tremor in. Vasomotor and trophic disturbances. Treatment. Arsenic, use. Atropia, hypodermically. Electricity, use. Gymnastics and massage. Local applications in. Medication, value of. Mechanical apparatus in. Rest in. Strychnia, use. Tenotomy and nerve stretching in. Z. Zinc salts, use, in Korea. In hysteria. In hysteroepilepsy. Valerianate, use of, in migraine. General index. A. Abdominal glands, diseases of, 2. 1182. Abortion, 4. 467. Acne, 4. 641. Rosacea, 4. 647. Addison's disease, 3. 939. Eulalia, 4. 569. Albinismus, 4. 647. Albuminuria, 4. 34. Alcoholism, v. 573. Alimentación, rectal, 2. 928. Alopecia, 4. 678. Areata, 4. 680. Amblyopia, toxic, 4. 803. Amenorrhea, 4. 183. Anemia, 3. 887. Progressive pernicious, 3. 898. Anesthesia of peripheral origin, v. 1198. Aneurysm, abdominal, 3. 821. Thoracic, 3. 801. Angina pectoris, 3. 755. Angioma, 4. 688. Anadrosis, 4. 584. Ankyloglossia, 2. 349. Anthrax, I, 926, 4. 606. Anus, cutaneous eruptions and parasitic conditions of, 2. 892. Syphilis of, 2. 900. Anus and rectum, diseases of, 2. 877. Fissure of, 2. 888. Prolapse of, 2. 881. Aorta, aneurysm of, 3. 801, 821. Atheroma of, 3. 800. Perforation and occlusion of, 3. 824. Rupture of, 3. 823. Stenosis of, 3. 825. Aortic insufficiency, 3. 659. Obstruction or stenosis, 3. 654. Apoplexy, cerebral, v. 917. Pulmonary, 3. 293. Artery, coronary, diseases of, 3. 828. Hepatic, aneurysm of, 3. 840. Inferior mesenteric, diseases of, 3. 839. Pulmonary, diseases of, 3. 833. Superior mesenteric, diseases of, 3. 836. Arthritis, gonorrheal, 2. 102. Rheumatoid, 2. 78. Ascaris lumbricoides, 2. 952. Ascites, 2. 1153. Asthma, bronchial, 3. 184. Hay, 3. 210. Atelectasis, 3. 251. Athetosis, v. 457. Atrophy, v. 1266. Facial, progressive unilateral, v. 694. Auditory canal, external, diseases of, v. 811. Auricle, external ear, diseases of, 4. 810. B. Baldness, 4. 678. Batty's operation, 4. 290. Barber's itch, 4. 723. Basedow's disease, 3. 761. Bed bugs, 4. 733. Bell's palsy, v. 1202. Beriberi, I. 1038. Bile ducts, catarrh of, 2. 1051. Biliary concretions, 2. 1058. Biliary passages, affections of, 2. 1051. Occlusion of, 2. 1082. Biliousness, 2. 965. Bladder, atony and paralysis of, 4. 133. Atrophy and hypertrophy of, in women, 4. 348. Diseases of, 4. 123. Functional diseases of, in women, 4. 349. Hemorrhage of, 4. 134, 340. Hyperemia of, in women, 4. 339. Inflammation of, acute and chronic, 4. 123, 126, 128, 341. Neuroses of, 4. 132. New growths of, 4. 136. Paralysis of, in women, 4. 350. Blood and blood glandular system, diseases of, 3. 882. Boils, 4. 604. Bowel, compression and contraction of, 2. 857. Stricture of, 2. 854. Bowels, hemorrhage from, 2. 830. Brain, abscess of, v. 792. Atrophy of, v. 993. Hypertrophy of, v. 996. Inflammation of, v. 790. Softening of, v. 989. Syphilis of, v. 1003, 1017. And its envelopes, tumors of, v. 1028. Spinal cord, concussion of, v. 907. Diseases of membranes of, v. 703. Hyperemia and anemia of, v. 763, 774. Bright's disease, 4. 72. Bromidrosis, 4. 584. Bronchi, diseases of, 3. 164. Bronchial asthma, 3. 184. Tubes, dilatation of, 3. 227. Bronchitis, acute and chronic, capillary, mechanical, pseudomembranous, and rheumatic, 3. 169, 170, 171, 172, 173, 174. C. Caisson disease, the, 3. 855. Calculi, hepatic, 2. 1058. Renal, 4. 42. Calicitas, 4. 662. Cancrum oris, 2. 338. Canides, 4. 678. Cannabis indica, habitual addiction to, v. 669. Carbuncles, 4. 606. Cardiac murmurs and their relation to valvular heart disease, 3. 651. Cardiac thrombosis, 3. 718. Cardialgia, 2. 459. Cardicentesis, 3. 798. Caruncle, urethral, 4. 403. Catalepsy, v. 314. Cerebral arteries, atheroma, v. 991. Meningeal hemorrhage, v. 710. Paralysis, v. 917. Veins and sinuses, thrombosis of, v. 982. Vessels, occlusion of, v. 917, 946. Cervical sympathetic, diseases of, v. 1263. Cestodes or tapeworms, 2. 931. Cloasma, 4. 659. Chloral habit, the, v. 660. Chloroform, habitual addiction to, v. 667. Chlorosis, 3. 894. Cholera, I. 715. Infantum, 2. 741. Morbus, 2. 719. Chorea, v. 439. Of the larynx, 3. 76. Chromadrosis, 4. 585. Chyluria, 4. 114. Cymex lectularius, 4. 733. Circulatory system, diseases of, 3. 599. Clavis, 4. 663. Cocaine, habitual addiction to, v. 667. Celiac axis, diseases of, 3. 841. Colic, hepatic, 2. 1058. Intestinal, 2. 658. Renal, 4. 42. Coma, v. 26, 382. Comedo, 4. 589. Constipation, 2. 638, 650. Convulsive disorders, local, v. 461. Copodyscinesia, v. 504. Corns, 4. 663. Cornucutaneum, 4. 663. Coronary artery, diseases of, 3. 828. Coryza, 3. 41. Cough, nervous, 3. 71. Craniocerebral topography, v. 93. Cretinism, v. 138. Croup, spasmodic or false, 3. 70, 92. True, 3. 100. Culex, 4. 733. Cyanosis and congenital anomalies of heart and great vessels, 3. 687, 712. Cysticercus cellulosae, 4. 732. Cystitis, acute and chronic, 4. 126, 128. In women, 4. 341. D. Deaf mutism, 4. 840. Deafness after cerebrospinal meningitis, mumps, scarlet fever, etc., 4. 839. Death, apparent, v. 385. Degenerations, I. 72. Dementia, v. 164. Demodex follicularum, 4. 732. Dengue, I. 879. Dentition, morbid, 2. 371. Dermatalgia, 4. 711. Dermatitis, 4. 600, 604, 611, 623. Dermatolysis, 4. 675. Dermoid cyst of the ovary, 4. 299. Diabetes insipidus, 4. 27. Mellitus, 2. 195. Diagnosis, general, I. 148. Digestive system, diseases of, 2. 319. Diphtheria, I. 656. Disease, causes and prevention of, I. 175. Diseases, general, I. 229. Distemum hepaticum, 2. 1109. Drainage and sewerage in their hygienic relations, I. 213. Dreams, v. 368. Ductus communis coleticus, occlusion of, 2. 1082. Dura mater, cerebral, congestion of, v. 704. Dysentery, 2. 777. Dyslalia, v. 571. Dysmenorrhea, 4. 192. Dyspepsia, functional and atonic, 2. 436. Ear, internal, diseases of, 4. 835. Middle, diseases of, 4. 817. Echinococcus of the liver, 2. 1101. Eclampsia, v. 464. Ecstasy, v. 339. Ecthyma, 4. 653. Eczema, 4. 625. Marginatum, 4. 718. Effusions, I. 67. Elephantiasis, 4. 675. Embolism and thrombosis, I. 56. Of the spinal cord, v. 808. Capillary, cerebral, v. 979. Emphysema, 3. 233, 249. Endocarditis, 3. 639, 640, 642, 643. Endometritis, acute and chronic, 4. 460, 462. Enteralgia, 2. 658. Enteritis, pseudomembranous, 2. 763. Enterocolitis, 2. 726. Epilepsy, v. 468. Epiglottis, inflammation and erosion of, 3. 109. Epithelioma, 4. 707. Epistaxis, 3. 50. Erythema, 4. 593, 595, 596. Erysipelas, I. 629. Ether, habitual addiction to, v. 667. Etiology, general, I. 125. Eye affections, from diseases of the digestive organs, 4. 749. Diseases of the kidneys and skin, 4. 752. General system, 4. 800. Nervous system, 4. 771, 796, 797, 799. Respiratory organs, 4. 748. Sexual organs, 4. 755. Spinal cord, 4. 792. Mental affections, 4. 791. Eye ground and appendages, changes in, from diseases of the circulatory apparatus, 4. 738. F. Facial atrophy, progressive unilateral, v. 694. Nerve, peripheral paralysis of, v. 1202. Spasm, painless, v. 462. Fallopian tubes, dropsy of, 4. 295. Farcy, I. 909. Favus, 4. 715. Fibroma, 4. 686. Filaria medinensis, 4. 732. Fistulo in ano, 2. 897. Flea, common, 4. 733. Flea, sand dash, 4. 732. Flukeworms, 3. 946. Furunculus, 4. 604. Of external auditory canal, 4. 813. Of labia, 4. 362. G. Gadfly, 4. 732. Gallstones, 2. 1058. Gangrene, symmetrical, v. 1257. Gastralgia, 2. 459, v. 1238. Gastric catarrh, acute and chronic, 2. 463, 470. Gastritis, acute and chronic, 2. 463, 470. Gastromalacia, 2. 618. Gastrorrhagia, 2, 580. Genitourinary system, diseases of, 4. 17. Glanders, I. 909. Glossanthrax, 2. 368. Glossitis, acute, 2. 354 to 366. Chronic, 2. 366 to 368. Glottis, edema of, 3. 112. Spasm of, in adults, 3. 74. Glycosuria, hepatic, 2. 973. Gnats, 4. 733. Goiter, 3. 974. Exophthalmic, 3. 761. Gout, 2. 108. Graves' disease, 3. 761. Great vessels and heart, congenital anomalies of, 3. 687. Guinea worm, 4. 732. H. Hematoma of the dura mater, v. 707. Hematuria, 4. 104. Hemoglobinuria or hematonuria, 4. 104. Hemopericardium, 3. 788. Hemophilia, 3. 931. Hemoptysis, 3. 266. Hemothorax, 3. 582. Hair, atrophy of, 4. 682. Blanching of, 4. 678. Harvest mite, 4. 731. Hay asthma, 3. 210. Headache, v. 402, 1216, 1230. Heart, adventitious products of, 3. 637. Aneurysm of, 3. 636. Atrophy of, 3. 618. Dilatation of, 3. 630. Diseases of substance of, 3. 601. Fibroid, 3. 607. hypertrophy of 3. 619. Malformations of, affecting primarily left side of, 3. 707. Malformations of, affecting primarily right side of, 3. 702. Malpositions of, 3. 601. Murmurs, 3. 651. Neuroses of, 3. 747. Spontaneous rupture of, 3. 617. Valvular diseases of, 3. 639. And great vessels, congenital anomalies of, 3. 687. Clot, 3. 718. Muscle, degeneration of, 3. 609. Heart's action, functional disorders of, 3. 747. Heat, acute affections produced by, v. 387. Hemorrhoids, 2. 882. Hepar adiposum, 2. 1046. Hepatic artery, aneurysm of, 3. 840. Calculi, 2. 1058. Colic, 2. 1058. Glycosuria, 2. 973. Hepatitis, interstitial, 2. 990. Suppurative, 2. 1002. Hernia, cystovaginal, 4. 377. Pudendal, 4. 398. Rectovaginal and enterovaginal, 4. 378. Herpes iris, 4. 609. Simplex, 4. 607. Zoster, 4. 610. Hirsutes, 4. 669. Hodgkin's disease, 3. 921. Hydatid tapeworm, 2. 943. Hydatids of liver, 2. 1101. Pulmonary, 3. 466. Hydrocele or cyst of the canal of Nuck, 4. 397. Hydrocephalus, chronic, v. 704. Hydronephrosis, 4. 56. Hydropericardium, 3. 789. Hydrophobia and rabies, I. 886. Hydrothorax, 3. 570. Hygiene, I. 173. Hymen, atresia of, 4. 374. Hyperhidrosis, 4. 583. Hypertrichosis, 4. 669. Hypertrophy, v. 1271. Hypnotism, v. 373. Hypochondriasis, v. 154. Hypostatic pneumonia, 3. 258. Hysteria, v. 205. Hysteroepilepsy, v. 288. I. Ichthyosis, 4. 666. Icterus, 2. 975. Idiocy, v. 138. Imbecility, intellectual, v. 138. Impetigo, v. 651, 652. Indigestion, 2. 436. Intestinal, 2. 620. Infantile spinal paralysis, v. 1113. Inflammation, I. 37, v. 1273. Influenza, I. 851. Insanity, v. 99. From gross lesions of the brain, v. 202. Specific poisons, v. 175. Insanities, complicating, v. 174. Insomnia, v. 379. Intracranial hemorrhage, etc., v. 917. Intermittent fever, I. 592. Intestinal affections of children in hot weather, 2. 726. Catarrh, acute, 2. 667. Chronic, 2. 699. Colic, 2. 658. Indigestion, 2. 620. Obstruction, 2. 830. Ulcer, 2. 823. Worms, 2. 930. Intestines, cancer of, 2. 868. Lardaceous degeneration of, 2. 874. Intussusception and invagination, 2. 844. Ixodes, 4. 733. J. Jaundice, 2. 925. K. Catatonia, v. 166. Keloid, 4. 685. Keratosis pilaris, 4. 660. Kidneys, abnormalities of, in shape, size, position, etc., 4. 19. Bright's disease of, 4. 72. Chronic congestion of, 4. 69. Cysts of, 4. 63. Diseases of parenchyma of, 4. 69. Floating, 4. 21. Malignant growths of, 4. 60. Parasites and tuberculosis of, 4. 64. And pelvis, diseases of, 4. 19. Kleptomania, v. 147. L. Labia, furuncles of, 4. 362. Majora, phlegmonous inflammation of, 4. 391. Labioglossolaryngеal paralysis, progressive, v. 1169. Laryngismus strigilis, 3. 70. Laryngitis, acute catarrhal, false croup, 3. 92. Chronic, 3. 121. Pseudomembranous, true croup, 3. 100. Laryngoscopy in rhinoscopy, 3. 19. Larynx, anesthesia of, 3. 65. Chorea of, 3. 76. Diseases of, 3. 109. Disorders of motion of, 3. 69. Hyperesthesia of, 3. 62. Morbid growths of, 3. 127. Neuroses of, 3. 59. Edema of, 3. 112. Paresthesia of, 3. 63. Paralysis and paresis of, 3. 78. Perichondritis and chondritis of, 3. 117. Spasm of, in children, 3. 70. Lead poisoning, chronic, v. 678. Lentigo, 4. 658. Leprosy, I. 785. Leptomeningitis, v. 716. Leptis, 4. 731. Lethargy, v. 384. Leukoderma, 3. 908. Leukemia, 4. 697. Lichen rubor and scrofulоsis, 4. 623, 624. Leuthemia, 2. 968. Liver, abscess of, 2. 1002. Acute yellow atrophy of, 2. 1023. Amyloid, 2. 1040. Carcinoma of, 2. 1033. Cirrhosis of, 2. 990. Diseases of, 2. 965. Fatty degeneration of, 2. 1046. Flukes, 2. 1109. Hyperemia of, 2. 982. Parasites of, 2. 1101. In phosphorus poisoning, 2. 1030. Localization of lesions in the nervous system, v. 65. Lung, abscess of, 3. 296. Brown induration of, 3. 256. Cancer of, 3. 460. Cirrhosis of, 3. 440. Collapse of, 3. 251. Congestion and edema of, 3. 258. Gangrene of, 3. 301. Syphilitic disease of, 3. 447. Lupus erythematosus, 4. 689. Vulgaris, 4. 693. Lymphangioma, 4. 689. Lymphangitis, simple, 3. 983. M. Macroglossia, 2. 349. Malarial fever, pernicious, I. 605. Malarial fevers, I. 589. Hematuria and hemoglobinuria, 4. 107. Malignant pustule, I. 926. Mania, v. 161. Mastoid disease, 4. 833. Measles, I. 557. Mediastinum, diseases of, 3. 861. Melena neonatorum, 2. 832. Melanemia, 3. 896. Melancholia, v. 155. Meniere's disease, 4. 839. Meningeal hemorrhage, cerebral, v. 710. Spinal, v. 754. Meningitis, cerebral, acute simple, v. 716. Chronic, v. 721. Tubercular, v. 723. In the adult, v. 737. Acute and chronic spinal, v. 749, 752. Menopause, functional disorders in connection with, 4. 432. Menorrhagia, 4. 200. Mental defects and degenerations, v. 138. Mental diseases, v. 99. Organic, v. 176. Mesenteric artery, inferior and superior, diseases of, 3. 836, 839. Metritis, acute, 4. 447. Chronic, 4. 450. Microcephalism, v. 138. Migraine, v. 406, 1216, 1230. Miliaria, or prickly heat, 4. 654. Milium, 4. 592. Mitral regurgitation, 3. 669. Stenosis, 3. 665. Molluscum epithelial or contagiosum, 4. 661. Fibrosum, 4. 686. Morbid growths, I, 105. Processes, general, I, 35. Morphia, 4. 672. Mosquitoes, 4. 733. Mouth, hemorrhage from, 2. 370. And tongue, diseases of, 2. 321. Mumps, I, 620. Muscular atrophy, progressive, 4. 540. System, diseases of, 4. 327. Myalgia, 4. 529. Myelitis, acute simple, v 810. Chronic, v 886. Myocarditis, acute and chronic, 3. 604, 607. Myoma, 4. 687. N. Nevus pigmentosus, 4. 666. Nail, atrophy of, 4. 683. Hypertrophy of, 4. 669. Nasal catarrh, chronic, 2. 42. Passages, diseases of, 3. 42. Morbid growths of, 3. 52. Nematodes or threadworms, 2. 949. Nephritis, acute diffuse, 4. 82. Acute parenchymatous, 4. 78. Chronic diffuse, 4. 84. Parenchymatous, 4. 80. Suppurative, 4. 99. Nerve, 5th, neuralgia of, v 1232. Nerves, affections of, in medical ophthalmology, 4. 771. Of second pair of, 4. 771. Of third pair of, 4. 780. Of fifth pair of, 4. 785. Of sixth pair of, 4. 789. Of seventh pair of, 4. 790. Peripheral, diseases of, v 1176. Injuries of, v 1182. Nervous system, diseases of, general principles of diagnosis of, v 59. General semiology of, v 19. Motory symptoms of, v 42. Psychic symptoms of, v 19. Sensory symptoms of, v 31. Trophic symptoms of, v 54. Neuralgia, v 1212. Of the fifth nerve, v 1232. Neurasthenia, v 353. Neuritis, v 1189. Multiple, v 1195. Neuroma, 4. 686. Neuromata, v 1208. Neuroses, trophic, v 1241, 1266. Vasomotor, v 1242. Night terrors, v 370. O. Edema, laryngeal, 3. 112. Esophagitis, acute and chronic, 2. 409, 416. Esophagus, diseases of, 2. 409. Estrus, 4. 732. Onychoxis, 4. 669. Oophorectomy, 4. 290. Opium habit, the, and kindred affections, v. 647. Ophthalmitis, febrile and postfebrile, 4. 761. Ophthalmology, medical, 4. 737. Optic nerve, affections of, 4. 771. Otology, medical, 4. 807. Ovarian cysts, extra dash, 4. 293. Ovarian tumors, 4. 297. Ovaries and oviducts, diseases of, 4. 282. Malformations of, 4. 282. Removal of both, 4. 237. Ovaritis, acute and chronic, 4. 283, 284. Ovariotomy, 4. 313. Ovary, cystic tumors of, 4. 301. Dermoid cysts of, 4. 299. Fibroid tumor of, 4. 297. Hernia of, 4. 289. Malignant disease of, 4. 298. Prolapse of, 4. 286. Oviducts, cysts of, 4. 295, 296. Oxyuris vermicularis, 2. 950. P. Pachymeningitis, acute spinal, v. 747. Chronic spinal, v. 748. External, v. 704. Hemorrhagic, v. 707. Internal, v. 706. Pancreas, degenerations of, 2. 1128. Diseases of, 2. 1113. Hemorrhage into, 2. 1129. Morbid growths of, 2. 1123. Pancreatic duct, obstruction of, 2. 1129. Pancreatitis, acute idiopathic, 2. 1118. Chronic interstitial, 2. 1121. Paralalia, v. 571. Paraldehyde, habitual addiction to, v. 666. Paralysis agitans, v. 433. Cerebral, v. 917. General, of the insane, v. 176. Infantile spinal, v. 1113. Pseudohypertrophic, 4. 557. Parametritis, 4. 209. Paradiphylitis, 2. 814. Paratitis, I. 620. Paravarium, cysts of, 4. 293. Pathology, general, I. 33. Pediculosis, 4. 728. Pelvic hematocele, 4. 239. Peritoneum and cellular tissue, inflammation of, 4. 208. Pemphigus, 4. 656. Perianal and perirectal abscesses, 2. 985. Pericarditis, 3. 769. Chronic, 3. 784. Tubercular, 3. 793. Pericardium, adherent, 3. 785. Diseases of, 3. 769. Pericardial effusions, operative treatment of, 3. 794. Perihepatitis, 2. 982. Perimetritis, 4. 227. Perinephritis, 4. 102. Perisplenitis, 3. 964. Peritoneum, hemorrhage into, 2. 1180. Peritonitis, acute, 2. 1133. Cancerous, 2. 1168. Chronic, 2. 1161. Local, 2. 1159. Infantile, 2. 1172. Tubercular, 2. 1165. Paratyphlitis, 2. 814. Pertussis, I, 836. Pharyngitis, acute, tubercular, chronic, and syphilitic, 2. 390, 400, 402, 406. Pharynx, diseases of, 2. 390. Phlebitis, 3. 843. Phleboliths, 3. 853. Phlegmasia dolens, 3. 843. Phosphohidrosis, 4. 585. Phthisis, fibroid, 3. 440. Pulmonary, 3. 391. Pia mater, cerebral, congestion of, v. 715. Piles, 2. 882. Pityriasis, 4. 621, 622. Plague, the, I, 771. Plethora, 3. 886. Pleura, diseases of, 3. 483. Pleural cavity, growths in, 3. 583. Pleurisy, 3. 483. Diaphragmatic, 3. 568. Double, 3. 562. Hemorrhagic, 3. 565. Multilocular, interlobular, mediastinal, and rheumatic, 3. 564. Purulent, 3. 539. Tubercular, 3. 569. Pneumonia, catarrhal, 3. 353. Crupus, 3. 307. Hypostatic, 3. 258. Interstitial, 3. 440. Pneumohydropericardium, 3. 791. Pneumonoconiosis, 3. 454. Pneumopericardium, 3. 790. Pneumothorax, 3. 573. Polyneuritis, v. 1195. Polyuria or diabetes insipidus, 4. 27. Pomphalix, 4. 655. Portal vein, diseases of, 2. 1095. Pregnancy, disorders of, 4. 405. Prickly heat, 4. 654. Proctitis, 2. 887. Prognosis, general, I. 167. Progressive muscular atrophy, 4. 540. Prurigo, 4. 639. Pruritus, 4. 711. Ani, 2. 909. Vulvi, 4. 362. Pseudohypertrophic paralysis, 4. 551. Membranous enteritis, 2. 763. Laryngitis, 3. 100. Psoriasis, 4. 614. Psychoneuroses, v. 153. Pudendal hernia, 4. 398. Puerperal fever, I. 984. Tetanus, v. 562. Pulex irritans, 4. 733. Penetrans, 4. 732. Pulmonary apoplexy, 3. 293. Artery, diseases of, 3. 863. Embolism, 3. 373. Hydatids, 3. 466. Obstruction, 3. 675. Phthisis, 3. 391. Regurgitation, 3. 676. Purpura, 2. 186. Pyemia and septicemia, I, 945. Pyelitis, calculus and secondary, 4. 47, 53. Pyelonephritis, suppurative, 4. 99. Pylophlebitis, suppurative, 2. 1097. Pylorus, hypertrophic stenosis of, 2. 615. Pyopericardium, 3. 790. R. Rabies and hydrophobia, I, 886. Rachitis, 2. 137. Rectal alimentación, 2. 928. Pouches, dilatation of, 2. 885. Rectum, abscess about, 2. 895. Effect of certain poisons and remedies on, 2. 911. Hemorrhage from, 2. 890. Inflammation of, 2. 887. Neuralgia of, 2. 909. Non-malignant stricture of, 2. 885. Obstruction of, 2. 889. Polypi of, 2. 882. Rodent and lupoid ulcer of, 2. 889. Rectum and anus, cancer and malignant stricture and ulceration of, 2. 902. Diseases of, 2. 877. Prolapse of, 2. 881. Scrofulous and tubercular affections of, 2. 901. Spasm of, 2. 909. Syphilis of, 2. 900. Ulceration of, 2. 893, 894. Relapsing fever, I, 369. Remittent fever, I, 598. Renal calculus, 4. 42. Colic, 4. 42. Raynaud's disease, v. 1257. Rheumatism, acute articular, 2. 19. Chronic articular, 2. 46. Subacute articular, 2. 69. Gonorrheal, 2. 102. Muscular, 2. 74. Rheumatoid arthritis, 2. 78. Rhinoscopy and laryngoscopy, 3. 19. Ringworm, 4. 717. Rothelm, I, 582. Round ligament, solid tumor of, 4. 296. Rubeola, I, 557. S. Sanitary science, I, 173. Sarcoma, 4. 710. Scabies, 4. 726. Scarlet fever, I, 486. Sclerema neonatorum, 4. 671. Scleroderma, 4. 671. Sclerosis of the spinal cord, secondary, v. 892. Sclerosis of the spinal cord, amyotrophic lateral, v. 867. Combined forms of V 869. Diffuse V 886. Disseminated V 873. Posterior V 826. Scrofula 2. 231. Scrofuloderma 4. 698. Scurvy 2. 167. Seborrhea 4. 586. Semiology, General, of Diseases of the Nervous System, v. 19. Seminal Incontinence, 4. 137. Septicemia and pyemia, I. 945. Sewerage and drainage in their hygienic relations, I. 213. Simple continued fever, I. 231. Skin, atrophies of, 4. 676. Diseases of, 4. 581. Hypertrophies of, 4. 658. Inflammations of, 4. 593. Neuroses of, 4. 711. New growths of, 4. 685. Parasites of, 4. 715. Secretions, disorders of, 4. 583. Sleep and its disorders, v. 363. Smallpox, I. 434. Somnambulism, v. 371. Speech, disorders of, v. 566. Spina bifida, v. 757. Spinal cord, chronic inflammation and degenerative affections of, v. 825. Disease of one lateral half of, v. 1165. Diseases of membranes of, v. 746. Embolism, thrombosis, hemorrhage, and abscess of, v. 808. Hyperemia and anemia, v. 763. Membranes, congestion of, v. 746. Meningeal hemorrhage, v. 754. Meningitis, acute and chronic, v. 749, 752. Paralysis, spastic, v. 801. Sclerosis, v. 826, 867, 869, 873, 886, 892. Syphilis, v. 1022. Spine, concussion of, v. 912. Spleen, diseases of, 3. 962. Splenitis, 3. 962. Stammering and stuttering, v. 571. Steatoma, 4. 592. Stomach, anomalies in form and position of, 2. 617. Atrophy of, 2. 616. Cancer of, 2. 530. Cirrhosis of, 2. 611. Dilatation of, 2. 586, 610. Functional and inflammatory diseases of, 2. 436. Hemorrhage from, 2. 580. Minor organic affections of, 2. 611. Non-cancerous tumors of, 2. 578. Rupture of, 2. 618. Simple ulcer of, 2. 480. Ulcers of, other than simple, 2. 529. Stomatitis, 2. 321 to 348. Stomatorrhagia, 2. 370. Sudamen, 4. 586. Suprarenal bodies, diseases of, 3. 939, 949. Psychosis, 4. 649. Parasitica, 4. 723. Sympathetic nerve, cervical, diseases of, v. 1263. Symptomatology, general, I. 148. Syphilis cutanea, 4. 699. Hereditary, 2. 254. Syphilitic affections of the nerve centers, v. 999. Syphiloderma, 4. 699. T. Tabes dorsalis, v. 826. The family form of, v. 870. Tabes mesenterica, 2. 1182. Tapeworm, 2. 931. Tetanus, v. 544. Neonatorum, v. 563. Puerperal, v. 562. Thermic fever, v. 388. Thomson's disease, v. 461. Thoracentesis, history of, 3. 586. Thornhead worms, 2. 949. Thread worms, 2. 949. Thrombosis, cardiac, 3. 718. An embolism, I. 56. Of the cerebral veins and sinuses, v. 982. Thrush, 2. 331. Thyroid gland, diseases of, 3. 974. Tinea favosa, 4. 715. Psychosis, 4. 723. Versicolor, 4. 724. Tongue, hypertrophy of, 2. 399. Inflammation of, 2. 354 to 368. Malignant pustule of, 2. 368. Ulceration of, 2. 369. Vices and abnormalities of, 2. 348. And mouth, diseases of, 2. 321. Tongue-tie, 2. 349. Tonsils, diseases of, 2. 379. Torticollis, v. 463. Trachea, diseases of, 3. 133. Tracheitis, simple and complicated, 3. 133, 136. Tracheotomy, 3. 144. Trematodes or flukeworms, 2. 946. Tremor, v. 429. Trichinosis, 2. 957. Tricuspid regurgitation, 3. 677. Stenosis, 3. 671. Trophic neuroses, v. 1242, 1266. Tuberculosis, I. 94. Acute miliary, 3. 472. Tumors of the brain and its envelopes, v. 1028. Of the spinal cord and its envelopes, v. 1090. Typhlitis, paratyphlitis, and paratyphlitis, 2. 814. Typhoid fever, I. 237. Typhomalarial fever, I. 614. Typhus fever, I. 338. Ureters, diseases of, 4. 67. Urethra, dilatation of, in women, 4. 355. Dislocations of, in women, 4. 361. Prolapse of, in women, 4. 362. Stricture of, in women, 4. 363. Urethral, caruncle, 4. 403. Glands, in women, inflammation of, 4. 354. Urethritis in women, 4. 353, 355. Uridrosis, 4. 588. Urinary organs of women, diseases of, 4. 339. Urticaria, 4. 597. Uterine functions, disorders of, 4. 182. Uterus, cancer of, 4. 274. Diseases of parenchyma of, 4. 447. Displacements of, 4. 147. Fibrous tumors of, 4. 245. Sarcoma of, 4. 271. V. Vaccinia, I. 455. Vaccination, I. 465. Vagina, atresia and prolapse of, 4. 376. Cicatrices of, 4. 380. Diseases of, 4. 367. Double, 4. 381. Growths of, 4. 382. Vaginal cystocele, 4. 377. Rectocele and enterocele, 4. 378. Vaginismus, 4. 384. Vaginitis, 4. 368. Varicella, I. 481. Variola, I. 434. Varioloid, I. 443. Vasomotor neuroses, v. 1242. Veins, diseases of, 3. 843. Verruca, 4. 664. Vertigo, v. 416. Vitiligo, 4. 677. Vocal cords, paralysis of, 3. 85, 86. Vulva, atresia of, 4. 373. Diseases of, 4. 388. Vulvitis, 4. 389. Vulvovaginal glands, cysts, and inflammation of, 4. 396. W. Warts, 4. 664. Whooping cough, I. 836. Wood ticks, 4. 733. Worms, intestinal, 2. 930. Writers and artisans, neural disorders of, v. 504. Wryneck, v. 463. X. Xanthoma, 4. 687. Y. Yellow fever, I. 640. End of Volume V.